Hello guys, how are you all? A very good morning to all of you. Good morning all of you. Good morning Srinivas, Vancomycin, Rahul, Amir, Osama Sheikh. How are you Osama? Meeting all of you after a long time. Naimat. Good morning all of you. Dr. World, don't worry, I'll take care of it. Mirza, good morning. Elon Musk has also joined. Very good. I'm really happy. Sheikh, good morning. Right. So, how are you all guys doing? You guys woke up in the morning just to attend the live class, or you usually get up in the morning at this time? How many of you are writing FMGe this time from this chat list? Whoever has attended? Yeah. Is anyone giving? Okay, you're giving FMGe. Very good. Very good. Very good. Right. Right. Lotlo, fine. How are you? Chalo. Let's not take a lot of time over here. Let us start straight to the point. So, I'm going to teach you the entire anatomy right now. Okay. Yeah, yes. I'm going to tell about the today's topics, creative. So, the few common questions which I get all the time when I come to the live is, the first most important question which I get is, how long will be the live session? So, nothing to worry guys, I am the one who is shouting here, right? Even if it is 4 hours, 5 hours or 6 hours, how many hours it might be, I am the one who is shouting. So, you just have to just sit back, relax and just watch, right? So, I will maintain the same energy till the end. So, what we will do is that, we have completely updated some of the important points, some of the important topics compared to the previous live session. Previous FMGe live session, if you see there, right, the image based questions which I have discussed there and the matter which I have discussed in the previous sessions, out of that 8 questions got repeated. Even if you want, you can see in the comment box also. Students were telling 7 to 8 questions were repeated, and yeah, not exactly 8, actually 9 questions are repeated there, right? So I even kept the screenshots as well. So this is a little bit updated version of the previous lectures which I have taught. Okay, so what we shall do is that we shall cover up the anatomy as fast as possible, right? Clearly, detailedly, as simple as possible, so that 70% I want you to learn within the class along with me itself. Okay, the remaining 30% later on you can revise, before the exam and go on. And immediately after the class I'll post the PDF. Okay, within 1-2 hours I'll post the PDF within the Telegram group, so you can study that PDF also. So if you are all okay with that, shall I start? Yes or no? Shall we start guys? Yeah. Chalo. Let's start now. Now I don't want anyone to make any kind of notes. Okay, just open your screens, just watch whatever I'm teaching you. Okay, so there is no time to draw all of these things. Again, if you miss the continuity, that will be a greater problem. Again, we have to extend the session here. Okay, so whatever it is, the target which I have kept over here is 5 to 6 hours, right? But 5 to 6 hours will be worthy, I'm telling you. I'm going to discuss each and every topic in detail. Okay, so let us first start from the upper limb. Okay, now I don't want anyone to comment here, just look whatever I'm teaching. Let us start from the upper limb. Now what you can see in the screen, in this picture over here guys, so here you can see few important things. For example, if you see here, the layers which are formed are mainly from the ectoderm, the structures which are formed from the ectoderm, mesoderm and endoderm. Okay, now here you have got your neural tube, this is your notochord. Okay, as you can see, there are 3 different colors. Yellow in the center, right? On either sides you have got blue, here you have got blue and you have got red over here. What are these centers? The centers which are located completely peripheral, right? These are called as lateral plate mesodome. What is this? Lateral plate mesodome. Lateral plate, just inside to this lateral plate mesodome, this red color thing you see, that is called as intermediate mesodome. Okay, what is that called? Intermediate mesoderm. And for example, guys, if I'm drawing a center line like this, this is called as an axis. Axis ke dono taraf, right? On either side of the axis, you have got this yellow color one. So can I call it paraaxial? Yes or no? I am calling it as paraaxial mesoderm. So what is my main concept to discuss here is that what is developing from lateral plate mesoderm, what is developing from intermediate as well as paraaxial mesoderm. This is the question which will be asked. You have to remember it. Okay. So all of you just pay attention. Now, all of you just look here. Paraaxial mesoderm. Paraaxial mesoderm will develop into what? Paraaxial mesoderm will develop into your skeletal muscles. It will develop into your skeletal muscles. Now, we are right now discussing the topic of upper limb. Yes or no? So, your upper limb and lower limb, both of them will develop from which one? Any guess, guys? Lateral plate or intermediate? Very good. So, this upper limb as well as lower limb, both of them are developing from lateral plate mesoderm. Whereas, intermediate mesoderm जो है, intermediate in the sense things which are located in the center. What is the thing that is located in the center? Your genitourinary system. So your genitourinary system is located in the intermediate mesoderm. Okay. So guys, I want you to remember these three MCQs at any cost. Okay, so paraaxial develops into skeletal muscles, lateral plate mesoderm develop into upper lower limb, and intermediate mesoderm will develop into your genitourinary system. Okay, अब ये देखो और एक question, upper limb, when does the development of upper limb will start? In the beginning of 4th week or end of the 4th week? Don't confuse. Upper limb development starts from the end of your 4th week. Okay, it starts from your end of your 4th week. Now, end of your 4th week is the beginning of the 5th week, right? So, lower limb development starts from the beginning of 5th week. Beginning of 5th week. Beginning of 5th week. Okay, right. Now, this is just out of the concept in the sense I have to discuss this in the cardiology part, I mean the thorax part, but I am discussing it here. When do you listen to the first heartbeat sound? You listen it in the 4th week. Keep this thing in mind. You listen to the first heartbeat in the 4th week. And how are you going to listen it in the 4th week? Through the transvaginal ultrasound. Transvaginal ultrasound. Guys, still here, all of you are clear? Can I move to the next slide? Yes or no? Be fast. Be very fast. And I think I should not use green, I think, right? So green is not that visible here. Yeah. Right. Rafiullah, after the session, message me so that I'll send you the entire this one playlist. Okay. Chalo, if you are clear, let us start the next most important and guys, I expect at least one question from this part. Okay. From this part. Okay. Because these are 2 or 3 times they have asked from this part, so I want you to remember it at any cost, right? Chalo. So all of you look here now. The next important thing we shall be discussing is regarding your clavicle, and actually which question will be asked from the clavicle I will tell you, but I've just kept it here safe side. Okay. So first important thing is it is a horizontally placed bone. Okay. The second important thing which you have to remember at any cost is clavicle is the first bone to ossify in your entire body. Ossification मतलब ये first bone है जो thair होगा. Okay. So when is it forming? It is forming during 5th to 6th week of your intrauterine life. 5th to 6th week of your intrauterine life. That is the time when your clavicle starts forming. Okay. And this one, every one of you know that the most common bone that is fractured in your body is your clavicle. Where it is fractured, all of you just comment here where it is fractured. In the meanwhile, I'll be teaching the remaining points. So you know that clavicle is the only one which transmits the weight of entire upper limb onto your axial skeleton. Agar clavicle nahi hai, so your entire upper limb weight, do you think it is transmitted to the axial skeleton? No. Okay, so these were previously asked one word questions. Okay, subcutaneous throughout, इसके अंदर कोई medullary cavity नहीं है. These are all one word questions which I want you to remember. Okay, right. Now, very good Amar Qureshi, very good Brijesh, perfect. See guys, most of you are telling, right, very good that you are telling the right answer, but most of you, I'm telling you, those are not commenting, right, you don't think that it is medial 2/3, lateral 1/3 or medial 1/3, lateral 2/3, no. So most common site of clavicular fracture is medial 3/5 and the junction between medial 3/5 as well as lateral 2/5. Junction between medial 3/5 and lateral 2/5. Okay? So all of you just look at the screenshot which I have put over here. Clavicle is usually fractured at the junction of lateral 2/5 and medial 3/5. Okay, this is a screenshot that I have taken from the Gray's Anatomy student edition. Okay, so in that they have updated this, and I want all of you to keep this thing in mind. The most common site of clavicular fracture is medial 3/5 as well as lateral 2/5. Okay, so if they give you an X-ray also in orthopedics, you have to answer it. Okay, अगर X-ray भी दे दिया, you have to know that this is 3/5. ठीक है, और ये छोटा सा पार्ट क्या होगा, ये होगा 2/5. Medial 3/5 as well as lateral 2/5. Okay, so I hope I'm not going fast. Even if I'm going fast, I won't go super fast because I have to go fast because you have an exam. Okay, we have to complete the anatomy as soon as possible. Okay, so I want, don't write anything. That's why I'm telling you, just concentrate, just sit back and relax and watch. Okay, chalo guys, anyone can anyone tell what is this condition called? In this condition, you know, pata kya hua? Clavicles are absent. Both the clavicles are absent. Now when both the clavicles are absent, what has happened? यहाँ पे नीचे क्या है? Pectoralis muscles है, pectoralis major. Clavicle is absent. Clavicle is the one which is putting your shoulders apart. Pectoralis muscle क्या करेगा? It will pull this shoulder like this. It will pull this shoulder like this. So both the shoulder tips touch together. Very good, Sheikh Osama. Wonderful. So the answer over here, this condition you call it as cleidocranial dysplasia or cleidocranial dysostosis or cleidocranial dysplasia. They can ask you in an image based question. I want you to remember this. Okay? Cleidocranial dysplasia or cleidocranial dysostosis. Very good. Now, second important thing which you need to know. What is the second important thing? Second important thing over here is that, guys, don't write, just sit back here, just look at whatever I'm teaching you. What is this B over here? What is this B? B is joining your coracoid process to clavicle. तो क्या बोल सकता हूं मैं इसको? Coracoclavicular ligament. See, B is what? B is your coracoclavicular ligament. Next, what is A? A is attaching clavicle to the rib. Rib is called costa. So what I have to call it as? Costoclavicular ligament. What is this? Why am I telling you this is that this is very important. The entire weight of your upper limb, first with the help of this coracoclavicular ligament, it is impinging upon the clavicle. The weight of your entire clavicle is impinging upon your axial skeleton with the help of costoclavicular ligament. फिर से बोल रहा हूं, सुनो. The entire weight of your upper limb, right, is impinged upon clavicle first. Okay, through which ligament? By coracoclavicular ligament. From the clavicle, the weight is impinged upon your axial skeleton with the help of costoclavicular ligament. Clear, all of you? This was a question asked previously, इसीलिए I'm stressing it. You see here, weight of upper limb is transmitted to the axial skeleton by, first of all answer this, weight of upper limb is transmitted to the clavicle by, बताओ, weight of upper limb is transmitted to the clavicle with the help of B. What is B over here? B over here is called as coracoclavicular ligament. Coracoclavicular ligament. Okay. Next, clavicle say axial skeleton. So from here it came to the clavicle. From the clavicle to the axial skeleton, the weight has to be transmitted with the help of which ligament? Costoclavicular ligament. What is that? Costoclavicular ligament. Costoclavicular ligament. These are the two most important MCQs which I want you to remember. Everyone is answering well, I'm telling you. Excellent, guys. Excellent. Right. Now, there was once a question asked, what are the list of ligaments you have near the shoulder joint? So, all of you remember the mnemonics CGC. Okay, C, G and C. Let us look at the list of ligaments over here. All of you look here. The first important thing, see, this is the glenoid cavity और ये humerus है और दोनों के बीच में जो ligament है, what is that called as glenohumeral ligament. Second important one, this is the coracoid process और this is the humerus. Coracoid process और humerus के बीच में क्या है, coracohumeral ligament. ठीक है. And third important ligament, what is that third important ligament? That is your, what is that? Coracoclavicular ligament. This is your coracoclavicular ligament. So these are the three important ligaments that are present near your shoulder joint. So again I am telling you CGC. What do you mean by C over here? C stands for coracoclavicular ligament. Coracoclavicular ligament. ठीक है. G stands for what? Glenohumeral ligament. Glenohumeral ligament. ठीक है. And next important thing is what? C stands for coracohumeral ligament. Coracohumeral ligament. What instead of remembering like this, what I suggest you is just look at the picture and then answer. Okay, so वो easy होगा exam में. If you can imagine and answer, then that is the best thing which you will do. Okay, so I hope till here you are clear, right? So we have covered so far few important MCQs in these 7 pages, right? So till here all of you are clear. Before I move on to the next part, yes or no? जल्दी बताओ फटाफट. Tell me fast. Yes or no? Rahul, Sheikh Osama, Doc, Amit Gupta, right? Amir Qureshi, vancomycin, Medexam, Elon Musk, Bridges, all of you are clear, right? Very good. Chalo, now the next important thing we shall be discussing is scapula. Sir, scapula mein what do they ask? Before whatever they ask in scapula, you have to know scapula, what are the things that are located here? ये देखो, ये होगा superior angle, ये होगा inferior angle. This is your medial border, this is your lateral border. Are they going to ask this? No. What they will ask you? They will ask you what is the thickest border of scapula. You have to tell lateral border is the thickest border of scapula. Okay, this is first MCQ. Lateral border is the thickest border of scapula. Second important thing they can ask you is what is the topography of scapula. You have to tell scapula, the tip of the scapula over here, the top of the scapula, tip notch starts all the way from T2, right? Very good, mid exam, perfect. Start all the way from T2 all the way till T7 posterior ribs. Okay, now this was a question that was asked previously, but now they have updated a question telling that ye kya hai guys, what is this? This is called as your spine of the scapula. Yes or no? So they will ask you where is spine of the scapula present? That is present at the level of T3. All of you are clear with this? So scapula ranges all the way from T2 to T7 posterior ribs, and spine of the scapula is present at the level of T3. All of you remember this. This is the spine that they are asking, spine of your scapula. And the thickest border of scapula is the lateral border. And guys, here itself I just want to tell you one more MCQ also. If they ask you where is the head of the scapula, where is the head of the scapula? Okay, so you cannot determine the head over here, but I am telling you lateral border is called as the head of the scapula. This is another MCQ. It was asked only once. Just keep it in mind. Lateral border of scapula is the head of the scapula. Okay, right. So just write this thing down here, guys. So scapula extends all the way from T2 to T7 posterior ribs. Whereas your spine of the scapula is present at the level of T3. Okay, T3. Right. Guys, can anyone look at this condition? Very good, Kefin. Very good. Dr. World, question to all of you. Bridges, Dr. World, vancomycin, all of you. Saiful Islam, all of you. Just question to all of you. बताओ ये कौन सा condition है in which you know, you have got a pushpa style over here. What is this? One scapula is on the top, one scapula is on a normal location. Okay, so what is this? What is this? Don't tell it is a pushpa deformity. Tell it as what? Very good. It is Sprengel deformity. This is Sprengel deformity. Okay, Sprengel deformity. Okay, Sprengel deformity. You're right. झुकेगा नहीं साला. चलो, Sprengel deformity. Now, in this Sprengel deformity, they can also give you another important thing. Instead of giving Sprengel deformity, in the options they will give you congenitally high scapula. That is also the right answer. Okay, that is also the right answer. Right. So till here, I hope all of you understood. So this is the deformity over here, and this is normal. Okay. Right. So guys, till here, whatever I have discussed, previous year one question was asked. Right, one question was asked. But now 100% I'm telling you, 100, yes, very good Islam. It is called congenitally high scapula also. Guys, 100% I'm telling you, one question you are going to get from humerus. Either they are going to ask you the muscles or they are going to ask you the nerve injuries. Okay, nerve injuries of your upper limb, pakka one question every year it is repeated. Okay, so now pay attention to whatever I'm teaching you. Okay, so all of you just look here. Yes, sweetie. Yes, yes. So all of you just look over here. Coming to the humerus. In this humerus, you have got the greater tuberosity, lesser tuberosity, and all of this. Okay. Greater tuberosity ke niche, what do you have? You have got the lateral lip. And lesser tuberosity ke niche, what do you have? You have got the medial lip. Okay. What is my main concern is that they are going to ask you which muscle is attached to medial lip, which muscle is attached to lateral lip, and which muscle is attached to your bicipital groove. Guys, to remember this question, just remember one mnemonic, that is MET, MET. Okay? MET क्या होगा? ME. ME stands for medial lip. Okay? ME stands for medial lip. Medial lip को कौन सा मसल अटैच होगा? T. T stands for what? Teres major. Teres major. ठीक है? So two muscles are there. एक होगा teres major और दूसरा होगा pectoralis major. So on the opposite side you have got pectoralis major. Pectoralis major. ठीक है? Most of you will confuse teres यहाँ पे और pectoralis वहां पे. No. Just keep this mnemonic in mind. MET, you will not miss a question. Okay. और bicipital groove में क्या है? Bicipital groove is having latissimus dorsi. Simply I'm writing it as LADS. Okay. Simply I'm writing it as LADS over here. Okay. Chalo. Now the next important thing which you need to know is, how do you remember this? A lady between two majors. Two majors क्या है? एक pectoralis major, एक teres major. और बीच में lady क्या है? Lady is latissimus dorsi. If you remember this, if they ask you question from this, a confusing question, definitely you should be able to answer. Is it clear to everyone? Yes or no? अच्छा ये देखो, they asked a question already. Which muscle is inserted to the floor of intertubercular sulcus? पता है intertubercular sulcus का दूसरा नाम क्या है? What is that? Bicipital groove. Bicipital groove. Answer बताओ जल्दी फटाफट. What is that? A, B, C, D. Very good. That is latissimus dorsi. Okay. These are some of the simple questions that they are asking you guys. So I want you to just pay attention to these questions. Okay. Chalo. Now we are entering into the main important part. I'm going to tell you, Dr. World. Yeah. So coming to the injuries, guys, stop commenting. Just look at whatever I'm teaching you. See, whatever injuries of the upper limb, ठीक है, fractures जो भी होगा ना upper limb में in the humerus, all these are a result of push injuries. All these are a result of push. Push मतलब क्या? Fall on outstretched hand. What is this? Fall on outstretched hand. ठीक है? So all of you know this thing that ये होगा anatomical neck और ये होगा surgical neck. Most common fractures कहाँ पे होगा? Most common fractures you see in the surgical neck. Okay? चलो देखते हैं अभी what are the fractures that you see over here. First important thing, if surgical neck fracture will happen, listen carefully. If surgical neck fracture will happen, what is the artery that is ruptured? is your axillary artery. What is that? Axillary artery. Axillary artery का दो branches है. There are two branches of axillary artery. ये देखो, one branch coming from the front making a circle called as anterior circumflex. One branch from the back, it is making a circle called as posterior circumflex. So what are they? One is called anterior circumflex artery, humeral artery, posterior circumflex humeral artery. HA मतलब humeral artery. Okay? चलो ठीक है. Along with this axillary artery, can anyone tell which nerve is damaged? जल्दी बताओ. Very very easy. Very good. Very good. Very good. Safikul. Very good. That is your axillary nerve. That is your axillary nerve. Okay? Chalo. Next important thing is that, guys, this humerus which I have kept over here, ये anterior weave है. ठीक है? Anterior weave. Why am I calling it as anterior weave? ये देखो. From here there is a nerve that is coming. There is a nerve that is coming. This nerve is not passing from the front. Rather, this nerve is passing from the back. In which groove it is passing? It is passing through the radial groove. इसीलिए I have drawn it in the form of a dotted line. ठीक है? और ये nerve का नाम होगा radial nerve. What is this nerve? Radial nerve. So, अगर यहाँ पे fracture हुआ, for example, if the fracture has happened in the mid shaft of the humerus, so mid shaft fracture will lead to which nerve palsy, which nerve injury? That is your radial nerve injury. Okay. Next important thing is that all of you know we have got medial epicondyle, we have got lateral epicondyle. Guys, put all of your hands like this and you can palpate a medial epicondyle over here. Yes or no? And have you anytime observed whenever you hit the table or hit the gate or door, whatever it is, you might get an electric shock here. Why? क्योंकि medial epicondyle के पीछे, back of that, you have got a nerve. What is that nerve called as? Come on. Very good. That nerve is called as your ulnar nerve. Perfect. Very good, guys. Ulnar nerve. So can I tell, अगर medial epicondyle fracture हुआ, then which nerve will be damaged? Ulnar nerve will be damaged. And lastly we were discussing like this. अभी ये देखो, this yellow color highlight which I have given you over here, ठीक है? This area is called as supracondylar, क्योंकि medial epicondyle, lateral epicondyle के ऊपर है ना, so you called as supracondylar region. Supracondylar region में you have got two important things. This green color one which is running down is called as median nerve, and this red color one which is running down is called as brachial artery. फिर से बताओ, what are these two important things? एक हो गया median nerve, another one is called as brachial artery. Brachial artery, okay? Brachial artery as well as median nerve. Brachial artery as well as median nerve. So can I tell like this that अगर supracondylar fracture हुआ, then what is the artery that is ruptured if they ask? That is one MCQ. What is the nerve that is injured if they ask also? You have to know the MCQ. Okay? Sir, what will happen when axillary nerve is injured, radial nerve is injured, ulnar nerve is injured? I will discuss it in a minute. Okay? But from here, guys, from these nerve injuries, फिर से बोल रहा हूँ, if someone have joined right now, I'm telling you again, nerve injury से पक्का एक question आएगा. 1 or 2 questions, 100% it will come. So till here, I hope all of you are clear. Yes or no? Can I move to the next part, guys? जल्दी बताओ. Is everyone clear till here? Very good. Very good. Chalo. Now, first let us discuss what happens when axillary nerve is injured. First of all, you have to know this thing. Agar axillary nerve damage हुआ, what are the two muscles that are affected? One is your deltoid muscle and दूसरा क्या है? Teres minor muscle. Deltoid and teres minor. Sir, how do you remember? Remember it by mnemonic date. ठीक है? ये देखो D हो गया, A हो गया, T और E, D-A-T, date, which you all have gone when you are back in abroad, है ना? अब तो पुराने दिन याद आ रहे होंगे, हाँ? But you have to sacrifice yourself right now, ठीक है? Girlfriend, willfriend, Russian, vision, सब छोड़ दो अभी. Right now, just concentrate here. So, DATE will give you an idea of about axillary nerve and what muscles are injured. ठीक है, fine. For example, if deltoid is injured, what will happen? If deltoid is injured, this muscle is not working. If this muscle is not working, it will undergo atrophy. Atrophy matlab kya? You won't find any muscle over here, right? So if you see, you can see this particular shoulder, और ये shoulder का नाम हो गया flat shoulder. What is this? Flat shoulder, right? Flat. Really, you guys are very good. Okay, कोई date पे नहीं गया. Very good. I'm happy for that. Right. So this is called as your flat shoulder. What happens here is that, see, all of you look here now. Next important thing that will happen when axillary nerve is injured is that exactly at this region there are no sensations left. अगर यहाँ पे sensation नहीं है, this is the place where you keep the regimental badge. Okay, so exactly at that place you won't have any kind of sensation. So that is why you call this area as regimental badge anesthesia. Regimental anesthesia or regimental badge anesthesia. Regimental badge anesthesia. Why? Because you have a loss of sensation. You have a loss of sensation. Loss of sensation, regimental badge anesthesia. Guys, अभी डेट वीट ये सब छोड़ के वापस आ जाओ, ठीक है? I will come back to that. We will discuss in detail. I will tell you how to date, how not to date, everything I'll tell you. अब पहले anatomy discuss करेंगे, ठीक है? Right now we'll discuss about anatomy right now over here. Okay, chalo. So once again, guys, what are the muscles that are injured in case of axillary nerve injury? Remember the mnemonic DATE. D stands for deltoid, T stands for teres minor. What are the two important clinical manifestations you see? एक हो गया flat shoulder और दूसरा हो गया you won't have any sensation here. This is called as regimental badge anesthesia. This is what I want you to remember. Now a small test for you which will be asked in orthopedics. ठीक है? Orthopedic का few questions we shall discuss right now. What is that is I will show you an X-ray. You will tell me which nerve is injured over here. ठीक है? Will everyone do that? अब ये बताओ. Look at this X-ray and tell which nerve is injured. I want very fast answers. We don't have time. जल्दी बताओ. Look at this X-ray and tell which nerve is injured. First of all, ये बताओ fracture कौन सा है यहाँ पे? Very good. This is a surgical neck fracture. Perfect. Surgical neck fracture, and the nerve that is injured, that might be injured over here is axillary nerve. अगर artery पूछा गया तो axillary artery. Look at this X-ray, guys. This is also the same X-ray. Okay, this is also the same X-ray over here, right? Next important thing, who will answer this? Which nerve is injured in this particular fracture? Jaldi batao. This one, ye wala. What is this? Perfect, very good. So this is a mid shaft fracture of your humerus. और यहाँ पे कौन सा nerve injury हुआ होगा? Very good. There might be radial nerve injury. Might be. ठीक है? Might be radial nerve injury. Now they are going to ask you this. What is this fracture called? बताओ. Actually, this is a picture that is taken from the side of the elbow. Side of the elbow, you can see humerus, you can see the radius, you can see the ulna over here. Okay? तो fracture यहाँ पे हुआ. यहाँ पे मतलब क्या? No, not Colles. यहाँ पे हुआ. What is this? Mantis. Perfect. Very good. That is your supracondylar fracture. Very good. Supracondylar fracture. Okay? Right. If I ask you what artery that is injured in supracondylar fracture, batao. Which artery will you tell? Very fast. Very good. Very good. Very good. Brachial artery. Perfect. Very good. Brachial artery. See, again, this is also the same. This is also supracondylar fracture. और ये फ्रैक्चर कौन सा होगा? दिस इज योर मिड शाफ्ट फ्रैक्चर. ठीक है? आई एम जस्ट राइटिंग द नेम्स ऑफ द फ्रैक्चर्स बिकॉज यू नो व्हाट नर्व इज इंजर्ड बिहाइंड दैट. ठीक है? और यहां पे अब बताओ कौन बताएगा? हु विल टेल दैट व्हाट इज दिस फ्रैक्चर ओवर हियर? दिस वन. फास्ट. व्हाट इज दिस फ्रैक्चर? जल्दी बताओ. कैफिन, मैंटिस, Sneha and Shilpa, very good, both of them. Medial epicondyle fracture. Can you see a small bone that has been broken out and displaced here, right? और ये हो गया तुम्हारा मीडियल एपिकॉन्डाइल. व्हाट इज दिस? दिस इज योर medial epicondyle. Okay, so medial epicondyle fracture, which nerve over here guys? Ulnar nerve. This is your ulnar nerve. Okay, ulnar nerve. और ये फिर से again this is mid shaft fracture. Guys, mid shaft fracture is very important, medial epicondylar fracture is very important, and supracondylar fracture is very important. Okay, right. Next important thing over here is that whenever you have a supracondylar fracture, okay, for example, मान लो I fell from a bike, right? I had a push injury and I had my supracondylar fracture happen. And remember one thing, supracondylar fracture will most commonly happen in children. ठीक है? अगर supracondylar fracture हुआ, you went near a unpracticed doctor, whoever it might be, right? Who don't know what is orthopedics and all of these things. So उसने क्या किया? He has applied a cast, a very tight cast. So when he has applied very tight cast, because of compression, do you think your brachial artery will supply the remaining amount of blood to your forearm? No. Your brachial artery is not working. If your brachial artery is not working, don't you think all your muscles of the forearm are atrophied, right? So because this condition, you call it as tight cast syndrome or compartment syndrome. Okay, so what is happening? There is shortening of forearm muscles. Sneha and Shilpa, very good, very good. The answer is right. That is your Volkmann's contracture. This condition is called as Volkmann's contracture. Volkmann's contracture. Okay, so you basically call it as Volkmann's ischemic contracture. Why? Because there is ischemia, right? Thank you so much, Caroline. Right, so all of you just look at this hand. In orthopedics, if they give this picture and ask you, right, which fracture has happened to this patient, what will you tell? You have to tell it as supracondylar fracture of your humerus. Supracondylar fracture of your humerus. Okay, I'm not discussing regarding the Colles fracture and Smith fracture, guys. That would take up a lot of anatomy that you will be discussed in orthopedics anyways. Okay, but if you really want to know Colles and this one, there are my videos on YouTube. Upper limb part 1, right, where I'll be teaching all these fractures. Chalo, let us get to the most favorite thing and the most easiest thing to all of you. The first thing you have studied in your anatomy, that is your carpal bones. That is your carpal bones. Chalo, dekhte hain what are the questions that are asked. What are the questions that are asked from the carpal bones over here, right? So I'm not discussing the names of the carpal bones. All of you know that. Okay, she likes to play, try to catch, blah blah blah, and all, scaphoid, lunate, all these things you know already. I'm not taking your time over here, but you have to remember these one-word questions. Who will tell me this thing? Anyways, this is not from the carpal bones, but still I kept this. Thickest border of scapula. क्या होगा बताओ? Guys, if you can't see, I'll change the color over here. ठीक है, बताओ what is the thickest border of scapula? Lateral or medial? Very good, excellent. That is your lateral border. Very good, lateral border. Tell me what is the most common fractured carpal bone? Most common fractured carpal bone is your scaphoid. One word questions which you have to remember. Most common dislocated carpal bone is your lunate. Dislocated carpal bone is your lunate. Perfectly answering, everyone. Largest carpal bone, the largest is the head, right? The head of the family. Largest in the sense, head of the family. Head matlab kya? Capitate. Capitate. Okay. First carpal bone to ossify, that is capitate. Guys, first carpal bone to ossify, capitate hai, but tell me first bone to ossify in your entire body, batao. Shortest metacarpal is your first metacarpal. जल्दी बताओ. वेरी गुड प्रत्युषा, वेरी गुड लहरी, perfect, 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 perfect. Marinate, very good. Marinate, perfect. Clavicle is the first bone to ossify in your body at 5th to 6th week of intrauterine life. Guys, हमने यहाँ पे ये डिस्कस किया कि the most common fractured carpal bone is scaphoid. अगर scaphoid fracture हुआ, right? How do you feel? If a patient is having scaphoid fracture, how will you know? How will you know that? You know, all of you know that this is your anatomical snuff box. right? This is the place where you put the drug and snuff. That is why you call it as anatomical snuff box. Now this anatomical snuff box is soft, right? But agar fracture hua, this will be tender. This anatomical snuff box will be swollen and this will be tender. That is the first sign of scaphoid fracture. So agar scaphoid fracture hua, then you will see tenderness. What do you see? Tenderness in anatomical snuff box. Tenderness in anatomical snuff box. Clear all of you? Other tenderness in anatomical snuff box, so you have to get an X-ray. Which weave is the best weave to get an X-ray? Anteroposterior weave, posterior anterior weave, lateral weave or oblique weave? Oblique weave is the best weave. Oblique weave. Okay, so oblique weave X-ray is the best weave. So they might, in orthopedics, they might give you this question. Okay, they will give you this X-ray and they will ask you which weave has been taken in the given X-ray. First of all, you should know that this is an X-ray of scaphoid fracture. So scaphoid fracture matlab kaun sa weave hoga? The only weave that we basically do over here is oblique weave, and this is your scaphoid fracture. Here, yahan pe bhi dekho. Can you see the scaphoid fracture over here? Right? So I just want you to look at these X-rays, right, again and again, so that it will, yeah, this will be easy for you. Okay. Now this question actually is not asked from anatomy, but this will be asked from your ortho, right? So even if they have once asked this question, they will just ask you to identify the carpal bones over here. So how do you identify these carpal bones? That is upon you. You just have to put your own memory, what you want, whatever signs you want, put those things. And at the end, I want you to remember this. And again, I'm telling you, do not skip this. Do not skip this question. Okay? DST. Do not skip this at any cost. Okay, chalo. Now guys, अब बताओ, यहाँ तक everyone is clear? Be fast. Is everyone clear till here? Hi, creative mind. Right. Next important thing is that all of you just look at this. What is this carrying angle? Normally when you stand in an anatomical position, your hand is completely not perfectly straight. There is some kind of angle over here, right? Is angle ko bolte ho carrying angle. Is angle ko bolte carrying angle. Usually the carrying angle is around 17 degrees. Okay, in males and females the carrying angle will differ. Males it is around 10 to 15 degrees and in females it is around more than 15 degrees. Okay, more than 15 degrees. Clear all of you? So all of you just look over here. So in males it is around 10 to 15. In females it is more than 15 degrees. Okay. Now if things interchange, it looks bad. Okay. Right. So all of you just keep this thing in mind. So till here, if you are clear, let us start discussing the muscles of the complete body. I mean the upper limb over here. So the first important thing is muscles of pectoral region. Uske baad back, scapula, arm, forearm and hand. Okay. How do you remember these muscles in an easy way? What to remember also I'm going to tell you. Just pay attention. First let us discuss about the pectoral muscles. Okay. Pehla hoga pectoral muscles. How do you remember this? Just remember a mnemonic 2P, 2S. 2P, 2S. 2P, what are those 2P? Pectoralis major, pectoralis minor. Okay. 2S is subclavius and serratus anterior. 2P and 2S. Okay. Now, out of this, the first important muscle I am going to tell you is pectoralis major. Again I am telling you, remember the mnemonic MET. Medial lip, which muscle is attached? Teres major. Then to the lateral lip, which muscle is attached? Pectoralis major. Okay. So all of you just look down over here. All of you look here. Pectoralis major is a muscle that is attached to the lateral lip of your bicipital groove. Ye ho gaya pectoralis major. Okay. Next important thing, what are the actions of these muscle? Actually pectoralis major, ye chest muscle jo hai na, this is called as a famous muscle. Okay. Why it is called as a FAMOUS? Why it is called as a famous muscle? Kyunki F stands for flexion, A stands for adduction and M stands for medial rotation of your arm. Flexion of arm, adduction of arm, medial rotation of your arm is a function of your pectoralis muscle. Till here everyone is clear? I want you to remember the actions. I want you to remember this point, the insertion point, okay? Right. Next important thing is that अगर pectoralis major को निकाल दिया ऐसा, ठीक है? You have removed the pectoralis major. Inside you will have a muscle called pectoralis minor. ये देखो ये pectoralis major हो गया. This is your pectoralis major. This is your pectoralis minor. ठीक है? यहाँ पे क्लास चल रहे हैं कि डिस्कशन चल रहे हैं? हाँ, इंस्टा आईडी पूछ रहे हो. You guys, how many days are left for the exam? If you have at least asked my Insta ID, I would have been happy. You guys are chatting, आपस में chat कर रहे हो और एक दूसरों को Insta ID पूछ रहे हो. Wow, very good. तो ये भी पूछ लो, married, unmarried, girlfriend, boyfriend है कि नहीं? हाँ? चलो, right. So pectoralis major as well as pectoralis minor. Guys, can anyone tell what is this particular condition? Very very important thing. अब इस condition में पता क्या हुआ? One side pectoralis major muscle is absent. That is why you call it as aplasia. ठीक है? Aplasia or hypoplasia of pectoralis major. Okay? Along with this, patient is also having brachysyndactyl. Brachysyndactyl in the sense this is how the fingers are there. Okay? Short fingers and they are fused. Okay? Brachysyndactyl. So these two conditions you see in a very good, very good, very good. These two conditions you see in a single disorder over here, single syndrome over here, you call it as Poland syndrome. Poland syndrome. What is this? Poland syndrome. I want you to remember this Poland syndrome at any cost. Okay? Right. Now coming on to the next important thing, what is this muscle? If they ask you if they give three important actions and ask you what is the name of the muscle, ये देखो. First, it is a powerful protractor of scapula. Boxer's muscle, abduction of more than 100 degrees. मतलब with the help of that muscle, I can abduct my arm more than 100 degrees, right? So, what are these three important actions over here? Very good, very good. These three important actions are for the muscle over here, that is your serratus anterior. What is this? Serratus anterior muscle. Okay, so this muscle over here is called as your serratus anterior muscle. Is it clear to everyone? Serratus anterior muscle. Right, so all of you just look at this muscle over here. ये देखो, ये हो गया serratus. Serrated margin से ना, इसीलिए इसको serratus anterior muscle बोलते हैं. Okay, right. Now, guys, I just want to discuss few important things of serratus anterior muscle. ठीक है? See, if I am doing boxing, right? If I am pushing the door, and if the door is opening, if I am able to open the door, it is because of serratus anterior. And this serratus anterior is innervated by a nerve which is passing all the way down into the thorax, which is very long, and this is called as long thoracic nerve. What is this nerve called? Long thoracic nerve. और ये long thoracic nerve कहाँ पे होगा? This is more superficial like this. If it is superficial, if I beat you over here, don't you think this nerve will be damaged? Yes. If this nerve will be damaged, what will happen? Serratus anterior will not work. If serratus anterior is not working, there is no protraction of scapula. This would lead to a condition called winging of scapula. This would lead to a condition called as winging of scapula. So all of you just look over here. See, this muscle over here is called as your serratus anterior. What is this? Serratus anterior muscle. Okay, this is your serratus anterior muscle. ये देखो, पीछे से भी देखो, this is your serratus anterior. Yeah. Next important thing. So all of you just look over here. This muscle, if they give you a cadaveric image also, you should be able to answer. This muscle over here is called as your pectoralis major. Now what I'm going to do, I'm going to cut down this muscle. Okay? When I cut down this muscle and remove it, okay, like a flap, ऐसे होगा. ये देखो, I have removed pectoralis major और अंदर जो muscle है, what is this? This is called as your pectoralis minor muscle. This is your pectoralis minor. Pectoralis minor. Next important thing is that on the side of the chest, guys, can you clearly observe over here on the side of the chest, you see muscles over here, ye dekho. Can you observe this muscle? Ye dekho, 1, 2, 3, 4. Can you observe it? I want all of you to observe. Can you observe these muscles? These are your serratus anterior muscle, and serratus anterior muscle ke upar, can you see a long nerve that is passing over here? Can you see this nerve? They will point out at this nerve and they will ask you, what is the clinical manifestation you see when this nerve is damaged? What is the disorder you see? This nerve is nothing but called as your long thoracic nerve. This is a very important image based question which will be asked. Keep this thing in mind. Okay. So this is called as winging of scapula. Guys, remember one thing, there are two types of winging. Agar scapula is moving towards spine, isko bolte hain medial winging of scapula. Scapula moving away from the spine, it is called as lateral winging of scapula. Ye dekho, there is one thing called medial winging, theek hai, aur dusra kya hai? Lateral winging of scapula. Okay, now you should know medial winging of scapula is because of paralysis of which muscle? That is your serratus anterior. It is because of serratus anterior. Okay, lateral winging of scapula is because of paralysis of which muscle? That is your trapezius muscle. What is that? Trapezius muscle. Clear all of you? Trapezius muscle. Agar serratus anterior injury hua, injury will happen because of injury to which nerve? The nerve which you should know over here is long thoracic nerve. That is your long thoracic nerve. Next, agar trapezius damage hua, then what is the nerve over here? There are two nerves that are given in the book. One is your spinal accessory nerve. Spinal accessory nerve, और दूसरा dorsal scapular nerve. Dorsal scapular nerve. Okay, dorsal scapular nerve. Okay, so basically the material which I use is mainly the amboss as well as the USMLE materials. Okay, so in those materials only they have given both the spinal nerve as well as the dorsal scapular nerve. They are responsible for the lateral winging of scapula. Okay, so guys, I want you to remember this here, and I'm telling you this will mark a very important MCQ. Very important MCQ. I'm telling you. Okay, so keep this thing in mind. Chalo, let us move on to the next important thing. Let us discuss what are the nerves that are innervating your pectoralis muscles. So, abhi isme se which muscle you already know? You know serratus anterior. Serratus anterior ka nerve supply kya hoga? I already told you that is your long thoracic nerve. What is that? Long thoracic nerve. Next important thing. Coming to pectoralis major, pectoralis minor. Guys, all of you know alphabets. Alphabets mein na, you know the alphabets L, M, N, O, P and all. Okay, so apply those things over here. What does L stand for? L stands for lateral. Okay, lateral and medial pectoral nerve. Lateral and medial pectoral nerve. Okay, now when it comes to pectoralis minor, you have to know M. What is M over here? Medial pectoral nerve. Medial pectoral nerve. Okay. Next important thing, subclavius. Subclavius ka nerve is very easy. That is your nerve to subclavius. Nerve to subclavius. Okay. Guys, 1 minute. Just look at what are the nerve innervations over here. 2P, 2S. 2P matlab pectoralis major minor. 2S matlab subclavius serratus anterior. Serratus anterior to you already know, long thoracic nerve I already told you. Coming to pectoralis major, remember the mnemonic LMNOP. L stands for lateral and medial pectoral nerve. Niche, M stands for medial pectoral nerve. Niche you have got N. N stands for nerve to subclavius. So this thing will cover up your pectoral region. Is everyone clear before I move on to the next one? Jaldi batao fadafat. And what is this? This is your winging of scapula. Winging of scapula questions has been asked 8 to 9 times. I'm telling you, 8 to 9 times they have asked you. So I'm telling you, if you remember just this box over here, most of your questions will be solved. Okay. Chalo. All of you understood? Very good. Now let us discuss a next important targeted question. Maybe इस साल ये पूछ सकते हैं लोग, that clavipectoral fascia. Okay, clavipectoral fascia. So this is your clavipectoral fascia. What is this clavipectoral fascia? For example, if I'm standing side like this, ठीक है, यहाँ पे क्या है? clavicle. clavicle के नीचे क्या है? subclavius muscle. subclavius के नीचे क्या है? pectoralis major. If I remove pectoralis major, अंदर क्या होगा? pectoralis minor. The same muscles I have drawn over here. ये देखो. First, ये क्या हो गया? clavicle. clavicle के नीचे क्या है? subclavius. Below the subclavius, you have got pectoralis minor. Upon all of this, covering all of them, you have got pectoralis muscle, pectoralis major muscle. Okay? अभी clavipectoral fascia क्या है? This is your clavipectoral fascia. See, this particular fascia over here is called as your clavipectoral fascia. Okay? Now, what is the question that is asked is, what are the structures that are piercing through this clavipectoral fascia? All of you look at another picture. ये देखो, this is the picture. Okay? So, all of you just concentrate here. So, यहाँ पे, this is your clavipectoral fascia. What are the structures that are piercing? ये देखो, there is one artery that is going inside. There is one blue color one, that is a vein that is going inside, and there is a golden color nerve that is going inside. Artery का नाम क्या होगा? All of them are present over here. Yes or no? This is the region of axilla. So what is the artery that is piercing inside? Axillary artery. The vein that is piercing inside? Axillary vein. The nerve that is piercing over here is your lateral pectoral nerve. Okay. So the branches of these main arteries are piercing inside. So what are these? Let us see here. All of you look here. Axillary artery, axillary vein, and a nerve. Okay. What is this axillary artery? Axillary artery का नाम है thoracoacromial artery. I'm sorry guys, this is some small technical glitch. Thoracoacromial artery. What is a vein over here called as? Cephalic vein. Cephalic vein, which is a branch of axillary vein. What is the nerve over here called as? This is your lateral pectoral nerve. What is this? This is your lateral pectoral nerve. Right? So guys, nothing new. अभी यहाँ पे देखो एक बार, all of you just look here. ये देखो, this lateral pectoral nerve is piercing which muscle over here? Pectoralis major. I have already told you that pectoralis major is innervated by your lateral pectoral nerve. Yes or no? So just look at the picture. If the nerve is innervating your pectoralis major, then it is your lateral pectoral nerve. Okay? Lateral pectoral nerve. And next important thing is your lymphatics. Okay? Lymphatics. So these are the structures that are, these are the structures that are piercing through your clavipectoral fascia. So if they ask you what are the structures that are piercing, these are the structures you have to mention. Structures that are piercing through your clavipectoral fascia, these are the structures. I hope this is clear to all of you. Just do these two questions for me guys, very fast. Clavipectoral fascia is pierced by all but one of the following structures. Option A, lymphatic drainage, yes. Cephalic vein, yes. Lateral pectoral one, yes. Thoracoacromial artery, yes. And pectoralis minor, no. Pectoralis minor क्या है? That is a muscle. It cannot pierce a structure. Next, which of the following structures do not pierce the clavipectoral fascia? देखते हैं. Lymphatics will pierce. Acromiothoracic axis नहीं, ये artery है, okay? Thoracoacromial artery, it will pierce. Cephalic vein will pierce. Lateral pectoral nerve will pierce. What will be the answer? Bhuvana, very good. Sufficul, very good. Marinette, very good. The answer over here is median pectoral nerve. Median pectoral nerve. So I hope you are clear till here. Yes or no? Let us go on to the next important thing, that is your axilla. Okay, this is your axilla. We will discuss the important things in the axilla. Okay, Now, when it comes to the axilla, axilla is like a pyramid. Okay, axilla is like a pyramid. Pyramid में दो चीज होंगे, yes or no? There is apex of the pyramid, there is base of the pyramid, right? So all of you, whatever you can look over here, ये देखो, this one is called as the apex of the pyramid. So from here you will have the base of the pyramid. So apex of the pyramid is having three important structures. What are those three? Medially you have got the first rib, anteriorly you have got the clavicle, और पीछे क्या है? Posteriorly you have got scapula. All of them together you call it as the apex of the cervical canal or apex of the axilla. If they ask you what are the borders of apex of axilla, you should answer all of this. Okay, right. Let us come to the base of the axilla. This picture I have kept it for you guys. You have to answer it. What is this? What is this? And what is this? All of them together are forming a canal over here. This is the apex. Okay, right. Now if you come little bit down guys, ठीक है, ये हो गया apex, थोड़ा नीचे आ गए यहाँ पे. See what will happen, let us down here. See, if I am putting my hand like this, down here what do you see? Medially you see ribs, yes or no? Laterally you see what? Humerus. Medially ribs, laterally humerus, और पीछे क्या है? From T2 to T7 you have got your scapula. So all of you just look over here. Medially you have got the ribs, laterally you have got the humerus, और पीछे क्या हो गया? Back side you have got your scapula. But in the front what do you have? In the front you have got your pectoralis muscle. ये देखो, pectoralis major, pectoralis minor. Okay, and tell me to the ribs, what are those muscles which I told you where long thoracic nerve will pass? What is that? Serratus anterior muscle. That is why I have written here serratus anterior. Okay, next on the back you have got your scapula. This is your scapula. Okay, scapula के नीचे जो muscle है, that is your subscapularis, right? Next, if you look at the humerus, I have already discussed it long ago. We have got a lateral lip, we have got a medial lip, we have got a lateral lip. To the medial lip, teres major is attached. In the bicipital groove, what is this muscle attached? Latissimus dorsi. Okay, so if you remember these things, if you remember this picture, many MCQs will be solved, I am telling you. Okay, I just want you to remember this picture. Why? Because they are going to ask you what is the anterior wall of axilla made up of, posterior wall of axilla made up of, lateral wall, medial wall of axilla made up of. Guys, you tell me now, आप लोग बताओ अभी, anterior wall is made up of what? Pectoralis major जहां पे, this is called as the anterior, और scapula जहां पे, this is called as the posterior. ठीक है? Now tell me, anterior is made up of what? Anterior wall of axilla is made up of pectoralis major, pectoralis minor. Clear all of you? Anterior is made up of pectoralis major and pectoralis minor. When it comes to the back, posterior is made up of what? Scapula, okay, and subscapularis muscle. Scapula and subscapularis muscle you have got posterior. And posteriorly you have also got one more important thing. All of you remember this thing. When I have drawn a line over here, line के पीछे whatever structures are there, all of this will come under posterior. Line के सामने whatever structures are there, all of them will come under anterior. So in the posterior aspect, you even have to mention teres major and latissimus dorsi. Teres major, latissimus dorsi, scapula as well as subscapularis. These are the four things that form the posterior wall of axilla. Keep this thing in mind. These four things form the posterior wall of the axilla. Coming to the medial. Medially मतलब ये ribs हो गया, ये देखो medial. Medially what do you have? You have got the upper four ribs. उसके साथ साथ you have got your serratus anterior muscle. This is your serratus anterior muscle. Okay, so let us look down here. ये देखो, anterior wall is having pectoralis major minor, posterior wall is having scapula, teres major, subscapularis, latissimus dorsi. Lateral wall is having humerus coracobrachialis. Lateral wall में तो humerus है, you know that thing. ठीक है, humerus के साथ साथ why I have written it in another color is this is I haven't mentioned it in the picture. Just remember it out of your memory. Okay. Medial wall में क्या है? The first four ribs. Along with that serratus anterior क्या है? ये serratus anterior muscle. So all these structures, they form the wall of your axilla. Guys, are you clear till here? Jaldi batao guys. We have to little bit fast up the things now. Right. Thank you. Right. Now let us see. ये देखो. All of you just look here. If this is your axilla, what is this? This is called as the entry point into the axilla. Yes or no? So in this, what are the contents? What are the contents that are located here? Contents मतलब ये देखो, यहाँ पे artery हो सकता है, यहाँ पे vein, यहाँ पे nerve, यहाँ पे fat, यहाँ पे lymph vessels. What are these? What are these? We'll discuss. We are right now discussing about axilla. So axilla के अंदर जो artery होगा, वो होगा axillary artery. Axilla के अंदर जो vein होगा, that is your axillary vein. And the lymph nodes are called as axillary lymph nodes. And obviously all of you know brachial plexus will pass through axilla, so brachial plexus will be there. And if you want to remember it, or else no, that is axillary fat and connective tissue. So I don't think so. This is not that difficult for you to remember. Okay? This is very easy. Axilla contents are very easy, right? So this is all you need to know. Now let us discuss about the breast. Okay? Why am I discussing breast? Is breast, it will be discussed in surgery also, but still I am trying to cover up some points over here. Okay, so breast or scapula, the topography is almost same. Scapula ka kya tha topography? T2 to T, what is that? From the second posterior rib all the way till the seventh. और यहाँ पे the breast ranges all the way from the second rib all the way till the sixth rib. वहां पे 7th rib scapula, this is 6th rib. Okay, this is 6th rib. And remember one more thing also, where is nipple they are asking nowadays? Nipple is present at the level of 4th rib. Wrong. It is present at the level of 4th intercostal space. It is present at the level of 4th intercostal space. So these were the questions which were previously asked guys. Previously ये questions पूछा था. So breast extends from 2nd rib to 6th rib. First question. Nipple is present in the 4th intercostal space. Second question. Okay. Nipple is innervated by what? Nipple is innervated by 4th intercostal nerve. Space कौन सा है? 4th intercostal space. Nerve कौन सा है? 4th intercostal nerve. Entire breast is innervated by 4th to 6th intercostal nerve. 4th to 6th intercostal nerve. These are the 4 important MCQs which I want you to remember. Very, very, very important MCQs. Guys, can anyone tell what is the most common type of breast cancer? Jaldi batao. Most common type of breast cancer. Very good, very good, very good, very good. Rishi Jha. Rishi, how are you? Very good, Rishi. So it is your invasive ductal carcinoma. Invasive ductal carcinoma. Okay, invasive ductal carcinoma. Very good, very good, very good. Pratyusha, Rahul, Safikul, very good. Fia, very good. VPR, very good. Mantis, very good. Guys, what are these important things is that in surgery, whenever they ask you regarding, if they give you a clinical question and ask you what is the most common type of breast cancer and all, right? If they ask you what are the alarm features, these are the alarm features of the breast cancer. I just kept it for you so that you will look at it. Swelling of the breast, skin dimpling, nipple pain, retraction, right? So color discharge and swollen lymph nodes. So these are some of the important things here. Okay. And also do remember this point in surgery. They will speak this, that whenever you have these alarm features, right, you go to a doctor directly. He won't do a biopsy. First, what he will do is that based upon the age, if your age is less than 40 years, you will undergo ultrasound. If your age is more than 40 years, you will undergo mammography. Ultrasound या mammography, whatever it might be, breast के अंदर you will see a lesion. उसके बाद क्या करना चाहिए? You have to take a biopsy. There are two types of biopsy. One is called as needle biopsy. Another one is called as core biopsy. Needle biopsy में you just use a thin needle, right? The pain is less, results are inaccurate. Another biopsy is core biopsy where you use a very thick needle and the pain is more but results are very accurate. Okay, these are some of the important things you just remember in surgery point of view. Okay, chalo, I'm not discussing surgery now. Chalo, let us discuss here. If you divide the breast into 4 quadrants, okay, if you divide the breast into 4 quadrants, the upper lateral quadrant, मतलब यहाँ पे ये देखो upper lateral quadrant जो है, inside to that you will have a small tail. ये देखो ये छोटा सा tail दिख रहा है ना यहाँ पे, small tail. This tail is called as axillary tail of Spence. And what is this tail doing? If this is a tail, this tail is piercing this fascia. This tail is piercing the superficial fascia and entering deep inside. So when it is piercing here, it is making an hole over here. It is making an opening. That opening over here is called as foramen Langer. Foramen of Langer. You have to just remember that. That is called as your foramen of Langer. Okay, and yeah, Pratyusha is telling here that the upper lateral quadrant is the most common site for breast cancer. Very good, excellent. Okay, so this is the important thing you need to remember. And coming to what is the blood supply to your breast? Okay, how do you remember this? How do you remember this is that remember by the mnemonic I slap. Okay, I slap. What is this I? I stands for internal mammary artery or internal thoracic artery. Right? Next, S stands for superior thoracic artery, L stands for lateral thoracic artery, A stands for acromiothoracic artery, and P stands for posterior intercostal artery. Okay, so if you want, you can look at this picture also over here, which I have drawn it on the side. Okay, so remember, whenever I ask you the blood supply of the breast, you have to tell I slap. Okay, keep this thing in mind. Okay, right. Now let us go on to the next important thing. This is a very dead easy question, but this was asked multiple times. How many lactiferous ducts open into the nipple? Ye dekho guys, all of you look at this. This is called as the lobule, breast lobule. Breast lobule ke andar kya cheeze? See, this is called as the breast lobule, okay, and this is called as the lactiferous sinus, or ye kya hoga? Lactiferous duct. Okay, so I've drawn the same picture on the side. All of you look here. Lactiferous duct, lactiferous sinus, and lobule. Very good. 15 to 20 here, 15 to 20 here, 15 to 20 here. Very good. So this is the 3-time asked MCQ. 3 different times they have asked this MCQ. Keep this thing in mind. Clear, all of you? So this is all the important things which you need to know regarding the breast part, right? Some of the pathologies also have discussed, right? Those will be in the detailed lectures, not in the rapid revision. Like Pudy orange syndrome, what is that, and all these things I've discussed. If you have time, you go watch that videos, but not necessary for anatomy point of view. Okay, chalo, if you are okay with that, then tell me fastly, then I will start the muscles of the back fast. Very good. Let us start the muscles of the back. Now when it comes to the muscles of the back, all of you know you have got trapezius. Guys, all of you know the muscles of the back, right? और ये पीछे यहाँ पे जो मसल है trapezius होगा, नीचे जो मसल है पीछे, right? What is this called? This is called latissimus dorsi, right? And after that you have got one muscle on the scapula called as levator scapulae. उसके बाद rhomboid minor major. Okay, so these are the muscles that are located over here. Now one by one we will discuss all the muscles. Okay. First muscle let us discuss is trapezius. Last में I will also discuss the clinical point. So this is your trapezius muscle. ये देखो ये हो गया trapezius muscle. Origin insertion if you want you remember, no one is going to ask you, ठीक है? But if you want remember it, origin from external, ये हो गया external occipital protuberance, ये external occipital protuberance, all the way from C1 down all the way till T12 and attached to the scapula. Chalo, whatever it is. If this is your trapezius, let me discuss the actions. There are 3 types of fibers. These are called as the superior fibers. These are called as the middle fibers. These are called as the inferior fibers. If I'm pulling the superior fibers, scapula is elevated like this. So superior fibers are responsible for elevation of scapula. If I'm pulling the medial fibers, scapula is medially retracted in this way. So retraction of scapula. If I am contracting the inferior fibers, if I am pulling them down, the scapula is pulled down. This is called depression of scapula. So if someone is asking you what are the functions of scapula, what will you tell? Superior fibers for elevation, middle fibers for retraction, inferior fibers for depression. Till here you are clear? Right. So scapula ho gaya. Sorry, trapezius is done. And one clinical point I already told you on trapezius. What is that? I told you that trapezius is responsible for medial winging or lateral winging. Lateral winging of scapula. Yahan pe dekho. It is responsible for your lateral winging of your scapula. I want you to remember it at any cost. Okay? Lateral winging of scapula. Let us discuss about another muscle called as latissimus dorsi. ये देखो यहाँ पे ये जो blue color में जो muscle मैंने draw किया था ना, this entire muscle is called as your latissimus dorsi. Okay, guys, one very important thing I want you to identify over here. Latissimus dorsi is inserting where? If you remember, a lady between two majors. ये देखो latissimus dorsi is inserting exactly at this point, and this point is called bicipital groove. This is the first point I want you to observe. This is the first point I want you to observe. Second point पता क्या है? Where the place where ये trapezius हो गया, ये latissimus dorsi हो गया. The place where both of them are overlapping upon each other, you see a small triangle here in the center here. This triangle over here is called as triangle of auscultation. Triangle of auscultation matlab yahan pe when you put the stethoscope in the lower lobes you can listen very clearly. Okay, so they are going to ask you what is the borders of triangle of auscultation. Ye dekho, all of you just look here. These are the borders which I have taken from a website called Radiopedia, very standard website. ये देखो inferior laterally क्या है? trapezius है. trapezius कहां पे है? ये देखो inferior and laterally, नीचे और side पे. inferior laterally you have got trapezius. superior border of latissimus dorsi, this is the latissimus dorsi का superior border हो गया, ठीक है. and inferior medial border of rhomboid major और medial border of scapula. ये देखो ये क्या हो गया? medial border of scapula. Okay. In some textbooks it is given as inferior medial border of rhomboid major. So all of these three together you form a triangle of auscultation. Okay. So once again all of you just look here. Lower border of your trapezius, okay, simple way. Upper border of your latissimus dorsi or medial border of your scapula. Clear all of you? Right. Now let us discuss. ये देखो, this is your trapezius muscle और ये नीचे जो है latissimus dorsi है. Okay. So functions of trapezius I have already discussed. Right. Now latissimus dorsi functions क्या? What are the functions of latissimus dorsi? Adduction of these things you have to remember, guys. Okay. There are no other tricks you can play over here. और निमोनिक्स कितना याद रखोगे? तो adduction of arm, internal rotation of arm, and latissimus dorsi is considered as an accessory muscle of respiration. Okay, adduction, internal rotation, and accessory muscle of respiration. These are the things you have to remember. Okay, right. So what are the things we have discussed? We have discussed about trapezius. We have discussed about latissimus dorsi. Now we will discuss about this part. Where is that? Right. So these are the parts. What are the two important muscles? So rhomboid major minor हो गया और levator scapulae. ये देखो, this is your levator scapulae. Right. If I ask what is the function of levator scapulae, तुम देख के बताओ. Right. आप लोग देख के बताओ यहाँ पे. Levator scapulae muscle is located on the top of the scapula. So when I'm contracting, fibers are pulled up. So elevation of scapula. In the same way, retraction of scapula is done by rhomboid minor major. ये देखो. Both of them do the retraction. Clear all of you? Both of them do the retraction. Okay. So, इसीलिए इसका नाम levator. Levator मतलब क्या? Elevation. Okay. So, this is your trapezius. When I remove the trapezius, this is how it looks. ये देखो rhomboid minor और ये हो गया rhomboid major. Clear all of you? Rhomboid minor and rhomboid major. और ये देखो यहां पे हो गया levator scapulae attached on the top. Yeah, right. So coming to these nerves over here. How do you remember these nerves? Very easy way to remember these nerves. Just follow whatever I'm telling you over here. Okay. First important thing, remember a mnemonic TAN. TAN मतलब क्या? T मतलब trapezius, AN मतलब accessory nerve. What is AN? Accessory nerve. And again I'm reminding this point again and again, responsible for lateral winging of scapula. ठीक है? Next, coming to latissimus dorsi. अच्छा ये बताओ, where is latissimus dorsi? Back side. ठीक है? Back side मतलब क्या? Dorsal की ventral dorsal. Dorsal where? In the thoracic region, right? So thoracodorsal nerve. What is this nerve? Thoracodorsal nerve. Next, rhomboid minor or major. Rhomboid minor or major, they are present on the top of the scapula or below the scapula. Picture देख के बताओ. They are present on the top of the scapula, right? That is why you are calling it as dorsal scapular nerve. Now, levator scapula is also present on the top of the scapula. Again, you call the same nerve dorsal scapular nerve, right? Just by thinking about the muscle, imagining the muscle, you have to tell the nerve innervation, guys. This is very, very easy, right? So, till here, I hope all of you are clear. Can anyone tell what is this? Dorsal scapular nerve innervates all the muscles except anyone? Just answer me ABCD. Very good, Sneha, Shalvi, Mantis, Marinette, Safikul. Very good. Perfect. You guys are perfect. You're right. Latissimus dorsi. Why? Because latissimus dorsi is innervated by thoracodorsal nerve. Thoracodorsal. Right. Now, one of the favorite topic in orthopedics, which is asked every year. Every year they ask this topic. Muscles of scapula. They are going to ask you a very important point here. That is your rotator cuff muscles. Okay. So, what are these muscles over here? Just pay attention. Muscles of scapula. What are the muscles that are located on the scapula? On the scapula. Not just attached to the scapula. Located on the scapula. Remember the mnemonic D sits. ठीक है? D sits. D मतलब क्या? Deltoid. SITS. S मतलब क्या? Supraspinatus. All of you guys, all of you know scapula is having a spine. Yes or no? This is your scapula. It is having a spine like this. All of you know, right? Spine के ऊपर जो मसल है supraspinatus, spine के नीचे जो मसल है infraspinatus. All of you are clear? Supraspinatus, infraspinatus. T stands for teres minor or major, दोनों. And S stands for subscapularis. These are the muscles you need to remember over here, right? Now, out of all these muscles, supraspinatus, infraspinatus, teres minor and subscapularis. These four muscles are called as rotator cuff muscles. These are called as rotator cuff muscles. Keep this thing in mind. These four muscles over here are called as your rotator cuff muscles. Now, what is the important thing that they are going to ask you is that where are these muscles inserted? चलो ठीक है, शुरुआत से scapula से होगा. All of them start from scapula. But out of all, supraspinatus, infraspinatus and teres minor, these three muscles attached to the greater tubercle of your humerus. Greater tubercle of your humerus. Okay. So, very good. All of you know this. This is your humerus. ये देखो, ये हो गया greater tubercle of humerus, whereas subscapularis will attach to the lesser tubercle of the humerus. This thing I want you to keep in your mind, guys, क्योंकि later I will discuss in the femur, in the lower limb topic, I will discuss greater trochanter, lesser trochanter. Okay, what are the muscles attached to the greater trochanter, lesser trochanter? In the same way, you have to remember what are the muscles that are attached to the greater tubercle and lesser tubercle. Okay, so keep this thing in mind. Now, when I'm telling you these supraspinatus muscles, whenever you are overusing your shoulder, सुनो अच्छे से, whenever you are overusing your shoulder, these four muscles will damage. Okay, out of these four muscles, जो muscle सबसे ऊपर होगा, the muscle which is present on the top is most commonly damaged. Yes or no? What is the muscle that is present completely on the top? Supraspinatus. Okay, supraspinatus is present. So that is the reason why if they ask you the most common injured among rotator cuff muscles, what is that? Supraspinatus muscle. Supraspinatus muscle. ठीक है, और सुप्रास्पाइनेटस मसल का व्हाट इज द एक्शन? इनिशियल अबडक्शन, मतलब यहां तक 0 to 15 degrees only you can lift the hand with the help of supraspinatus like this. Okay, initial abduction of the arm. Clear? Next important thing is that let us write down the degrees over here. Supraspinatus will perform abduction to how many degrees? Just now I told 0 to 15 degrees. Deltoid will perform abduction from 15 degrees से लेकर 100 degrees तक. Okay, 15 degrees से, thank you so much Sahith. Serratus anterior is more than 100 degrees. Guys, ये question पक्का होगा. All of you remember this question at any cost. Okay, 0 to 15 supraspinatus, 15 to 100 deltoid, more than 100 serratus anterior. More than 100 it is serratus anterior. Right, so all of you keep this thing in mind. And rotator cuff muscles जो है, there should be some joint that is providing the stability. That is your glenohumeral joint. Okay, so that is a joint between the glenoid and the humerus. Glenohumeral joint. Right, all of you just look at this. This is a normal MRI. Okay, wherever there are hyperintensity on the MRI, that is a lesion basically. ये देखो, ये normal MRI है और ये हो गया तुम्हारा supraspinatus muscle. All of you just look at this MRI. Here you see that the supraspinatus is injured over here. ये देखो, supraspinatus is injured. That is why the lesion is white. Okay. Anyways, they won't ask you MRIs. Even if they are, they will ask in orthopedics. You will study there separately. I just kept it here. Okay. Right. Whatever it is. So this is the muscles from the back. Okay, guys, if they give you this picture and ask you, what is this particular muscle? ये देखो, ये muscle क्या है? What is this? This is your trapezius. Okay, and down over here, what is this particular muscle over here? This is your latissimus dorsi. What did I tell you? Place where latissimus dorsi and trapezius, they will overlap upon each other. यहाँ पे, can you see a small triangle here? Can everyone see a small triangle? What is this triangle? Answer very fast. What is this triangle? जल्दी बताओ. Vancomycin, answer, come on. Suffocul, mantis, very good mantis. Triangle of auscultation. Triangle of auscultation. Guys, can you see here? ये देखो. I'm zooming it slowly here. Can you see a small triangle over here? ये है triangle of auscultation. Okay, triangle of auscultation. Right, guys, I kept these two questions for you. I want you to answer these questions. ये देखो, which of the muscles do not form the rotator cuff? You should answer it. Right, we have discussed supraspinatus, infraspinatus, teres minor discuss किया कि teres major? We have discussed teres minor. So teres major is not a part of rotator cuff. ठीक है? In the same way, the other one also. I'm sorry. Right. Coming to, mic is going only on one side. I'm sorry. Right. Hope I am clear now. Hope I am clear to all of you. Right. Right. So all of you just look at this, muscles of the arm. So muscles of the arm, forearm, hand, just listen to whatever I'm telling you. Muscles of the arm, forearm, hand, okay, you have to remember by anterior compartment, posterior compartment, ठीक है. Muscles of arm में भी anterior compartment है, posterior compartment है. Anterior compartment muscles are called as flexors, posterior compartment muscles are called as extensors. Even forearm में भी यहाँ पे flexors होगा और पीछे क्या होगा, extensors होगा. Hand में भी यहाँ पे क्या होगा, flexors और यहाँ पे पीछे क्या होगा, extensors होगा. Okay, so flexors or anterior compartment, posterior compartment or extensors. So anterior compartment of arm में how do you remember by the mnemonic BBC. BBC क्या होगा? biceps brachialis coracobrachialis. Next, extensor posterior compartment में you have got two muscles, triceps muscle and anconeus muscle. Okay guys, right now I am telling you one very important thing. Remember this thing, posterior compartment जो है ना, in your arm, forearm and hand, entire posterior compartment is innervated by only one nerve और वो होगा radial nerve. ठीक है, ये चीज फिक्स कर लो ब्रेन में. Entire posterior compartment of upper limb एक ही nerve होगा. What is that? Radial nerve. Now when it comes to the arm region में ना, in the arm region, anterior compartment, the nerve that is innervated over here is musculocutaneous nerve. I will make you revise these nerves at the end. Don't worry about that. Remember this as musculocutaneous, here it is radial. So what we have to discuss in the arm, only two muscles, origins of biceps brachii, origins of triceps brachii. Guys, when I tell you biceps, okay, what are the two heads you have? Long head, short head. Triceps में मतलब three heads are there. Long head is there, lateral and medial head is there, no short head. Okay? Now remember this thing very clearly over here. See, long head originates from where? Supraglenoid tubercle. ठीक है, और ये क्या होगा? What is this? This is your biceps and this is your triceps. Okay, so long head originates from supraglenoid tubercle. Triceps में long head originates from infraglenoid tubercle. Both of them are opposite to each other, है कि नहीं? यहाँ पे supra होगा तो वहां पे infra होगा, right? Next, short head here originates from coracoid process. Sir, how do you remember this? Is that all of you look here. This is S for short head. Short head को you can even make it as C. C stands for what? Coracoid process. Clear all of you? हो गया. Biceps is completely done. When you come to triceps में there are two other things, lateral head and the one is medial head. Very simple. Lateral head is lateral to radial groove. Medial head is medial to radial groove. ठीक है सर, why are you talking about radial groove? क्योंकि पीछे radial groove होगा ना, from which radial nerve will pass. You remember that thing, right? So lateral head, lateral to radial groove, medial head, medial to radial groove. I don't think so this origins and insertions are that difficult. Okay, now what I'm trying to tell you is that this biceps muscle जो है, यहाँ पे जो tendon होगा, this is called proximal tendon, this is called distal tendon. If my proximal tendon is cut off, क्या होगा? This entire biceps muscle will hang down. When it will hang down, it looks in this way. This condition is called as, can anyone answer what is this condition called as? Very famous condition. Vancomycin has answered it already. Very good, Shalvi, very good. This condition you call it as Popoy deformity. Again, I'm telling you, in the exam, if they ask you, Popoy deformity is what? It is nothing but rupture of proximal tendon or distal tendon. Proximal tendon, okay? Rupture of proximal tendon, okay? Keep that thing in mind. And there was once a question asked that where is this biceps muscle inserting finally? ये देखो, biceps muscle जो है, it will insert to the radial tuberosity here. ठीक है, radial tuberosity. ये देखो, ये आर्म है, right? And you see this small elevation over here, X-ray में, ये होगा radial tuberosity, and ये biceps muscle जो है finally आके यहाँ पे insert होगा, okay? So keep this thing in mind. So we are done with the muscles of arm. What did we discuss? यहाँ पे BBC, brachialis, BBC, biceps, brachialis and coracobrachialis. और पीछे एक ही muscle होगा, triceps. Okay? Clinical point which we discussed was proximal tendon rupture हुआ तो the muscle will hang down, called as Popoy deformity. चलो next. Coming to muscles of forearm. Muscles of forearm also Muscles of forearm are also divided into two compartments: anterior compartment, posterior compartment, flexor compartment, extensor compartment. Okay? Now when it comes to this, remember this thing: anterior compartment mein there are some muscles in two layers. Upper layer is called superficial, नीचे जो layer है deep layer. Okay? How do you remember these muscles? Remember by the mnemonic PF, 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 PF. Guys, if you just remember these three 6-letter word PF, 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 most of the muscles are covered. Okay? What does P stand for here? P stands for pronator teres. Okay? F stands for what? Flexi carpi radialis. फिर से P stands for what? Palmaris longus. F stands for what? Flexi carpi ulnaris. Okay? ये देखो P, F and here also P, F. Another PF. Another P stands for what? Pronator quadratus. ये देखो pronator quadratus. Another F stands for what? Flexor pollicis longus. हो गया PF, PF, PF. And there are two separate muscles. What are these two separate muscles? Is एक हो गया flexor digitorum superficialis because I have included it in superficial group. एक हो गया flexor digitorum profundus because it is in the deep group. That's it. This is all you need to remember. Is it clear to everyone? Right. So I hope all of you are clear with these muscles, guys. Yes or no? You just need to practice these muscles. In my detailed lectures, each and everything I have drawn all these muscles and I've taught you, but right now we don't have that time to draw and all. चलो, let us discuss about the nerve innervation. अभी यहाँ पे जितने भी muscles है ना, all these muscles are innervated by only one nerve, that is your median nerve. Okay? Except there is one exception. ठीक है? वो exception क्या है? ये देखो. All the muscles. Okay? So all the muscles of flexor compartment are innervated by median nerve, except 1.5 muscle. Oh, one muscle क्या है? That is nothing but your flexor carpi ulnaris. Flexor carpi ulnaris. And what is that? A half muscle. Half muscle is your medial half of flexor digitorum profundus. Medial half of flexor digitorum profundus. Okay? So what are these 1.5 muscles innervated by? Ulnar nerve. So ये 1.5 छोड़ के बाकी सब all of them are innervated by which nerve? Median nerve. So majority of the muscles of forearm are innervated by median nerve. अगर median nerve is not working, majority of the muscles will not work and you can't do the things. इसीलिए इस nerve को laborers nerve बोलते हैं. Okay? The laborers work with their hands and mainly the nerve responsible is median nerve. Okay? Keep this thing in mind. Okay? So this statement is very, 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 very important statement. Okay? So till here all of you are clear, guys? So which is a laborer's nerve from now onwards? Your median nerve is your laborer's nerve. Okay? Right. Coming to the extensor. Again I am telling you, entire extensor compartment jitne bhi hai, all of them are innervated by only one nerve, that is your radial nerve. Chalo, theek hai. What are these muscles? All of you remember here. Now all of you just pay attention to whatever I am showing it to you on my hand. ये देखो, ये एक्सटेंसर पॉइंट है. एक्सटेंसर पॉइंट मतलब लैटरल एपिकॉन्डाइल, फ्लेक्सर पॉइंट मतलब मीडियल एपिकॉन्डाइल. ठीक है? फ्रॉम हियर you see a muscle that is coming all the way, this big chunk of muscle, this is called as brachioradialis. brachium से लेकर radius तक brachioradialis. हो गया? Second, next muscle from the extensor point all the way it is moving. ये देखो, extensor point all the way it is moving towards the carpal bones onto the radial side. Extensor carpi radialis. From the extensor point all the way it is moving to the carpal bones onto the ulnar side. Extensor carpi ulnaris. Okay? Next, from the extensor point all the way it is going and attaching to the digits. Extensor digitorum. From the extensor point all the way it is going and attaching to your little finger. Extensor digiti minimi. Okay? So all of you are clear with this. So what are the muscles we have discussed? एक हो गया brachioradialis, एक हो गया extensor carpi radialis longus. Longus होगा तो brevis होगा, मेजर होगा तो माइनर होगा, लॉन्गस होगा तो ब्रेविस होगा. एक्सटेंसर कार्पी अल्नारिस, डिजिटोरम डिजिटी मिनिमी मतलब लिटिल फिंगर, or anconeus. Okay, anconeus, you also keep it in the posterior compartment here, and even sometimes discussed in the forearm also, small screwing muscle. Okay, right. So guys, before I go to the next clinical point here, all of you are clear with this? All of you are clear with whatever I've discussed over here? जल्दी बताओ. Right. Now remember one thing, guys. All of you look here. Remember, this is my finger. Right? If I'm able to flex my finger, why? Because there is a tendon here called as flexor tendon. If I'm able to extend my finger, how? Because of a tendon on the top here called as extensor tendon. Okay. Now what I'm telling you is, अगर ये flexor tendon cut हो गया, then what will be the position of my finger? My finger is all the time like this. क्यों? क्योंकि extensor tendon is pulling my finger up. Right? If my extensor tendon is cut off, then what will happen? My flexor tendon will pull my finger down. You're clear with that? Now remember this particular thing. For example, if my flexor tendon is cut off, okay, flexor tendon is cut off. So where is your flexor tendon? Let us say this is your flexor tendon, and I'm cutting your flexor tendon over here. I'm cutting your flexor tendon. Then what will happen? What will happen is that my finger is going up all the way like this, right? So this kind of condition, this finger, you call it as jersey finger. This finger you call it as jersey finger. In the same way, agar extensor tendon cut off hua, then what will happen? Don't you think, guys, my finger looks like this? You see, the finger is bent in this way. My finger is bent in this way. Why? Because extensor tendon is cut off. Then this finger is called as mallet finger. क्या है ये? What is this finger called as? Mallet finger. This finger over here is called as your mallet finger. Okay. So one you call it as a jersey finger, और दूसरा क्या है? Mallet finger. I want all of you to remember. Very good. Rahul is telling that this is swan neck deformity. Very good, Rahul. Swan neck deformity. Very good. This is your swan neck deformity. Guys, now I'm going to show you a picture. You will answer me. Actually, this is from the orthopedics part which I'm discussing right now. I will show you a picture, X-ray. You will tell me ये कौन सा finger है, ठीक है? ये देखो, बताओ. What tendon might have been ruptured? और ये what will be this? Tell me very fast. Suffical Jones fracture is in the lower limb. I will discuss it in the lower limb. Very good. ये क्या होगा? नीचे जो होगा jersey. Guys, simple way to remember. You remember jersey cow? Jersey cow है ना? मोटा सा jersey cow. Now where do you basically in the jersey cow, right? If you need the milk, where do you take it from? You take it from the nipples, right? Nipples are on the top or below. Below मतलब क्या? Flexor. So jersey is below. Okay. M for what? Moon. Where is moon? Moon is on the top. M for mallet. Okay. Remember like this. Something I tried. Remember like that. Okay. Chalo. Now coming to the next most important topic over here, that is your cubital fossa. Cubital fossa मतलब क्या है? ये देखो यहाँ पे जो injection देता ना, the blood which you take, the sample which you take from here, this is your cubital fossa. This cubital fossa is very, very dangerous region and very, very important over here. Cubital fossa is having three important borders. So all of you just look at this particular picture. Okay. ये देखो. Here you have got a border like this, right? Here you have got a muscle. Here you have got another muscle like this. Okay. So this is your medial epicondyle. This is your lateral epicondyle. Muscle that is present to the medial epicondyle is your pronator teres. हमने already discuss किया. The first muscle present in the lateral epicondyle is brachioradialis. याद है? यहाँ पे हमने discuss किया already. Brachioradialis. Right? So cubital fossa is having three borders. ये देखो, this is called as the base of cubital fossa, this is called as the medial border of cubital fossa, और ये जो है lateral border of cubital fossa. Base of cubital fossa क्या है? Base of cubital fossa is nothing but it is a line joining medial epicondyle to lateral epicondyle. Medial border of cubital fossa is having what? Pronator teres. Lateral border of cubital fossa is having your, what is this muscle? This is your brachioradialis. Okay, this is your brachioradialis. So what are the contents that are present from lateral side to medial side? From lateral to medial, you have got R tan. R tan क्या होगा? R stands for radial nerve, T stands for tendon of biceps, A stands for artery, brachial artery, and N stands for nerve, median nerve. Median nerve. Okay, all of you just look at this. Look at this. If they give you such picture and ask you, will you be able to answer it right? All of you tell me, what is this? This is called as your brachioradialis, and this is called as your R. R matlab radial nerve. This is called as your T. T matlab tendon of biceps. This is your artery, brachial artery, और ये हो गया nerve. What is this nerve? Median nerve. और ये हो गया second part, that is your pronator teres. So this is your cubital fossa from your lateral direction to your medial epicondyle. Lateral to medial epicondyle. Okay. So if they ask you the cadaveric image also, you must be able to answer. Okay. I don't think so it is difficult to look at this cadaveric image here. Okay. Right. Now let us discuss about the muscles of the hand over here, guys. Now coming to the muscles of the hand, guys, tell me, very easy muscles. Okay. See here, यहाँ पे जो muscles है, these are called as a thenar muscles. यहाँ पे जो muscles है, these are called as a hypothenar muscles. क्या है ये? Thenar muscles, or these are called as hypothenar muscles. Okay. How do you remember them? How do you remember them? Remember it as AFOA. Okay. ये देखो AFOA, and this is AFOP. AFO is common. यहाँ पे ये होगा, यहाँ पे P होगा. Okay, so what is AFOA and AFOP? What is this? All of you look here. A stands for abductor, F stands for flexor, O stands for opponents. Okay, all of them, what is a common thing? Pollicis brevis. Pollicis matlab little finger, brevis is a short muscle. Okay, pollicis brevis. Abductor pollicis brevis, flexor pollicis brevis, opponents pollicis brevis. AFO, and A is what? Adductor pollicis. The same things will be repeated on to the other side also. ये देखो, यहाँ पे abductor है, यहाँ पे भी abductor, यहाँ पे flexor है, यहाँ पे भी flexor है, यहाँ पे opponents है और यहाँ पे भी opponents है. The only difference is, guys, here it is adductor pollicis, here it is palmaris brevis. This is the only difference which you need to know. And you know, thumb is called pollicis, so I have written pollicis everywhere. Little finger is called digiti minimi. I have written digiti minimi there everywhere. Okay. So these are the muscles of the thenar and hypothenar. Lumbricals, how many are there? 4. 1, 2, 3, 4. Palmar interosseous, 1, 2, 3, 4. Dorsal interosseous, 1, 2, 3, 4. Now, what is a nerve that is innervating? Can you see an yellow color box here, guys? ये देखो, ये यहाँ पे एक yellow color box है जिसमें in this 3 muscles are there. Here in lumbricals also 2, right? So whatever is drawn in yellow, right, are innervated by median nerve. ये yellow box छोड़ के बाकी सब, they are innervated by ulnar nerve. Okay, so all muscles in yellow are innervated by median nerve. What is that? Innervated by median nerve. Remaining all muscles are innervated by ulnar nerve. Is it clear to everyone? Yes or no? Clear, innervated by ulnar nerve. Okay, right. Remember one thing, most of you make this mistake. Whenever I tell claw hand, you just tell ulnar nerve, only ulnar nerve. No. If it is a total claw hand, then ulnar nerve के साथ median nerve, ulnar nerve and median nerve. If it is a partial claw hand, then only ulnar nerve. Keep this thing in mind. If ulnar nerve is damaged, only ulnar nerve is damaged, that will lead to partial claw hand. ये देखो, guys, ये हो गया partial claw hand और ये हो गया complete claw hand. ये देखो, partial claw hand और ये हो गया complete claw hand. Complete claw hand is because of ulnar and median. Partial is because of only ulnar nerve. Okay, right. So all of you are clear till here? 10 more pages left. We shall finish up the upper limb. I shall give 5 minutes break for you, and then we shall start the lower limb. Only this part is a high. Yeah, and by the way, why adductor pollicis is called as a graveyard of ulnar nerve, right? Why adductor pollicis is a graveyard of ulnar nerve is, ye dekho, ulnar nerve will travel all the way from behind the medial epicondyle, hai ki nahi? It is coming all the way, supplying all your hypothenar muscles. It is making a U-turn, and finally this nerve will end in one muscle in the thenar region. What is that? Adductor pollicis. Here the nerve is finished. Yahan se there is no nerve. So the entire nerve from here all the way it is coming down, and finally it is ending up here. इसीलिए इसको बोलते हैं graveyard. This is the last point, last journey of ulnar nerve. Okay, right. So all of you look at lumbricals. Whenever I tell lumbricals are like this. Whenever I tell lumbricals, all of you put your hand in the form of an inverted L shape. Okay, L shape. What are these joints? Metacarpophalangeal joints. What are these joints over here? Interphalangeal joints. Ab dekho, I have done flexion of metacarpophalangeal joints. I have done extension of interphalangeal joints. Flexion of metacarpophalangeal, extension of interphalangeal. This is the action of lumbricals. If you look at the lumbricals, first two lumbricals 1 and 2 are what? Unipinnate. But whereas 3 and 4 are bipinnate. And unipinnate 1 and 2 are innervated by median nerve. 3 and 4 are innervated by ulnar nerve. I already told you. यहाँ पे yellow में जो है, that is median nerve. बाकी सब ulnar nerve. Okay, बाकी is ulnar nerve. Next, coming to palmar interossei and dorsal interossei. Okay, palmar interossei R4, dorsal interossei R4. ये देखो guys, palmar interossei all of them are unipinnate. है कि नहीं? Look at dorsal interossei, all of them are bipinnate. है कि नहीं? Now, which finger is not having palmar interossei? देखो, first one is having, second one is having, third one is not having, fourth one is having, and fifth one is having. So they have asked a question once that what is this? Metacarpal devoid of palmar interossei is third metacarpal. Okay, all are unipinnate, all are bipinnate. अभी action क्या होगा? Palmar interossei, P stands for what? Pad. What is pad? P stands for palmar interossei. AD stands for adduction. What is that? Adduction. Guys, you know what is this action called as? Adduction. What is this action called as? Abduction. So adduction is happening because of palmar interossei. Abduction is happening because of dorsal interossei. Okay, keep this thing in mind. Abduction. What is this? Palmar interossei. And what is this? Dorsal interossei. Okay, ये देखो adduction, abduction. Okay, adduction and abduction. Guys, still here everyone is clear? I'm going to right now discuss which areas the nerve injuries will happen. I told you 100% one question is going to come from nerve injuries. I told you. I also told you that I will discuss what are the different kinds of nerve injuries, what are the patient's presentation and all. Right? If you are clear, then I'm continuing with this. All of you are clear with this? Clear? Share the live session to your friends, guys. From that time onwards, I'm seeing the people over here are 80, 90. Let's make it 100. Chalo. Coming to the nerve injuries, all of you listen carefully. Very, very clearly listen. I'm going to explain you here. First is your radial nerve. Radial nerve का root value होगा C5T1. ठीक है? और ये देखो, radial nerve is coming down all the way, coming down, and radial nerve is passing behind, right? And again it is coming down all the way, coming down, passing above which epicondyle? Lateral epicondyle. ठीक है? But before it is passing above lateral epicondyle, listen. Before it is passing above the lateral epicondyle, it is giving one branch, और ये branch का नाम क्या है? Extensor carpi radialis longus. I think we discussed somewhere extensor carpi radialis longus. याद है? Extensor point से लिखा, radius to the carpal bones on the radial side. So extensor carpi radialis longus. उसके बाद this nerve will pass over the lateral epicondyle, divide into two branches. One is called superficial branch, another one is called posterior interosseous nerve. Okay, posterior interosseous nerve. So this superficial branch will cause sensation on the dorsum of the hand. On the dorsal part of the hand, if you are having a sensation, it is because of this radial nerve. Okay, and what is posterior interosseous nerve doing? Agar posterior interosseous nerve damage hua, you will have finger drop. What is this? Finger drop. So what are the three important things, guys? Ye dekho. First important thing. For example, in my body, if extensor carpi radialis longus is cut off, okay, then what will happen? I will have wrist drop. Wrist drop is because of extensor carpi radialis cut off. Next, if I have no sensation on the dorsum of my hand, it is because of superficial branch damage. Okay, injury to superficial branch. If I have finger drop, it is because of posterior interosseous nerve. Clear? These are the three important problems you encounter in case of radial nerve injury. Radial nerve injury. Right? Now, ye dekho. First, let us discuss about axilla. Three level of injuries, guys. What are the three levels of injury? Agar mujhe injury axilla ke region pe hua, someone has stabbed with a knife, or maybe I have got a fracture of my mid shaft, or let us say posterior interosseous nerve has been damaged. What will happen? The first important thing, all of you look. If I have damage in the level of axilla, that is called as crutch palsy. अगर axilla पे damage हुआ, this is called as crutch palsy. Crutch palsy में क्या क्या होगा, guys? You tell me now. If the nerve is cut off here, if the nerve is cut off, injury number one, what will happen? Patient will have wrist drop. Patient will have wrist drop. Patient will have no sensation on the dorsum of the hand. Patient will have finger drop. All these three things will be there, yes or no? ये देखो, wrist drop होगा, no sensation on dorsum of the hand, finger drop. All these three things are seen in case of crutch palsy. All of you should keep in mind crutch palsy. Okay? Second level of injury. Agar mid shaft fracture हुआ मुझे, again the same things, again all these three things will be gone. So what did I tell? Mid shaft fracture will lead to radial nerve injury, and that would lead to again all these 1, 2, 3, all these same things. Okay? For example, if I have a fracture of my lateral epicondyle, ये देखो, यहाँ पे lateral epicondyle cut हो गया. Okay? If my lateral epicondyle is cut, then what will happen? No sensation on dorsum of the hand and finger drop. But will I have wrist drop? No, wrist drop will not be there. Finger drop will be there and no sensation on the dorsum of the hand. ये देखो, if I have medial epicondyle fracture, no sensation on the dorsum of the hand and finger drop, but wrist drop will not be there. Isolated radial nerve injury मतलब क्या? Isolated मतलब only posterior interosseous nerve will be damaged. बाकी सब ठीक है? This would lead to what? Finger drop. So these are the four different types of injuries at four different levels. Guys, tell me, all of you have understood radial nerve injuries? Before I move on to the next nerve, जल्दी बताओ. Clear? All of you are clear? All of you are clear? Very good, very good, very good, very good. Now, Mantis, vancomycin, you are clear. Rahul is clear. Safikul, Sneha, Shalvi Gaur, Little Shiny Vlogs, all of you are clear. Good morning. All of you are clear? Right. Now let us go on to the next important nerve, that is your median nerve. And median nerve is C6T1. Okay? But in some individuals, fibers also come from C5. Okay? Fibers also come from C5. अब मीडियन नर्व कैसे डैमेज होगा? गाइस, मीडियन नर्व डैमेज, रिमेंबर अगेन स्टार्टिंग में मैंने बताया था, सुप्राकॉन्डाइलर फ्रैक्चर हुआ तो मीडियन नर्व डैमेज होगा, राइट? ये देखो, सुप्राकॉन्डाइलर फ्रैक्चर. सो if supracondylar fracture will happen, two important things you see. One is called ape thumb deformity, one is called pointing finger deformity. I will show those things right now in a minute, okay? Just remember, S for supracondylar, AP for ape thumb, pointing index. Okay, so remember it as SAP. Remember it as SAP. Next, carpal tunnel syndrome करके एक होगा, ठीक है? For those of you don't know, here you will have flexor retinaculum will completely contract, leading to median nerve injury. Carpal tunnel syndrome में भी क्या होगा? There are two things. Aphthum deformity will be there, but no pointing index. See guys, remember this. Supracondylar fracture में SAP, AP will be there. Aphthum deformity, pointing index. But नीचे carpal tunnel you will have only aphthum deformity, no pointing index. So one is called higher injury क्योंकि यहाँ पे हुआ, another one is called as lower injury which happened here. Okay, these are the two important points you need to remember regarding your median nerve. Clear? Median nerve के बाद the next important nerve is ulnar nerve. Guys, all of you remember ulnar nerve injuries are called as paradoxical injuries. क्यों? क्योंकि normally अगर higher level पे injury हुआ, the damage will be more severe. If lower level injury will happen, the damage will be less severe. ठीक है? But for ulnar nerve it is vice versa. अगर higher level पे injury हुआ, damage will be less severe. अगर lower level पे injury हुआ, the damage will be more severe. That is why you called as ulnar nerve injuries are paradoxical injuries. For example, ये देखो, higher ulnar nerve injury lead to less severe claw hand. Lower ulnar nerve injury will lead to more severe claw hand. Where is the location? Elbow and wrist. Okay, elbow matlab guys, all of you know medial epicondyle fracture. Medial epicondyle fracture, याद है ना? Medial epicondyle fracture. So just look at this picture guys. Bending कहां पे ज्यादा है? Where is the bending more? ये देखो, bending is more here. मतलब more severe होगा कि less severe? More severe. More severe मतलब where might be the injury? At the level of wrist. So ulnar nerve injury, more clawing. Okay. Next, ulnar nerve injury at the elbow, less clawing. Clear? Less clawing. Is it clear? So again I'm telling you, just remember, ये देखो, if I'm bending my fingers a little bit, this is because of ulnar nerve damage. Okay. This is less severe injury. Okay. If I'm bending my fingers more like this is called more severe injury. Okay. If I'm bending all of my fingers like this is called total claw hand. Total claw hand में क्या होगा? Ulnar nerve और median nerve दोनों involve होगा. Right? This thing you have to just clean it up in your mind. So this is all about ulnar nerve. So what did I tell you? Median nerve injury में aphthum deformity, pointing finger deformity होगा ना? ये देखो. Median nerve injury, this is called aphthum deformity. In aphthum deformity, thumb cannot flex, cannot oppose, cannot abduct. Thumb ऐसे ही होगा, straight, statue. Okay. So inability to abduct, flex and oppose. This is called aphthum deformity. Next, pointing finger deformity. This is also because of median nerve only, but uska, there are two other names for that. Ochsner clasp test and benediction test. ये test क्यों बोल रहे हो? Why are you calling it as test? I tell the patient to make a fist. When I tell the patient to make a fist, he is not able to bend his fingers like this. You see, he will make a fist like this. He'll try to make a fist but is not able to bend his index finger. Okay. Why is he not able to bend his index finger? Because you see, paralysis of flexor digitorum superficialis. So keep this MCQ in your mind. Agar flexor digitorum superficialis palsy hua, then the patient will not be able to bend his finger. And this test is called as benediction test or Ochsner clasp test or pointing index. Okay. Next, pen test. I told you finger, you cannot raise the finger like this in this patient, right? You keep the pen like this and tell the patient to touch the pen like this. If he is able to touch, it's fine. If he is not able to touch, it means his median nerve is damaged, right? So what is in pen test? What is the muscle you test for? Abductor pollicis brevis. Okay, no abduction, not able to touch the pen. Keep these things in mind, guys. Very, very, very important. Pen test has been asked previously. Even in NEET PG exam also pen test has been asked. Even in INACT also they have asked. So obviously in major exams they have asked. I don't think so they won't ask you here. Right? They will definitely ask you here. Okay? Keep this thing in mind. Next, coming to the ulnar. What did I tell you guys? Palmar interossei responsible for this action, if you are doing this action, it means even if I am putting a paper in between your fingers and trying to pull it, right? You're not letting the paper go. But if my palmar interosseous damaged, this action is weak. So if you put a paper like this and try to remove it, you can very easily let go of the paper. Okay, so that is a test which you do here for palmar interosseous. Okay, that test you call it as card test. You put a card or paper, whatever it is. Next test is called as Igawa test. Igawa test you do for dorsal interosseous. You put the middle finger, you put the fingers on the table and try to spread your fingers like this and try to move the middle finger like this. Okay, if you are trying to move the middle finger like this, it means the Igawa test is fine. Okay. Next, book test, the same thing for adductor pollicis, again for the ulnar nerve only you do, right? And this particular sign, what is this sign? You catch a book like this. Okay. Now when I'm trying to pull, you see you are making a sign over here. You see slowly, this sign, pyramidal sign which you are making over here is called as formant sign. You see this sign over here is called formant sign. Okay. Right, so these are the important things which you need to know over here. Okay, so these tests are very, very important to know. Okay, so they have asked once that the median nerve is damaged in case of carpal tunnel syndrome, median nerve is damaged in case of और एक क्या था वो, what was that, supracondylar fracture, right? Supracondylar fracture or even pronator syndrome, maybe median nerve damage होगा. Next, ulnar nerve is damaged in case of cubital tunnel syndrome and Guillain Canal syndrome. Now, I cannot discuss in detail what are these, right? Just remember it like that. They are not going to ask you what is cubital tunnel syndrome and all. The only important thing is carpal tunnel. Just remember it as cubital or Guillain में कौन सा nerve damage होगा, ulnar nerve. Pronator syndrome और carpal tunnel में कौन सा nerve damage होगा, median nerve. That is enough. Okay. Guys, बताओ जल्दी. Till here all of you are clear? Yeah? Right? Very good. Now all of you look at carpal tunnel syndrome. So I hope all of you have studied carpal tunnel syndrome a number of times. You know, this is a definite question, carpal tunnel syndrome. Every year they are asking you this question, right? So you just need to know what are the contents of carpal tunnel syndrome. Okay. So carpal tunnel syndrome मतलब एक ही nerve याद आना चाहिए, that is median nerve. So obviously that will be the content. इसको छोड़ के बाकी you have got few muscles. Okay. Flexor digitorum एक होगा profundus, flexor digitorum superficialis, flexor pollicis longus. Okay, these are the three extra muscles that are going. Next, so if this is a tunnel के अंदर से क्या जा रहा है? These are the three things. But above the tunnel, what things are going? Above मतलब superficial, SUP. S stands for what? Superficial. U stands for what? Ulnar nerve. P stands for what? Palmaris longus, palmar cutaneous branch. Okay, palmaris longus and palmar cutaneous branch of median nerve. Okay, so these are the structures that are passing. Yes, more than enough. FMGe free videos, more than enough. So these are the structures that are passing above. Okay, these are the structures that are passing above. So guys, if you want to remember this, remember it. In ortho, they will ask you, orthopedics, right? What are the symptoms that you see? Burning sensation, tingling sensation in 1, 2, 3, 4.5 fingers. Okay. Loss of sensation or numbness, worse pain at night, right? And there is also another thing which is not taught usually in FMGE, that is your flick sign. Flick sign matlab when you try to shake the hand like this, the pain will go away temporarily, but later on again compression will happen, pain will happen. Symptoms improve by shaking the hand. No sensory loss over the palmar region. These are the few important things here. Okay. Next important thing is, what are the two important tests you do? What are the two important tests is that you take the patient's hand, right? You bend it, you extend the wrist like this and try to tap it here. When you try to tap it here, if patient is having a tingling sensation in his fingers, this is called tinel. Tinel is tingling. You are tapping, T for tapping, T for tingling, T for tinel. Okay, that is your tinel test. What is Fallon test? Fallon test मतलब रिवर्स टिनल टेस्ट को Fallon test बोलते हैं. ये टिनल टेस्ट हो गया, ये Fallon test हो गया. Fallon test मतलब उल्टा नमस्कार. Okay, you do the namaste like this. You are flexing your wrist at how many degrees? 90 degrees, not extending. Question paper में extension at 90 degrees होगा. That is wrong. Flexion at 90 degrees like this. Okay, that is your Fallon test. तो यहाँ पे क्या होगा? Compression होगा यहाँ पे, and that would lead to the pain in the hand. Okay. Tinal, Fallon, both are the tests done for carpal tunnel. Okay, Tinal, Fallon for tunnel. Keep this thing in mind. Anatomical snuff box, very important question that is asked. Anatomical snuff box. So all of you, when you lift your thumb like this, right here, you can see this snuff box over here. On this snuff box, can you see a tendon over here, long tendon that is passing? This is called as extensor pollicis longus. Longus होगा तो brevis होगा, extensor pollicis brevis. Apart from this, ये देखो, just look at this. ये देखो, this tendon over here is extensor pollicis longus. कहाँ पे है ये? Where is this? On the medial side. Okay, longus होगा तो क्या होगा? Brevis होगा. See, extensor pollicis brevis. Okay, along with that there is abductor pollicis longus also. I just want you to remember EAE. What is EAE? One E stands for extensor pollicis longus, another E stands for extensor pollicis brevis, A stands for abductor pollicis longus. Out of these two muscles are located laterally, और ये single muscle जो है that is located medially. Okay, so here this box which is formed over here is called anatomical snuff box. What is this? Anatomical snuff box. Sir, बहुत दिक्कत हो रहा है. How do you remember this? Remember by a mnemonic BABE, which you guys have, right? BABE. What is BABE? B stands for brevis, extensor pollicis brevis. AB stands for what? AB stands for abductor pollicis longus, and E stands for extensor pollicis longus. I think this is the perfect mnemonic to remember it. Okay, B stands for brevis, AB stands for abduction, E stands for extensor pollicis longus. Okay, so if they give you a cadaveric image also, you should be able to answer. So cadaveric image maybe it is very pretty clear over here. ये देखो, you have got extensor pollicis longus over here, you have got extensor pollicis brevis over here, and you have got abductor pollicis longus. And next important thing is that ये बीच में ये जो box दिख रहे हैं ना आप लोगों को, can everyone see this box? ये देखो, can you see this particular box? This box over here is called as anatomical snuff box. Okay, so what are the contents of anatomical snuff box? So remember the mnemonic CAST, C-A-S-T. C stands for what? Cephalic vein. A stands for artery. कौन सा artery होगा? Radial artery. Radial side पे radial artery होगा ना, right? Next, S and T. S and T stands for scaphoid as well as trapezius. That is the reason why I have been telling you scaphoid fracture जब भी होगा patient को, anatomical snuff box में there is tenderness. In the starting I told you, if there is tenderness in anatomical snuff box, then that is a scaphoid fracture. Okay, so these are the contents which you have to remember. And the borders, lateral में क्या है? दो चीजें हैं, और medial में क्या है? सिर्फ एक चीज है. That thing you have to remember. Okay, guys, tell me what is this? Fast. क्या हो गया? You guys will sleep in the night time. That is why I have kept a session in the daytime. And daytime also you are sleeping. Robin, very good. Robin, very good. Robin, Marinette, Mantis, Shalvi, Akbar, all. Where were you guys till now? You guys are answering nice. Why didn't you answer from the starting? Very good. This is called as wrist draw. What is this called as? This is called as wrist drop, and wrist drop is because of what? Radial nerve injury. Very good, Mulamu, perfect. This is because of radial nerve injury. अब ये पता क्या है? Saturday night palsy. So in Saturday night palsy, he is resting his axilla on the chair. So in the axilla there is a compression going on. अगर axilla में compression हुआ तो crutch palsy बताया था, याद है? Right? So what is happening over here? All the three important manifestations you see. So this is called as Saturday night palsy. और यहाँ पे भी you see the radial nerve injury, compression. And what is this? अभी नहीं, एग्जाम के पहले नहीं, एग्जाम के बाद, ठीक है? So what is this? This is your crutch palsy. ठीक है? In crutch palsy what is happening? Axilla is compressed, ठीक है? And radial nerve is damaged. So crutch palsy, Saturday night palsy, all these are the names that are given for this thing. And what is this? Honeymoon palsy, right? You guys know better, right? You guys know in and out about honeymoon palsy. I know because I can understand the climatic situations over there. So in honeymoon palsy also what is happening, right? You put a hand, right? If she is sleeping on your hand here, right, on your arm, so what is happening? Directly the weight of her head, right, the weight of her head is compressing your arm. So when it is compressing your arm, your radial nerve is compressed. Yes or no? Your radial nerve is compressed. So that would lead to, don't tell you don't know anything. Okay? Come back. I can figure it out. पुराने दिन याद आ रहे होंगे, है ना? Come back. ठीक है? Once you are done with the exam perfectly, once you pass, ठीक है? Once if you pass, then फिर से वापस जाना, रेशन विशन सब कुछ. But अब तो let us land on brachial plexus, ठीक है? So all of you know the concept of brachial plexus over here, guys. Brachial plexus, the first thing is RTDC, roots, trunks, divisions, cords. Roots, trunks, divisions, cords. Okay. Now in brachial plexus, I'm not going to teach you how to draw brachial plexus, but what I'm telling you is that brachial plexus mein na, there is one very important point. All of you just look here. This is called as C5 C6 point. Is C5 C6 point mein na, there are few nerves which you should know. One is called dorsal scapular nerve. Another one is called suprascapular nerve. Third one is called nerve to subclavius. So all these three nerves, all of them are present at a single point. Ye point ka naam hai, what is this? This point is called as Erb's point. Okay, what is this point? Erb's point. So what are the things that are present in Erb's point? Ye dekho, C5 root, C6 root ho gaya, and next dorsal scapular nerve ho gaya, suprascapular nerve ho gaya, nerve to subclavius. So all of them are present in the Erb's point. Next, C5, C6, C7, C5, C6, C7. From all of this, you see a very long nerve that is running down. What is this long nerve that is running down all the way? Long thoracic nerve. Now tell me very fastly, long thoracic nerve is innervating which muscle? I already discussed. यहाँ पे होगा, what is that? Serratus anterior. ठीक है? Serratus anterior अगर paralysis हुआ, right? Then that would lead to medial winging of scapula or lateral winging of scapula. Medial winging of scapula. Very good. So what are the nerves that are present, guys? You just have to look at this and remember this. Posterior, lateral और medial में क्या क्या होगा? The mnemonic to remember the posterior one is ulnar. U stands for upper subscapular, L stands for lower subscapular, nerve to latissimus dorsi, axillary and radial. ठीक है? Lateral, L stands for LML. ये देखो LML. Next median, M4U. 4 M होगा, M and U. U is your ulnar nerve. So I'm not going to discuss these things क्योंकि ये यहाँ पे this is just a memory part. PDF भेज दूंगा वैसे क्लास के बाद. After in that PDF you better see all these things. Okay. So, Erb's palsy, policeman tip deformity or waiter's tip deformity, all of them are same. Erb's palsy is because of C5 C6 injury. C5 C6 is on the top, so you call it as upper trunk injury. And this is the most common birth injury. Okay, this is the most common birth injury. So, what is happening here? What is happening is patient's arm is first adducted to the body. Yes or no? It is adducted to the body and it is medially rotated or internally rotated and wrist is flexed like this. Okay. So first important thing, why patients, listen here, listen. Why patient is having flexion of wrist? क्योंकि wrist का extensors जो है they are weak. Why patient is having adducted to the body, arm adducted to the body? क्योंकि abductors जो है they are weak. Why patient's arm is internally rotated? क्योंकि external rotators are weak. Clear all of you? External rotators are weak. Okay. So what are your abductors over here? Remember the mnemonic SAD. S stands for what? Supraspinatus. A stands for what? Abductors. D stands for what? Deltoid. What are external rotators? SID. Remember it as SAD, SID. Okay. S stands for supraspinatus. I stands for infraspinatus. Okay. So these are the things. But overall, what muscles are weak are BBB. BBB in the sense biceps, brachialis and brachioradialis. These are the three muscles that are paralyzed over here. So upper trunk injury is C5, C6. वो Ebb's palsy हो गया. अभी lower trunk injury क्या है? Lower trunk is C8, T1, that is called as Klumpke's palsy. What is that called? Klumpke's palsy. Okay. In Klumpke's palsy, what will happen? What did I tell you? You will have damage to both median nerve and ulnar nerve. अगर median nerve, ulnar nerve दोनों damage हो गया, then patient will have such kind of hand. What is this? This is called as total claw hand. Yes or no, guys? Total claw hand में what are the two nerves? Median and ulnar nerve. ये देखो total claw hand. ये देखो ऐसे होगा total claw hand. Okay? Total claw hand. अगर partial claw hand है तो only ulnar nerve. Okay? Next, injury. ये देखो C8 to T1, right? In most of the books it is given injury to T1. Injury to T1 will lead to Horner syndrome. Galat, wrong. Okay? Injury to white ramus of T1. Spinal cord में white ramus होगा, grey ramus होगा, right? अगर white ramus of T1 injury हुआ, that would lead to Horner syndrome. Okay? In Horner syndrome, what do you see? You see meiosis, मतलब constrict होगा pupil. Anhidrosis, मतलब one side there is no sweating. और ptosis, मतलब ये eyelid जो है ऐसे droop हो जाएगा. ठीक है? This is called ptosis. Okay? Meiosis, so just remember it as MAP. Horner syndrome. You made a map to become horny. ठीक है? Map to become horny. So M stands for what? Meiosis. A stands for anhidrosis. P stands for ptosis. Clear all of you? Right. ये देखो हमारा दोलान बाइक, so he is having this Horner syndrome, right? So this is a Horner syndrome which is having this condition here, and यहाँ पे भी देखो this is another patient over here, right, where you have meiosis, constriction of pupil, and ptosis on to one end over here, right? So these are the things over here which you can see. Clear all of you? Right. Now let us discuss the last few parts over here. Two important arteries are very important. एक हो गया axillary artery और एक हो गया subclavian artery, right? Now what is this particular picture? What is this particular picture over here is that, ये देखो guys, ये हो गया coracoid process. Coracoid process से कौन सा मसल आएगा? Pectoralis major, right? Pectoralis major or minor? I'm sorry, I think it is pectoralis minor, right? ये pectoralis minor होगा ना? एक बार correct me. Yes or no? Pectoralis minor होगा ना? Right. So medial lip. When it is medial lip or medial lip, MET, T for teres major. Okay. So the same muscles I have kept it down over here. Okay. ये क्या है? First rib हो गया, pectoralis minor or teres major. Now the first artery that is coming out here is your subclavian artery. Subclavian artery कहां तक है? ये देखो, subclavian artery is coming down all the way to the lateral border of the first rib. Okay, ये देखो, subclavian artery extends till the lateral border of first rib. Lateral border of first rib से कौन सा artery शुरू होगा? That is your axillary artery. Okay, ये देखो, axillary artery starts from the lateral border of first rib to the lower border of teres major. ये देखो, lateral border of first rib लेकर lower border of teres major till here is your axillary artery. How many parts are there? 3 parts. First part here above pectoralis minor, second part behind pectoralis minor, third part below the pectoralis minor. ये देखो ये third part हो गया. So first part will give one branch, second part will give two branches, third part will give three branches. One for one, two for two, three for three. ठीक है, ये देखो. How do you remember this? How do you remember this? Is that remember a mnemonic? 16s, ठीक है, 16s love songs and poems. ये याद रखो. ठीक है, ये देखो 6 teens love songs and poems. So S stands for what? Superior thoracic artery. ठीक है. T stands for what? Thoracoacromial artery. L stands for lateral thoracic. Songs and poems. Subscapular. A for anterior circumflex. P for posterior circumflex. Okay. So these are the things which you just have to remember it. Okay. Just remember it here. Okay. Next important thing is your subclavian artery. So I have already drawn a picture here. अगर पिक्चर देख के सीखना है, it is your wish. I'm not explaining you the picture. There's nothing to explain. Just by looking at it, you can understand here. Without picture, if you want to remember also, that is well and good. Okay. Just remember this thing, that subclavian artery is having three parts. Okay. These are the arteries. Sir, how do you remember? It is very difficult, blah, blah, blah and all. Remember the mnemonic vitamin C and D. All of you know vitamin C and D. What is vitamin? V stands for vertebral artery. I stands for internal thoracic artery. T stands for thyrocervical trunk. Vitamin हो गया. C and D. C stands for costo. D stands for dorsal. ठीक है. So costo as well as dorsal. These are the parts. First part, second part, third part. All of you are clear with this, guys? Yes or no? All of you are clear, perfectly clear. So this part, whatever I have discussed so far, guys, Mantis, you are clear. Mantis, Shanvi, right? Vancomycin, Rahul, Akbar. What about Sneha, Ramchandra Rao? Ramchandra Rao, you are clear. Anu, everyone is clear. Guys, whatever I have discussed right now, this will complete your entire upper limb, and मैं 100% guarantee दे रहा हूँ. Compared to the last time rapid revision session which you have taken, from which 8 questions directly repeated from that session. Okay, so compared to that, this is much more updated. I mean, I've included a lot more topics. अगर कोई मेरा पुराना sessions भी attend किया होगा तो you guys might have known this thing, right? So what we'll do is that let us take a break for how many minutes break shall we take? Just 3 minutes, 4 minutes. Okay. Again, if you guys go away, it is very hard to take you back. 4 minutes break, 4 or 5 minutes. Okay, maximum 5 minutes break. Okay. Yeah, 5 minutes break, that too because the mic batteries have to be changed. So just 5 minutes break and then we will start with the lower limb. Okay. So guys, goodbye, take care and love you all. Hello guys, how are you all? Welcome back after a refreshing 5-minute break. 50 अब बाकी 30 कहाँ गए? 30-40 स्टूडेंट्स कहाँ गए? चलो, shall we start now? We shall start discussing the lower limb now. Lower limb is a short part. We shall finish it up very fastly. So all of you are with me now. Everyone, Diclofenac, Major Bharatwaj, Ali, Bakir Khan, all of you, come back. Anu, vancomycin, Shalvi, Sneha, Henry, Wesley, Molamu, all of you are here. Mantis, very good. Very good. Right, Demi, very good. Yeah. Chalo, then let's start now. If you want, guys, you can have your lunch. Take your plate, have your dishes in front of you, sit there and eat happily and just watch. Because approximately it will be for another 4 hours. Yeah, 4 to 5 hours. Right. Coming to this, let us discuss about the lower limb now. Now here in the lower limb, what are the important things you can see over here, right? So basically the lower limb starts from this particular point over here, right? So this particular point, this is your anterior superior iliac spine, this is your pubic tubercle. Okay, दोनों के बीच में what do you have? You have got your inguinal ligament. Okay, so from here the lower limb starts. Okay, so what I am trying to do is that I am going to make a cut section of this and I am going to show it to you here. But before that, all of you know that, you know guys, we have got the femur is resting on tibia. All of you know, abhi ye femur hai, ye tibia hai, it is resting on tibia. Now what I am doing is that I am removing the femur. Abhi ye tibia hai na, this is tibia. If you are looking from the top of the tibia, what are the structures that are present from anterior to posterior, from front to back? What are the structures do you have on the tibia? There's a very important question here. All of you look here. This is the tibia. ये posterior end है और ये हो गया anterior end. Okay, so what are the structures over here? First important thing, this one over here is called as your medial meniscus. What is this called? Medial meniscus. और ये हो गया lateral meniscus. Medial meniscus has got an anterior limb. Medial meniscus has got an anterior limb and posterior limb. No problem, you can eat. Okay. It has got an anterior limb, it has got a posterior limb. Lateral meniscus also has got an anterior end over here, it has got a posterior end, right? And next important thing, सामने ये जो ligament है, this is called ACL, और ये पीछे जो ligament है, this is called PCL. Now guys, I have drawn just a shade over here. Now tell me what you can see one by one. First, what you can see here? First you can see anterior end of medial lemniscus. Yes or no? Anterior end of medial lemniscus. Just behind that, what is this ligament you can see? ACL. ACL के पीछे what you can see? Anterior, again you come across this anterior limb of lateral meniscus, posterior limb of lateral meniscus, again posterior limb of medial meniscus, and lastly you have got PCL. Okay, so I want you to remember these three things here. Okay, so all of you just look over here, the same things are given over here. It is MCL, LMC. Okay, so already Mantis has mentioned here, very good Mantis. So it is MCL, LMC. Just keep this thing in mind, MCL and LMC. Okay, these are the structures that are present from the anterior end to the posterior end. Okay, so this covers up one very important MCQ over here. Right, and next important thing, and already Saif was asking me previously, what is this fracture over here, right? So what is this fracture over here? All of you look here now. Fracture of the styloid process of the fifth metatarsal over here. This over here is called as your Jones fracture. Okay, this is called as your Jones fracture. Jones. This is called as your Jones fracture over here. There is a technical glitch again. So this fracture is your Jones fracture. Clear, all of you? So all of you, can you see a fracture line over here? Can you see a fracture line over here? This is your Jones fracture. Another picture also. Can you see a fracture line over here? Right. So Wesley, this is the last slide. Take a screenshot if you want. Right. So this is the Jones fracture over here. Okay. And second important thing is that, see, when you are doing marching, right? Previously the soldiers, when they used to have very vigorous marching from morning till night. So in that condition, what used to happen is that because of this aggressive prolonged marching, second and third metatarsal would have been fractured, and this is called as march fracture. What fracture is this? March fracture. Can you look at the fracture line over here? So this fracture is called as your march fracture. Yes, and you can also call it as stress fracture or the march fracture. Okay, chalo. Let us get back to the thing. Now what I have done is that, very good Robin, what I have done is that I have taken a cross section of your thigh. When I take a cross section of your thigh, there are few important things. How many compartments you have in the thigh? You have got an anterior compartment, you have got a posterior compartment and a medial compartment. Okay. Next important thing is that what is the nerve that is present in the anterior compartment? That is your femoral nerve. Okay. What is the nerve that is present in the posterior compartment? That is your sciatic nerve. That is why sciatica pains are mostly on the back side. Okay. And sciatica pain is a very severe pain, I'm telling you, right? It is a continuous shooting pain. You call this pain as a continuous shooting pain. It will not let you to sit, not let you to stand. Okay. And basically you have to look at the diagnosis. Maybe there might be a disc protrusion or whatever it is, but the pain medications which you give to the patient are pregabalin or gabapentin. Okay. Next, when it comes to this obturator nerve, which is present in the medial compartment. So once there was a question asked in 2008, I think, nerve of medial compartment of thigh, what will be the answer? That is your obturator nerve. Now, when you come to the anterior compartment has got two actions. One is called extension of knee, another one is called as flexion of hip. Extension of knee as well as flexion of hip. For example, if I'm standing like this, right? So all of you just look here. Now I have just raised my knee over here. My knee is extended, my hip is flexed. Okay. This is called extension of knee as well as flexion of your hip. Now, what is the muscle that is responsible for the extension of knee? Two important muscles. One is the rectus femoris, another one is called as your vastus muscle. Okay. What are the three? Vastus are large muscles. One muscle on the lateral side, vastus lateralis, one in the center, intermedius, one on the medial side, that is medialis. All these three muscles together, 1, 2, 3, 4. All these four muscles together you call it as quadriceps femoris. Right? Keep in mind, quadriceps femoris is different from quadratus femoris. वो एक ही मसल है, quadratus. Quadriceps is four ceps. Okay. Flexion of hip is done by sartorius, pectineus, and psoas muscle. Psoas muscles में there psoas major as well as minor. These things you need to remember. Okay. Now let us discuss about all these muscles first. Coming to the origin, agar if you want to remember it, or else no. Okay. So no one is going to ask you the origins, but still remember it that this is your hip. Okay. In this pelvic bone, you have got anterior superior iliac spine. Anterior superior iliac spine के नीचे क्या होगा? Anterior inferior iliac spine. So the muscle which is starting from anterior superior iliac spine is your sartorius. The muscle which is starting from anterior inferior iliac spine is your rectus femoris. Okay. So all of you look here. Rectus femoris originates from anterior inferior iliac spine. Okay. Next, vastus lateralis. Lateralis कहाँ पे होगा? Guys, all of you know femur bone has got, if this is your femur, right? If this is your femur bone, right, ये देखो, this is called greater trochanter, this is called lesser trochanter. दो trochanters के बीच में the line which you have is intertrochanteric line. What is that? Intertrochanteric line. Where is vastus lateralis present? Vastus lateralis is present lateral to intertrochanteric line and lateral lip of linea aspera. It originates from lateral part of intertrochanteric line, lateral lip of linea aspera. अगर lateral से हुआ, then medial vastus medialis originates from medial part of intertrochanteric line and medial lip of linea aspera. I don't think so. This is very difficult to remember. That is lateral, this is medial. Intermediate जो है, it will stay in the middle, right? It will stay in the middle. कहाँ पे? ये देखो, anterior surface of the femur, on the upper 2/3 of the anterior surface of femur. So origins might be different, origins तो different है, but insertion तो एक ही होगा. Insertion is common point. So all these four muscles together they join together. All of you look here. All these four muscles together they join. ये देखो 1 2 3 4. You see 1 2 3 4. All these four muscles they join together to form a common tendon. ये tendon का नाम क्या होगा? Quadriceps tendon. And this tendon, as it is passing above the patella, you call this ligament as patellar ligament. और ये finally कहाँ पे insert होगा? It will insert onto your tibial tuberosity. Okay, where it is going to insert? Onto your tibial tuberosity. Sir, why are you telling this so much? Why am I telling you this? Is that, for example, when you are kneeling down all the time, you know what will happen? Your tibial tuberosity will be damaged. Right, it will be inflamed. अगर tibial tuberosity inflame हुआ, it is inflamed. What will happen? This inflammation will pass up like this. Inflammation will pass up, and it will affect all your quadriceps muscles. Okay, that is why this condition you call it as Osgood-Schlatter syndrome. What is this? Osgood-Schlatter syndrome. Okay, all of you just look at this. ये देखो, ये हो गया patella. This is asked in orthopedics, guys. ठीक है, ये हो गया patella का नीचे. Can you see tibial tuberosity fracture? Can you see a small fragment of tibial tuberosity that has been fractured over here? Right? So all of you just look at this. Can you see a small bumpy elevation here? This condition you call it as Osgood-Schlatter syndrome. Keep that thing in mind. Again and again I'm stressing it. Okay, Osgood-Schlatter syndrome. Right. So we are done with all these four muscles. You know the origins now, you know the insertion, you know what are the clinical points. Coming to the flexion of hip. When it is coming to the flexion of hip, the most important muscle, exam asking muscle we will be discussing right now is your sartorius, right? And what did I tell you? Sartorius originates from, all of you in the comment box, very fast. Sartorius originates from anterior superior iliac spine, whereas rectus femoris anterior inferior iliac spine. ये देखो, this is your sartorius. So from where did sartorius start? ये देखो, ये हो गया anterior superior iliac spine. All of you see here, anterior superior iliac spine. All the way this is coming and attaching to the medial aspect of tibia. So what is the letter? What is the shape of this muscle? S. S stands for what? Sartorius. That is why you call it as sartorius is a S-shaped muscle, and sartorius is the longest muscle. Sartorius is called as a Taylor's muscle. And again I am telling you, sartorius is called as a honeymoon muscle. Why it is called as a honeymoon muscle? You guys know better. Why it is called as a honeymoon muscle? Because see, what will happen in the honeymoon? I'm not going to discuss the details or events which happen there, but I'm telling you about the muscle here. In the honeymoon, you basically flex your hips, okay? And abduction in the sense open your hips, and next external rotation. So flexion of hip, abduction and external rotation. These three muscles together, these three actions together, they make up this honeymoon muscle, and the rest is the history, right? So this is why you call it as a honeymoon muscle. Now don't focus on honeymoon here, focus on what are the actions here. Okay, they are going to ask you the actions here. So till here you are clear now, right? Next important clinical point I want to discuss here is that, guys, when you fall down, most commonly you get an injury to your knee, so you have to save your knee. For that, what do you need? You need some cushion like pillows or bursa. What are those cushion like pillows called? Bursa. ये देखो पेटेला के सामने जो बरसा है दैट इज कॉल्ड प्री पेटेलर बरसा, पेटेला के ऊपर जो बरसा है दैट इज कॉल्ड सुप्रा पेटेलर बरसा, and below the patellar bursa you have is called infrapatellar bursa. Okay, for example, one very important clinical point, for example, if your suprapatellar prepatellar bursa is infected, right, this condition you call it as housemaid's knee. What do you call this condition as? Housemaid's knee. Very good. Why? Because housemaids they kneel down and mop the floor, तो ये ज्यादा डैमेज होगा, है कि नहीं? Next, infrapatellar bursa, if it is damaged, that you call it as anyone? Clergyman's knee. What is this? This is your clergyman's knee. So there are two important things. One is called housemaid's knee, that is prepatellar bursitis. Clergyman's knee, that is your infrapatellar bursitis. Okay. So all of you just look at this particular thing. If they give such question in orthopedics, you have to answer. ये देखो, ये normal है. This is called as your prepatellar bursitis and this is called as your prepatellar bursitis. और ये देखो, ये पेटेला नहीं है, ठीक है, पेटेला यहाँ पे है, this is patella, this is your infrapatellar bursitis, and if this is patella, again this is your infrapatellar bursitis. Clergyman's knee. Very good. Okay, right. So what are the things we were discussing is anterior compartment में, in the anterior compartment there is flexion of what? Hip. There is extension of what? Knee. तो posterior compartment में क्या होगा? Opposite action. Flexion of what? Knee. Extension of what? Hip. Okay. Medial compartment has got only one action, that is adduction. What is that? Adduction. Clear? Adductors. These are called as adductors. All of you just look at the medial compartment. We are done with the anterior compartment. Now we will discuss about the medial compartment. इसके बाद we will go on discussing about the posterior compartment. If you look at the medial compartment, what muscles do you have, guys? Just follow the way I am teaching you. It will be easy. Just remember the mnemonic gap. GA3P. Gap. Just remember the mnemonic gap. So the first important muscle which you see over here is gracilis. Okay. Then what is this A3? A3 I will tell you later. Another P. P stands for what? Pectineus. So दो muscles तो हो गया. एक हो गया pectineus. Pectineus is done. Another muscle is gracilis. Both of them are done. है कि नहीं? Right. Now what is this A? What did I tell you? All your medial compartment are called as adductors. ठीक है? एक muscle होगा छोटा. That is called adductor brevis. One muscle is long. That is called adductor longus. One muscle is large. That is called adductor. What is that? That is called adductor magnus. So what are the three important adductor muscles? Small is brevis, long is longus, large is magnus. बाकी तो तुमको पता है G and P. G for gracilis, P for pectineus. So all these muscles are called as adductor muscles or the medial compartment muscles. Guys, tell me fast, which nerve is innervating all these medial compartment muscles? Jaldi batao. Very fast. Mantis has already answered. Very good. Very good, Sonam. Very good. Perfect. Mulamu, perfect. It is the obturator now. Right. The next important topic which is most of the time asked is your femoral triangle. Guys, I'm telling you, itna important topic hai na ye, very important. Okay. Just learn the way I am teaching you. It will be easy. Okay. So look at the femoral now. Femoral triangle. Femoral triangle has got three important borders. Okay. एक हो गया base of the femoral triangle. One is called lateral border of femoral triangle, medial border. Base क्या है? ये देखो, ये होगा base. What is this base consisting of? This green color one. This green color one over here, क्या होगा ये? This is called as your inguinal ligament. What is this? Inguinal ligament. Okay. Next, you have got the lateral border. Laterally, what do you have? Sartorius. मैंने बताया था, sartorius originates from anterior, superior की inferior. Very good. Very good. Anterior, superior iliac spine. Next, another one is adductor longus. ये देखो, medial side में क्या होगा? Adductor longus. Clear all of you? So much more detailed if you want to know, you have to know, ये देखो ये क्या है? This is called as a medial border of sartorius. Next, this is called as the medial border of adductor longus, and this is called as the inguinal ligament. So medial border of sartorius, medial border of adductor longus and inguinal ligament, three of them form your triangle. Okay, triangle के अंदर क्या होगा? Femoral triangle के अंदर क्या होगा? There is femoral artery, there is femoral vein, there is femoral nerve. The distribution is very important. Okay, the first important thing you should know over here, ये देखो यहाँ पे जो है, this is called as, this one over here is called as femoral nerve. What is this? Femoral nerve. और ये क्या होगा? ये होगा femoral artery. What is this? Femoral artery. और last one क्या होगा? Blue color में, this is called as femoral vein. So how do you should remember this? NAV, NAV, nerve, artery or vein. ठीक है? Second important thing is that, can you see guys here, ये femoral artery जो है और femoral artery जो है और femoral vein जो है, both of them are surrounded by a sheath here. ये देखो, there is a sheath that is covering both of them. ये sheath का नाम क्या है? Femoral sheath. What is this sheath named called as? Femoral sheath. So they can ask you contents of femoral sheath. You should tell femoral artery and femoral vein. Now what we will do is that we shall remove these structures and put it outside. ठीक है? We shall remove these structures, put it outside. ये देखो, ये हो गया femoral sheath. This is your femoral sheath. What I'm telling you is, femoral sheath को ना we will divide into three compartments. क्या है ये? ये देखो, ये हो गया lateral compartment, ये हो गया intermediate compartment और ये हो गया medial compartment. Okay? Lateral compartment में क्या है? Femoral artery है. Intermediate compartment में क्या है? Femoral vein है, right? And medial compartment, what do you have? You have got lymph nodes. These lymph nodes are called as lymph nodes of Cloquet or Rosenmuller. Lymph nodes of Cloquet or Rosenmuller. Okay? Or next important thing is that if you closely observe, this particular nerve name is called as, guys, if you closely observe, this nerve is called as, again फिर से क्या हो गया? This is called as, God, right? Right, this is called as genitofemoral nerve. What is this? Genitofemoral nerve. Okay. So what is this nerve name called as? This nerve over here is called as genitofemoral nerve. Just give me a second, guys. Just give me a second. Let me. Right, I'm sorry for the thing here. So this nerve over here is called as what? Genitofemoral nerve. Okay. So what is happening with this genitofemoral nerve? Genitofemoral nerve is dividing into two branches. ठीक है? एक हो गया femoral branch. One is called as a femoral branch. Another one is called as a genital branch. Not femoral nerve. This is just femoral branch of genitofemoral nerve. So guys, if I am asking you what are the contents of femoral triangle, क्या बोलोगे? What do you say? You have to tell femoral nerve, पहला femoral nerve, then we have got femoral branch of genitofemoral nerve, then you have got the femoral artery, then you have got the femoral vein, and then you have got the lymph nodes of Rosenmuller. These are the structures from lateral to medial. Okay, these are the structures from lateral to medial. Now if I ask you what are the contents of femoral triangle within the femoral sheath from lateral to medial, femoral sheath के अंदर क्या है? Femoral branch of femoral nerve, next femoral artery, femoral vein and lymph nodes of Rosenmuller. So these are the some of the important points which you have to remember. Okay, right. and this is not that important, I just kept it like this कि ये देखो femoral artery जो है it is coming down all the way, it is entering into a canal. ये canal का नाम है adductor canal. From front of the thigh to back of the thigh you have this canal, okay, or Hunter's canal, and back side it is coming out through an opening called adductor hiatus down, okay. So if you just want to remember this, remember anytime the question was not asked. Hello, this was a picture over here. Now this is for you guys. Tell me what is this? What is this particular branch over here? बताओ ये branch का नाम क्या है? What is this branch? Femoral branch of genitofemoral nerve. Very good. This is called as femoral artery. ये हो गया femoral vein, and this is called as the lymph nodes of Rosenmuller. I hope this sounds good to you. Okay. Now another important question is that, okay fine, you discussed about femoral triangle. ये femoral triangle है, fine, but femoral triangle के अंदर, inside the femoral triangle, how many muscles are there? ये देखो, there is one muscle over here, there is a second muscle over here, there is a third muscle over here. So these muscles are forming what? These muscles are forming the floor of the femoral triangle. So floor of the femoral triangle is formed by what? All of you look here. The floor of the femoral triangle is formed by iliacus, psoas major and pectineus muscle. Okay, will you remember it? Iliacus, psoas major and pectineus muscle. How do you remember it? Remember the mnemonic flip. F stands for floor. Okay, FL stands for floor. I stands for iliacus. PP stands for psoas major and pectineus. Here all of you? Till here, remember it. Okay. So guys, we are done with the anterior compartment. We are done with the medial compartment also. Now let us discuss about the posterior compartment. ये हो गया posterior compartment. Now if you look at the posterior compartment is having few regions. For example, ये देखो, ये पीछे वाला जो है, this is called as the gluteal region. Just below that you have got this region called as back of the thigh. Okay, so posterior compartment is divided into two parts. What are the two parts? Gluteal region and back of the thigh. Back of the thigh muscles को क्या बोलते हो? You call them as hamstring muscles. Okay, you call them as hamstring muscles. So gluteal region के अंदर how many muscles do you have? You have got many muscles, right? I'm going to teach you now. Just stop commenting. Just look here now, all of you. Gluteal region के अंदर how many muscles you have got? You know three major muscles. है कि नहीं? एक होगा maximus, एक होगा medius, एक होगा minimus. Gluteus maximus, gluteus medius, gluteus minimus. ये three muscles तो you guys know it. Yes or no? Maximus, medius, minimus. These three muscles are perfectly you know. Okay. Apart from this, what muscles you have? Remember it by the mnemonic top Q. Top question. T stands for what? Tensor fascia lata. O stands for what? Obturator internus. P stands for what? Piriformis. Q stands for what? Quadratus femoris. And lastly, just remember gemellus muscles, superior and inferior. ये gemellus muscles को पता क्या बोलते हैं? They are called as twin muscles. Okay. Once again, guys, what are the muscles that are present? Once again, just repeat with me, every one of you behind the screens. All of you just repeat with me. Gluteal region में क्या होगा? Gluteus muscles तीन. क्या है वो? Maximus, medius, minimus. छोड़ दो. इसके साथ साथ क्या होगा? Top Q. T stands for what? Tensor fascia lata. O stands for what? Obturator internus. P stands for what? Piriformis. Q stands for what? Quadratus femoris. ये देखो, this is quadratus femoris. ठीक है? Quadriceps नहीं है ये, quadratus, only single muscle. Here all of you, these are all the muscles that are located alone in the gluteal region. Okay, these are the muscles that are located in the gluteal region. Guys, starting I told you hip flexion extension. याद है? Hip flexion extension muscles. What are the muscles that are responsible? Sartorius and all of these I told you. है ना? Hip का ना two other actions are also there. One is called lateral rotation of hip. Another one is called medial rotation of hip. अगर ये hip है, if I am laterally rotating my hip, lateral rotators. If I am medially rotating, medial rotators of hip. Lateral rotators, what are the muscles that are responsible for lateral rotation of hip? Remember the mnemonic LOPS. Lateral, L for lateral, L for lobes. Okay, L for lateral, L for lobes. O stands for obturator internus, P stands for piriformis, S stands for superior and inferior gemmelli. So all these muscles, they perform what? Lateral rotation. Medial rotation is performed by what? All of you look here. What is a muscle by name? MEDI. MEDI नाम से कौन सा मसल है? That is your medius. Medius के नीचे क्या होगा? Minimus. Medius के नीचे क्या होगा? Minimus. Till here you are clear? Hip lateral and medial lobes and medius minimus. Till here you are clear, right? अब क्या करेंगे? We have discussed the muscles. ठीक है? Now we will discuss the nerve innervation. Okay? Now nerve innervation I can just write it down in the form of table also, but that will just put up a pressure in your memory. So I have planned this way. All of you look here now. ये देखो L2, L3, L4, L2, L3, L4. From L2, L3, L4, you have got a nerve like this, right? So this nerve over here is called as your femoral nerve. At the same time, ये देखो obturator nerve भी है. From L2, L3, L4, two nerves are coming. One is femoral nerve passing in the anterior compartment or obturator nerve supplying the medial compartment. मैंने बोला था ना starting में nerve of anterior compartment is femoral, posterior, sciatic and all. अब ये देखो, look at the other picture, that is the other side picture, that is your posterior compartment picture here. Okay, so the picture which you can see over here is your posterior compartment picture. Okay, now in this posterior compartment, the only one nerve in the posterior compartment क्या है वो? What is that? Sciatic nerve. Okay, sciatic nerve. Sciatic nerve is very thick, you know. Sciatic nerve, सुनो अच्छे से. Sciatic nerve is coming down all the way. But before sciatic nerve enters into your thigh, sciatic nerve gives out a branch, and this branch is called as common peroneal nerve. So common peroneal nerve क्या होगा? It will divide into two other branches. Okay, ये देखो, one branch just lying beneath your skin, इसको क्या बोलते हैं? Superficial. और दूसरा branch अंदर है, बहुत deep है. This is called deep peroneal. One is called superficial peroneal, another one is called deep peroneal. बाकी क्या हुआ? Sciatic nerve continues. ये देखो, sciatic nerve continues down as a nerve in the back of your thigh. और ये क्या है? ये tibial nerve. So the tibial nerve is innervating which muscles? Hamstring muscles. Back of the thigh muscles को hamstring muscles बोलते हैं, बोला ना हमने. So back of the thigh muscles are hamstring muscles. Next, tibial nerve continues as posterior tibial nerve. और ये क्या करेगा? This will supply your calf muscles. ठीक है? This will supply your calf muscles. Guys, till here is everyone clear? If I ask you what is the root value of obturator nerve or femoral nerve, what will you tell? L2, L3, L4. If I ask you what is the root value of sciatic nerve, क्या बोलोगे? ये देखो L4, L5, S1, S2 as well as S3. Clear all of you? If I ask you hamstring muscles are innervated by which nerve? Tibial nerve. If I ask you calf muscles are innervated by which nerve? Posterior tibial nerve. Guys, still here is everyone clear? Yes or no? Very good. Excellent. Right. Now let us discuss some of the MCQs which were asked previously. ठीक है? Femoral nerve injury का most common cause क्या होगा? Most common cause of femoral nerve injury is gunshot wound. ठीक है? Next, अगर obturator nerve damage हुआ, if obturator nerve is damaged, what will happen? What did I tell you? Obturator nerve will supply your medial compartment. ये देखो, medial compartment मतलब your inner thighs. अगर ये nerve damage, देखो guys, inner thigh region is very sensitive. अगर ये nerve damage हुआ ना, patient will have very severe pain that even if you just touch that area like that, patient will have hyper sensations. That is called as hyperparesthesia, increased paresthesia. Okay, on the inner thigh. This condition you called as Hauschip-Romberg sign. ये sign का नाम क्या है? Hauschip-Romberg sign. Which nerve is injured in Hauschip-Romberg sign? Obturator nerve. How? It is O for O. Next, common peroneal nerve बोला था ना मैंने, ये देखो, कॉमन पेरोनियल नर्व डिवाइडिंग इनटू सुपरफिशियल और डीप, है कि नहीं? ये देखो, कॉमन पेरोनियल नर्व डिवाइडिंग इनटू सुपरफिशियल एंड डीप. Very good, Anishul, he is right. In obturator hernia, you see, very good. Common peroneal nerve is dividing into superficial and deep. Now, most of you tell that common peroneal nerve injury will lead to foot drop. No, common peroneal nerve में deep peroneal nerve जो है, if deep peroneal nerve is injured, that would lead to foot drop. That would lead to foot drop. Okay. फुट ड्रॉप में क्या होगा? पेशेंट को स्टेपेज गेट होगा. स्टेपेज गेट मतलब पेशेंट विल पुट हायर स्टेप्स लाइक दिस एंड वॉक. You, if you want, you just type it as steppage gait on YouTube. You can watch it. Okay. So in foot drop, which muscle is paralyzed? Anterior tibialis muscle. Very, very potential MCQs, guys. इतना important MCQs है ना ये. Very, 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 very important MCQs. Foot drop, steppage gait, tibialis anterior muscle. Okay. Tibialis anterior muscle. Next. पोस्टीरियर टिबियल नर्व इंजरी. पोस्टीरियर टिबियल नर्व कहां पे देखा था? ये देखो, पोस्टीरियर टिबियल नर्व विच विल सप्लाई योर काफ मसल्स. अगर पोस्टीरियर टिबियल नर्व इंजरी हुआ, दैट वुड लीड टू ए कंडीशन कॉल्ड एज व्हाट? टार्सल टनल सिंड्रोम. अब अपर लिम में कौन सा सिंड्रोम था? कार्पेल टनल सिंड्रोम. वहां पे कौन सा नर्व कंप्रेस हुआ था? दैट इज योर मीडियन नर्व. बट नाउ हियर टार्सल टनल सिंड्रोम, पोस्टीरियर टिबियल नर्व इज डैमेज्ड. As a result, what is happening? Patient is having claw foot deformity. Claw foot मतलब, I'll show you a picture. ये देखो, this is called as claw foot deformity. Okay, claw foot. Such in English you call them as hammered toes. In English you call them as hammered toes. Clear all of you? उसको बोलते हैं क्या? Claw foot deformity. Claw foot deformity. ये और एक important MCQ है, very very important MCQ. Clear all of you? Right. Now, guys, if you remember, we have very clearly discussed anterior compartment muscles का nerve supply क्या है, we discussed. Medial compartment का nerve supply क्या है, we discussed. Back of the thigh nerve supply we have discussed. Calf muscles nerve supply we have discussed. But we did not discuss nerve supply of gluteus muscles. वो जो 8 muscles है ना, maximus, medius, minimus and top Q. What are these muscles? What are the nerves that are innervated? We didn't discuss. But before we discuss that, first you should know one thing. Muscle number 2. ये देखो, muscle number 2 क्या है यहाँ पे? Gluteus medius. Muscle number 3 क्या है यहाँ पे? Gluteus minimus and tensor fascial lata. These 3 muscles you call them as trio muscles. What are these called? Trio muscles. RSR eversion that will be done by the lateral compartment in the leg region. Okay, so I'll tell you, I'll come to the leg region, there I will discuss. Okay, so these are called trio muscles. Okay, अब ये देखो, all of you look here now. Now how do you remember this? How do you remember these nerves? Now just be with me, you will understand in 2 minutes what I'm trying to teach you. ठीक है, start from L4. Easy way I'm telling you, start from L4. L4 से लेकर the next 2 numbers. Okay. After that, what you do? Pick up the middle one. Again, add the next 2 numbers. For example, L4. L4 के बाद क्या आएगा? L5. उसके बाद S1. Now pick up the middle one. Middle one क्या है? L5. ये देखो, L5 रख दे यहाँ पे. Add the next 2. Next क्या होगा? L5 के बाद S1, S2. Again, pick up the middle one. What is that? S1. S1 के बाद क्या होगा? S2, S3. Again pick up the middle one. What is that? S2. S2 के बाद क्या होगा? S3, S4. So if you remember L4, the remaining all the root values are very easy. Okay. So first nerve. सबसे ऊपर क्या होगा? Superior. The nerve which is present all of it top is superior. So superior gluteal nerve. Whenever I tell superior, there will be inferior. Whenever there is major, there is minor. So when I tell superior, the next one will be inferior gluteal nerve, right? And lastly, you have got posterior cutaneous nerve of thigh and pudendal nerve. How do you remember it? Remember it by the mnemonic SIP. S-I-P-P, SIP. Okay. So what is the superior gluteal nerve doing? Supplying your trio muscles. Trio muscles मतलब ये तीनों. Supplying your trio muscles. ठीक है? Sir, अगर superior, see guys, most of you know what mistake you do? Superior मतलब बड़ा होगा, it is on the top, right? So gluteus maximus is on the top, major. So superior gluteal nerve supplies gluteus maximus. Galat, no. Superior gluteal nerve supplies these trio muscles. ये देखो trio muscles. Whereas inferior gluteal nerve जो है, that will supply your gluteus maximus. Vice versa. ठीक है? ये देखो. Inferior gluteal nerve जो है, that will innervate your gluteus maximus. Clear all of you? Right. Next important nerve is nerve to obturatus internus. Nerve का नाम है nerve to obturatus internus. So what it will supply? Obviously obturatus internus. Next nerve is nerve to quadratus femoris. So obviously it will supply quadratus femoris. उसके साथ साथ what you do is that put one superior gemellus on the top, put one inferior gemellus on the bottom. So if I ask you nerve to obturatus internus supplies what? Obturatus internus and superior gemellus. Okay. So this completes the discussion of all these nerves over here. All these muscles and their nerve supply. So guys, अब बताओ, all of you understood or no? यहाँ तक before I proceed on to the next. Everyone, very good. बाकी कहाँ गए? Only 44 went for lunch. Right. Next important thing, this is just a small clinical point I want to tell you guys. यहाँ पे जो मसल दिख रहे हैं ना, this muscle over here is called as popliteus muscles. ये popliteus muscle पता कहाँ पे है? This is present on the lateral side. It is absent on the medial side. ये देखो, medial side this popliteus muscle is not there, absent. Only on the lateral side you have this popliteus muscle. So in that case, यहाँ पे can you see two important menisci? ये देखो, this is called as lateral meniscus और यहाँ पे medial meniscus है. So can you tell me which meniscus is more prone to injuries? Which meniscus is more prone to injuries is medial meniscus. क्यों? क्योंकि popliteus is absent on the medial side. So that is the reason why medial meniscal injuries are more common. Medial I will discuss as yeah, back of the thigh. ये देखो next यही है muscles, ठीक है? आइजा मैं discuss करूंगा, okay? Right. So medial meniscal injuries, okay? Medial meniscal injuries are more common, okay? Why? Because of the absence of popliteus muscles. Clear all of you? So just remember this one point. Now let us discuss about the back of the thigh. Gluteus हो गया और नीचे क्या हो गया? Back of the thigh, called as hamstring muscles. ठीक है? Just remember as my tab. Remember it as my tab. M क्या होगा? Membranous. Okay? T क्या होगा? Tendinous. A क्या होगा? Adductor magnus. And B क्या होगा? Biceps femoris. So semi-membranosus, half membrane, half tendon, semi-tendinosus, posterior part of adductor magnus and biceps femoris. Now you might get a doubt, sir, adductor magnus is a medial compartment muscle. You have discussed there, but why are you discussing here? So that is why I am telling you, here it is a posterior part, adductor magnus ka posterior part hai. Then there it is called as your anterior part of adductor magnus. Here it is posterior part and there it was your anterior part of your adductor magnus. Clear? So these four muscles over here are called as your hamstring muscles, muscles which are located in your back of your thigh. Is everyone clear with this? Yes or no? Jaldi batao fatafat. Now let us discuss about the arterial supply of lower limb. Guys, arterial supply of lower limb, and by the way, hamstring muscles is innervated by what? Which nerve? यहाँ पे देखो, picture देखो, hamstring, ये पूरा hamstring muscles है ना? All these hamstring muscles are innervated by which nerve? Tibial nerve. Okay, right. Now look at the arterial supply here, guys. Arterial supply I have put it in two ways. ठीक है? एक in the form of picture. If you want, you learn it. Another way is in this chart manner. Okay, whichever way suits good for you, you better choose that way. Okay. So coming to the first important thing, ये देखो, ये हो गया abdominal aorta dividing into two common iliac arteries. कॉमन इलियक आर्टरीज आर अगेन डिवाइडेड इनटू, ये देखो ये हो गया तुम्हारा एक्सटर्नल इलियक आर्टरी और ये हो गया इंटरनल इलियक आर्टरी. ओके, ये क्या हो रहा है यहाँ पे, ऑल ऑफ यू लुक हियर नाउ. External iliac artery is coming down, and once this external iliac artery crosses your inguinal ligament, right? Now you should call this as femoral artery. Clear? Now, next, you remember one picture I told you, femoral artery is entering anterior part of the thigh, making a hole, going on to the back through adductor canal. दिखाया था, याद है? ये देखो, this is how it is. Femoral nerve is coming all the way. Femoral artery is coming all the way, making a hole over here, and ye dekho, it is coming on from the posterior aspect like this. Okay, and this femoral artery, once it enters into your popliteal region, this is called as now popliteal artery. Okay, what is this called? Popliteal artery. And this popliteal artery will divide into two. Okay, one is called as a tibioperoneal trunk, and another artery क्या हो रहा है फिर से, again it is making a hole and again it is coming in front of the tibia, you call it as anterior tibial artery. Popliteal artery is dividing into two, one is making a hole coming to the front again as anterior tibial artery. Okay, anterior tibial artery का एक branch है dorsal pedal artery where you can feel the pulse. Okay, let us go on to the back. Tibioperoneal trunk, what is it doing? It is giving two branches. One is called peroneal artery, another one is called posterior tibial artery. Yes, if there is anterior tibial artery, तो posterior tibial artery भी होना चाहिए. Clear all of you? So this is the blood supply of your lower limb. Okay, once again, close your eyes, just imagine the blood supply. ये देखो, femoral artery is coming all the way, making a hole, right? Adductor canal, coming onto the back, entering into your popliteal region. That artery you call it as popliteal artery. Popliteal artery will divide into two. One goes to the front called as anterior tibial, one stays on the back called as tibioperoneal. This tibioperoneal is again dividing into two, posterior tibial and peroneal artery. Okay, so this is what is your arterial supply. So if you want another clear way, this is how it is. Abdominal aorta का branch है common iliac, dividing into right and left. ठीक है, external, internal. External branch is femoral, femoral continues as popliteal. Popliteal gives to anterior tibial, tibioperoneal. Anterior tibial gives dorsal pedal artery, tibioperoneal, posterior tibial and fibular. Is everyone clear with this? Yes or no? Till here everyone is clear, guys? Shilpa, you will get it in very soon in the app. Okay, in the app all my lectures are recorded of anatomy, microbiology and pediatrics also, and even on this particular YouTube channel you even have got clinical videos also if you want to see injections and all. Right, chalo, let us go to the next important thing. What are these? If they give you such picture, this is a clawfoot deformity, hammer toes. Yes, Suyash, it is for both of them. Now next I will come to this part later. Okay, I will come to this two pictures later. Chalo, let us go to the leg, guys. Leg mein na, whatever thing I am telling you, I am going to discuss a AIMS question over here. In AIMS 2008 there was a question that was asked. Just remember that whatever I am going to teach you here, very very important. Ye leg hai. Leg mein kitne bones honge? How many bones are there in the leg? You have got two bones. One is called as your femur, fibula and tibia. Okay, chalo, I'm sorry, tibia as well as fibula. Okay, now how many compartments you have? You have got anterior compartment, you have got posterior compartment, you have got lateral compartment. Guys, all of you remember thigh mein na, you don't have lateral compartment, you have medial compartment. But leg mein na, you don't have medial compartment, you have lateral compartment. You see vice versa there, right? Now next important thing over here is that let us discuss this thing. Anterior, guys, this part is very 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 important. Anterior compartment of leg mein, what artery do you have? I have anterior tibial artery. What vein do you have? I have anterior tibial vein. What nerve do you have? I have deep peroneal nerve. You see, DPN stands for deep peroneal nerve. So from now onwards, anterior compartment, what do you have? Anterior tibial artery, anterior tibial vein, deep peroneal nerve. Coming to lateral compartment, what do you have? Superficial peroneal nerve. Only superficial peroneal nerve. No artery, no vein. Okay. Coming to posterior compartment. Guys, if you see, posterior compartment is again divided into two. Ye dekho, this is number 1 and this is number 2. This is called as a superficial posterior compartment, and number 2, this is called as a deep posterior compartment. That is the reason why posterior compartment of leg, एक बार पकड़ के देखो कितना bulky होगा. Posterior compartment of leg is a bulky compartment. Why? It is having superficial and deep. Okay. Now, if you look at the deep compartment, posterior, you have got posterior tibial artery. टिबिया के पीछे जो आर्टरी है पोस्टीरियर टिबियल आर्टरी, टिबिया के पीछे जो वेन है पोस्टीरियर टिबियल वेन, एंड बिहाइंड द टिबिया द नर्व इज पोस्टीरियर टिबियल नर्व. Along with that, you even have got PA, PV. What is PA and PV? देखते हैं यहाँ पे. PA is peroneal artery, PV is peroneal vein. So, peroneal artery is giving a branch to the lateral compartment. Peroneal vein is also giving a branch to the lateral compartment. Okay, but if you have observed one thing, posterior superficial compartment is not having any artery, any vein, any nerve. There is no neurovascular bundle by itself. Have you seen? यहाँ पे कुछ artery, vein, nerve दिख रहा है? No artery, no vein and no nerve. Then who is supplying? Your posterior tibial artery, vein and nerve are giving branches down like this and supplying. So, this was a question asked in AIMS. The only compartment in the entire body which is devoid of neurovascular bundle. Again, I am repeating, the only compartment in your entire body which is devoid of neurovascular bundle, that is your posterior superficial compartment of your leg. And the rich bundle, I mean, the neurovascular bundle which is rich, the compartment which is rich in arterial supply, venous drainage and the nervous supply is the deep compartment. Guys, still here all of you understood this point. I want you to keep it in your mind. Have you understood? Yeah? Very good. So, posterior superficial compartment of the leg lacks neurovascular bundle by itself, right? So, next important thing is anterior compartment. Okay, anterior compartment. First, let us discuss about the anterior compartment. Now, I am going to tell you only muscles, guys. Artery, nerve and all these things I won't tell you because you know that all these things we have just covered. Okay, so coming to the anterior compartment. In the anterior compartment, what muscles do you have? First important thing, this particular muscle which you can see, anterior side mein jo muscle hai, that is called anterior tibialis muscle. Yes or no? The same muscle located on the posterior side is called posterior tibialis. So this is anterior tibialis muscle. Next, look at this blue color muscle, guys, very interesting. See, this is coming down all the way and attached to your toe. Okay, attach it to your toe. What is a toe called as? Hallux. Toe is called hallux, and this muscle is called extensor hallucis longus. Okay. Next, this pink color muscle coming down all the way, attached to digits. Any muscle attached to digits is called as what? Digitorum. So what is this muscle? Extensor digitorum longus. And finally, the last muscle which you have in the lateral compartment over here, I mean laterally placed, is peroneus tertius. Why are you calling it as tertius? I will tell you in a minute, right? So, but right now, what are the things you need to know? What are the muscles, guys, in the anterior compartment? Tibia ke samne jo muscle hoga, what is that? Anterior tibial muscle. Okay? Muscle that is supplied to your thumb, extensor hallucis longus. Muscle that is supplied to your digits, extensor digitorum longus. Right? Till here you are clear? Right. Now what we will do is that we shall discuss about the lateral compartment. Lateral compartment का दूसरा नाम है peroneal compartment. इसीलिए whatever muscle in the lateral compartment we have, we name it as peroneus muscles. That is why we name it as peroneus nerve also. Okay. So Lateral compartment, what do you have? You have a blue line, you have a pink line. Which line is longer? Pink line is longer. You should call it as peroneus longus. And which line is short? Peroneus brevis. And where is the third peroneus muscle? Yahan pe hai third peroneus muscle. Okay, that is why you called as peroneus tertius. You called as peroneus tertius. Okay, so we are done with the lateral compartment also. Now coming on to the posterior compartment. Okay, so what did I tell you? Posterior compartment is divided into two. What are those two? One is called posterior superficial compartment. Another one is called as posterior deep compartment. How do you remember this? Guys, all of you, you know that whenever you talk gossips, okay, you love gossips. Whenever you have gossips, gossips are all superficial. They are not real, right? So superficial is gossip GSP. G stands for gastrocnemius, S stands for soleus, P stands for plantaris. Gastrocnemius muscle, if you look at gastrocnemius muscle, it has got two heads, lateral head of gastrocnemius and medial head of yes, Suresh, yes. Suresh, these are not for university exams, but for university final exams it will be useful, but not for your daily test, okay? I will tell you, Sneha, I will send the link to you so that you can download it, okay? So, once message me. So, all of you look here, gastrocnemius, soleus and plantaris, these are located in the superficial compartment. When it comes to deep compartment mein kya hoga? Exactly the opposite muscles. See, for example, anterior tibial is in the anterior compartment. So, yahan pe kya hoga? Posterior tibial muscle. Next, extensor hallucis longus in the anterior compartment. So, yahan pe kya hoga? Flexor hallucis longus. Next, extensor digitorum longus is in the anterior compartment. So, yahan pe kya hoga? Flexor digitorum longus. So, exactly opposite of anterior compartment is the posterior compartment. And if I ask you posterior compartment nerve supply, what will you tell? You have to remind this picture and tell posterior tibial nerve, artery is tibial artery, vein is tibial vein, and peroneal artery as well as peroneal vein. Here all of you? Daisy duck, don't worry. Right, message me after the class, okay? I'll send you the notes of other subjects also, right? So all of you just look over here. All of you understood all the muscles, guys? Everyone be fast. Yeah, all of you understood all the muscles over here. Very good, guys. You are tired. I should be tired, not you. You should be energetic, right? So the next important thing is there are some muscles called as gyropes muscles, guys, okay? There are some muscles called as gyropes muscles. Isa, I have already told you here that the lateral compartment, ये देखो, lateral compartment में कौन सा nerve है? Superficial peroneal nerve, okay? Right, so the muscles called as gyropes muscles, what are the gyropes muscles are? Semitendinosus, gracilis and sartorius. These three muscles together are called gyropes muscles. ये चीज याद रखो. Why am I telling you is that? Behind this gyropes muscle, there is a bursa. Sometimes this bursa might be infected. Okay, so that infection is called as pes anserine bursitis. और ये bursa का नाम है pes anserine bursa. If they ask you pes anserine bursa is located behind what are the following muscles except, right? So semitendinosus, gracilis and sartorius will be in the options. The fourth option you have to select it. Okay, right. So all of you now look here. ये देखो. These are the muscles. यहाँ पे bursa दिख रहे हैं ना छोटा सा. This is called as your pes anserine bursa. If it is infected, obviously patient will have a swelling over here. Okay. They can even give you such picture also and ask you what muscle this bursa is located behind which muscles. Okay. So keep this thing in mind. Next important thing is if you look, we have discussed cubital fossa. Cubital fossa discuss किया हमने, है कि नहीं? At the same time, we should also discuss popliteal fossa over here. Okay, so we even have to discuss popliteal fossa. Now, this fossa which is located behind your knee is called as your popliteal fossa. अब popliteal fossa में what are the muscles you have, guys? First thing, semimembranosus. ये तो back of the thigh muscles, hamstring muscles में एक part है. This is part of that. And next, biceps femoris, right? And next, here you have got gastrocnemius. What did I tell you? What did I tell you? I told you that gastrocnemius is having two heads, lateral head and medial head. You remember, right? Here I go. This is the medial head of gastrocnemius. This is the lateral head of gastrocnemius. So all of them together, they are forming a diamond-shaped cavity. This is called as diamond-shaped fossa. This is called as your popliteal fossa. This particular diamond-shaped fossa is called as your popliteal fossa. Okay. Now, within this popliteal fossa, what are the contents we will discuss in a minute. But before that, the borders of popliteal fossa. See, all of you look here. The popliteal fossa is like this. Supromedial, suprolateral, infromedial, infrolateral. Right. Now, you will tell me what are the muscles. Supromedially, what do you have? Semimembranosus. Suprolaterally, what do you have? Biceps. Infromedially, what do you have? Medial head of gastrocnemius. Infrolaterally, what do you have? Medial head or lateral head of gastrocnemius. ये देखो, semimembranosus, biceps, medial head and lateral head. Okay, lateral head. So what are the contents over here? The contents which you have over here are, one is popliteal artery, one is popliteal vein, one is common peroneal nerve and tibial nerve. These are the four important structures that are located. Popliteal artery, vein, common peroneal nerve and tibial nerve. These are the structures that are located in your popliteal fossa. Everyone is clear with this popliteal fossa? Right. So, back of the thigh, I told you gossip. You remember gossip muscles? What are the gossip muscles? Gastrocnemius, soleus and plantaris, right? Out of these, gastrocnemius and soleus are called, how many are they? Gastrocnemius का lateral head हो गया, medial head हो गया, soleus, three of them. Three of them together you call it as what? You call them as triceps suri. What do you call three of them together as? Triceps suri. So all of these three together they form a common tendon. वो tendon का नाम क्या है? Achilles tendon. Very, 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 very important. Achilles tendon is formed by the combination of what three muscles, they will ask you. Okay. So Achilles tendon is formed by the combination of all these three muscles. And this was a question once asked. Ankle reflex. For ankle reflex, where do you beat? You beat on the Achilles tendon. And what is the root value of that? That is your S1. That is your S1. Right? So these are the three important things. You should know what are gyrops muscles. You should know what are the triceps suri and all. So these are the important things which you have to know. And even you have to know the popliteal fossa and cubital fossa. Okay? Right. And last time in the June 2024 June, I think, no, 2023 or 2023, the previous exam, 2023 previous exam, they have asked a question telling, they have asked an image based question. They have pointed at greater tubercle, right? Greater trochanter of your femur and asked what muscles are attached here. So it is better you remember what muscles are attached to greater trochanter of femur and lesser trochanter of femur. Humerus may be greater tubercle, lesser tubercle. I already told you in case of your rotator cuff muscles, yaad hai? Right? Right. So coming to the greater trochanter of femur, what muscles are attached here? To the greater trochanter, G for greater trochanter, G for gluteus medius, minimus and maximus. उसके साथ साथ pig is also attached. What is pig? P stands for piriformis, I stands for internus. When I tell internus, there will be externus obviously, and G stands for gemellus. So these are the muscles that are attached to the greater trochanter. This is how you remember it. Okay. Coming to lesser trochanter, L for lesser, L for lips. Okay. L lesser, P stands for psoas, right? I stands for iliacus, and P and S stands for psoas, PS, psoas. Okay, so these are some of the muscles that you have over here. Okay, these are some of the muscles which you have over here, right? So all of you understood this, guys? Jaldi batao, all of you understood this? So here comes the discussion of lower limb. These are some of the important topics which you need to know in the lower limb. So after this we shall be discussing regarding the thorax, uske baad abdomen and all. So shall we take a 5-minute break again? Yeah, after every part it's better we take a break. ठीक है, अभी 70 80 से 50 तक आ गया, अभी 5 मिनट ब्रेक देने के बाद 50 से 5 होगा, 10 20, right? So we'll take a break. Anyways, I won't be having lunch, so if you want lunch you can have it, but there is no special lunch break. Okay, so just 5 minutes and then we shall start discussing the next part, that is the thorax. Okay, so till here I want you to keep in your mind clearly. Okay, so yeah, goodbye, take care and love you all. Hello guys, welcome back. So now we shall be starting our discussion with the thorax. Okay, with the thorax. And all of you are here. Let us start our discussion with the thorax now. Right. Few important things which you need to know. Regarding the thorax are as you can see, this is some of the very basic thing which I am discussing right now, that this is your ascending aorta, this is your arch of aorta, this is your thoracic aorta, and down here your abdominal aorta, right? So thoracic aorta and abdominal aorta together you call it as what? Together you call it as a descending aorta. Okay, so your thoracic aorta, is everyone here? Or I am the only one teaching to myself? Right. So this is the thoracic aorta over here, right? Now, next important thing you need to know is that you have to know exactly what is ascending aorta. That is most of the time that is asked, what is ascending aorta? If you look at ascending aorta, actually this entire thing which you can see over here is what is called as ascending aorta. So if you see what are the parts of ascending aorta over here, ye dekho, ascending aorta is having 3 important globe-like structures you see here. These 3 important things are called as sinuses. So you have got 3 sinuses, right? So these 3 are called as aortic sinuses. Okay. After this aortic sinus, little above here you have got something called as aortic bulb. What is this? This is called as your aortic bulb. So aortic sinuses or aortic bulb dono ko mila ke you call it as ascending aorta. This was a question asked. So remember one thing, that from now onwards, if someone is asking you what is ascending aorta comprising of, you have to tell 3 aortic sinuses plus 1 aortic bulb. Okay, that is your ascending aorta. Now, aneurysms. So most commonly, where does aneurysms occur? Aneurysms most commonly occur at the region of aortic bulb. ये चीज याद रखो, ठीक है? Aneurysms most commonly occur at the region of aortic bulb. So this is what is your ascending aorta. Now, next important thing you need to know is that ये देखो, this is from the side which I have taken, the picture which from the side. ये हो गया sternum and all. This is all the sternum and all, and this is all the vertebra on the back side here. Okay. Now, guys, please, I want you to engage here. Okay. Type something, that you are understanding, or answer along with me. Okay. So this is your sternum over here, और बीच में heart होगा और पीछे क्या होगा? Vertebra. Okay. So if I ask you the topography, what will you tell? The topography is all the way. So ascending aorta, where will ascending aorta end? The ascending aorta will end at the level of aortic bulb. Okay. From the aortic bulb से लेकर all the way down till the lower border of T4, whatever you have is, this is called as the arch of aorta. Okay. So ये क्या हो गया? ये क्या हो गया guys? This is called as ascending aorta. This is called as ascending aorta. Okay. Next, after that, from again remember the topography. From aortic bulb till the lower border of T4, this is called as what? This is called as your arch of aorta. This is called as your arch of aorta. Next, from the lower border of T4 से लेकर lower border of T12, lower border of T4 से लेकर lower border of T12, you call this aorta as thoracic aorta. What is this aorta called as? Thoracic aorta. From the lower border of T12 till the aortoiliac junction, जहाँ पे abdominal aorta will divide into 2 common iliac arteries, that is called as aortoiliac junction. So till there you call it as abdominal aorta. What is this called? Abdominal aorta. Okay. So once again, 4 MCQs I have written it down. What are they? Ascending aorta is consisting of what? Aortic sinus plus aortic bulb. Next, arch of aorta is consisting what? Aortic bulb se lekar lower part of T4 tak, that is arch of aorta. Lower border of T4 se lekar lower border of T12 tak, that is your thoracic aorta. Lower border of T12 se lekar aortoiliac junction tak, that is called as your abdominal aorta. What is this called? This is called as your abdominal aorta. This is called as your abdominal aorta. So from here definitely you can expect a question, very important topography. Okay, I hope you understood this. This is very smooth and clean, right? Coming to the next important thing, that is your development of the heart. Guys, heart is developed from 5 tubes. These 5 tubes are called as heart tubes. How many are there? Ye dekho, 1 2 3 4 5 tubes are there. Now you tell me, heart ke andar kya hoga? Basically in the heart what do you have? Yes, if this is a heart, right? If this is a heart over here, what do you have over here in the heart? Do you have aorta? Like what are the 2 aortas you have got? Here on the left side you have got an aorta called as systemic aorta. On the right side you have got an aorta called as pulmonary aorta. This is your systemic aorta. This is your pulmonary aorta. So from these heart tubes, one tube should develop into systemic aorta and pulmonary aorta. Yes or no? And in the same way, do you have veins in the heart? You also have veins in the heart. But before that, one very important thing I am telling you, that if you take this as a heart, okay, heart is having 4 parts. For example, see, 2 parts in the atrium, 2 parts in the left atrium, 2 parts in the right ventricle, 2 parts in the left ventricle. What are these parts? What are these parts are? For example, if you look at the right ventricle is divided into 2 parts. Ye dekho, one part is called as the rough part, one part is called as the smooth part. Left bhi एक रफ पार्ट होगा, एक स्मूथ पार्ट होगा. एट्रियम में भी एक रफ पार्ट होगा, एक स्मूथ पार्ट होगा, और लेफ्ट एट्रियम में भी एक रफ पार्ट होगा, एक स्मूथ पार्ट होगा. Okay, so this rough part, whatever is there in each chamber, okay, इस rough part का नाम है trabeculated part. What is the other name for the rough part? That is called as your trabeculated part. Clear all of you? Rough part is also called as your trabeculated part. Now we shall discuss all these important things. Okay, right. So all of you just look at this particular picture. Can you figure out that these are the rough parts? Okay, rough part का नाम क्या रखा मैंने? Rough part is called as your trabeculated part. If you want to look at the real picture also, ये देखो, ये पूरा rough है ना? ये देखो, ये पूरा rough है ना? This rough part over here is called as a trabeculated part. Okay, then what are the smooth parts called as? What is the name of the smooth part called? For example, ये क्या है? What is this? Right atrium. Right atrium में ये जो smooth part है, this is called sinus venereum. Right, guys, again I'm telling you, keep this thing in mind. Smooth part of right atrium is called as sinus venereum. Okay, next, smooth part of right ventricle is called as conus arteriosus. Smooth part of left ventricle is called as aortic vestibule. फिर से, smooth part of right atrium is called sinus venereum. Smooth part of right ventricle is called as trabeculated, conus arteriosus. Smooth part of left ventricle is called as aortic vestibule. Now we shall also discuss from where are these structures developing. Okay, so first let us start with the heart tubes here. Now heart tubes में क्या बोला था मैंने? Heart has got arteries, heart has got veins. तो arteries के लिए एक tube होना चाहिए. For arteries development you need one tube. For veins development also you need one tube. So this is called as arterial end. This tube is called arterial end, and this tube is called venous end. 2 tubes are done. Next, another tube. We should develop atria. We should develop ventricles also. So atria are developed from primitive atrium. Ventricles are developed from primitive ventricle. Okay. The last, how many tubes are left? Only one tube is left. That is called bulbous cordis. I just want you to remember number 2. 2 matlab alphabet B. B for bulbous cordis. Okay. B stands for 2. That is bulbous cordis. Okay. Chalo. Arterial end. From arterial end, what structures will develop? From this tube, pulmonary artery will develop, aorta will develop. Okay. Mission accomplished. Pulmonary artery, aorta. Both the arteries are done. Next. From primitive ventricle, what structures are developed? Remember this thing. primitive ventricle will develop into, again I'm telling, primitive ventricle will develop into rough part of right ventricle, rough part of left ventricle. Primitive atria will develop into rough part of right atrium, rough part of left atrium. All of you just look at this. Primitive ventricle is developing into your trabeculated part of right ventricle, trabeculated part of left ventricle, and primitive atrium is developing into trabeculated part of right atrium, trabeculated part of left atrium. So I hope this one, arterial end is easy for you, primitive ventricle is easy for you, primitive atrium is easy for you. Coming on to bulbous cordis. Bulbous cordis is developing into what? Bulbous cordis. Here देखो. Simple way to remember. Alphabet number 2 gives you an alphabet of B. Okay? Alphabetical order में first 3 alphabets क्या होगा? A, B, C. What is A? A stands for aortic vestibule. B stands for what? Bulbous cordis. C stands for what? Conus arteriosus. मतलब aortic vestibule and conus arteriosus are developed from bulbous cordis. So what is aortic vestibule? Aortic vestibule is a smooth part of left ventricle. Okay. And what is conus arteriosus? Conus arteriosus is a smooth part of right ventricle. Okay. हो गया? Till here you are done. The last part we are left over is the venous part. In the venous part, 3 structures are there. Mainly one structure you remember, that is sinus venerum. What is sinus venerum? The smooth part of the right atrium. Okay. Along with that, coronary sinus भी यही से develop होगा. What is coronary sinus? All the veins that drain blood into this coronary sinus. We will discuss what are the veins that are draining blood into this coronary sinus. I will discuss it in a minute. Okay. But till here, guys, just tell me development of heart tubes. All of you understood? I'm just telling you the method how to remember. That's all I can do. But remembering the things, it is your part. Okay. Till here you remember? Very good. Right. Next important thing. Next important thing over here. What is this important thing? What is this important thing is that this is called as your bronchial tree. Now bronchial tree you have been studying from childhood onwards, right? But still I'll give you some tricks to remember this bronchial tree. So all of you know primary bronchus dividing into secondary, uske baad tertiary, uske baad terminal. Till terminal bronchus, whatever you can see in the blue, this is called conducting part. Matlab, it will only conduct the air. It is not responsible for any kind of gaseous exchange, only conduction of air. But terminal bronchus is again divided into lobar, lobar bronchiole, terminal bronchiole, respiratory bronchiole. So all this green color part which I mentioned over here is the respiratory part where the real respiration happens, where the real exchange happens. Clear all of you? There are also other names that are given. Primary, secondary, tertiary is a simple thing. They won't ask you. They will ask you this. Primary is principal. Okay. Secondary is lobar. Tertiary is segmental. Okay. Why? How do you remember all these things? How do you remember all these things is that just remember the mnemonic. Please stop writing letters. Okay. So please stop writing letters. So when I tell please, P-L-E-A-C, please, right? So please is principal. Clear all of you? What is please over here? Please over here is principal. Please. Okay, fine. Please, P-L-S, please. P stands for principal bronchus, L stands for lobar bronchus, and S stands for segmental bronchus. Please stop. So when it will stop, it's T. Okay. Stop is T. T stands for what? Terminal bronchus. Writing letters. So letters, what is the short form of letters? LTR. Okay. LTR. That gives you what? Letters. LTR gives you letters. Okay. Please stop letters. If you remember this, then the bronchial tree is very easy. Okay. So you should know which is conducting part, which is respiratory part. So till here is everyone clear, guys? Yes or no? Yeah, give a thumbs up if you are clear. Coming on to the next easy part in the thorax which we shall be discussing is the ribs. Okay. How many types of ribs? This thing also you have been studying a number of times right from your MBBS, right from your +2, I think, right? So in human physiology, human biology, you have been studying this. So coming to the types of ribs, right? What are the two types of ribs? Some are called as typical ribs, some are called as atypical ribs. Typical ribs are what? 3 to 9 ribs are called as typical ribs. ये छोड़ के बाकी सब जो है atypical ribs. There is another classification also, very famous classification, that is true ribs, false ribs. If you are truly committed to someone, right? So that is called as true ribs, right? You are committed to someone, at the same time you start scratching another girl. That is called as false ribs. That is a false relation. Okay. So what is true ribs over here is that, see, ribs all the way start from the vertebra, all the way they come like this and attach to the sternum. So from the vertebra, if a rib is coming and attaching to the sternum, that is called true ribs. So 1 to 7 ribs are true ribs. When it comes to false ribs are not directly attached to the sternum. Okay, false ribs are not attached to the sternum. From where do these false ribs start? They start from vertebra only, back. They come all the way front, but they do not attach to the sternum. So what are they? The remaining 8 to 12, the lower 5 ribs. Simple way to remember is upper 7, lower 5. So articulate with sternum anteriorly. Here they do not articulate with the sternum anteriorly. Okay. So ribs which do not articulate with the sternum anteriorly are again divided into two. What are these two? I will show you a picture and then I will teach you. So all of you just pay attention to this. Okay. So just look at this. All of you see here. First rib is attached to the sternum, second, third, fourth, fifth, sixth and seventh is also attached to the sternum. But look at 8, 9 and 10. Are they directly attached to the sternum or initially they are attached to what? 7th rib. With the help of 7th rib, they are attached to the sternum. Okay. So 8th, 9th, 10th ribs are not directly attached to the sternum. See, 8th, 9th ribs, where are they attached? They are attached to the costal cartilage of what? 7th rib. From there they are attached to the sternum. But 11th or 12th jo hai, they are not attached to anything. They are just floating like that. All of you look at this picture. Ye dekho. Look at this. Ye dekho. Ye wala rib dekho. Is it attaching to anything? No. Is it attaching to anything? No. So the last two ribs are called as floating ribs. So I hope this explanation is clear regarding your ribs. So anything they can change it and ask you. So you have to be aware of these things. Okay. The next important thing we shall be discussing is your intercostal muscles. How many intercostal muscles you have got? Outside you have got one intercostal muscles. Inside you have got one intercostal muscle. And inside to that also you have got one intercostal muscle. So external intercostal muscle, internal intercostal muscle, innermost intercostal muscle. How many? 3. External, internal, innermost. Ye dekho, external intercostal muscle, internal intercostal muscle and innermost intercostal muscle. Innermost intercostal muscle is again divided into 3 types. Actually, ये 3 muscles मिलके मिलाके you have to call it as innermost intercostal muscles. What are those 3 muscles? Remember by the mnemonic SINS. S-I-N-S, SINS. S stands for subcostalis, I-N stands for intercostalis intimus and S stands for sternocostalis. Okay, subcostalis, intercostalis intimus and sternocostalis, together you call it as intercostalis intimus. Okay, clear all of you? Right. So first let us start discussing about external intercostal muscles, then internal intercostal muscles. Look at the external intercostal muscle. How are the fibers of external intercostal muscles? Don't you think they are projected downward like this? Downward and all the way they are going towards the midpoint like this. Anything going to the midpoint is called as medial. ये देखो downward and medially projected. Look at internal intercostal. ये देखो internal intercostal ऐसे ऊपर जा रहा है ना. Look at these fibers. Aren't they going top? But they are going top. They are going upward like this towards the midpoint again. So they are going upward medially. So what you need to know? External intercostal they proceed downward medially, or internal intercostal जो है they proceed upward medially. Janvi, yes, this is more than enough. This is more than enough, Janvi. That's what I've been telling you. The previous live sessions, around 8 questions were covered in this. I'm expecting more than 8 questions because this is completely updated version which I've kept it here. So this will be useful for you. Okay. External intercostal, internal intercostal हो गया. right? Now the same muscles I am showing it to you in another way. For example, you make a transverse section, okay? You cut my body like this. From the top you see, okay? Anteriorly what do you have? Anteriorly you have got sternum. Piche kya hoga? Piche you have got vertebra. Okay, why am I framing step by step concept? You will understand in a minute. ये देखो, what is the outermost layer? That is your skin. Skin के नीचे क्या होगा? Fat. After that, what is the next muscle you should have? External intercostal. ये देखो, this muscle over here is your external intercostal. After that, what do you have? Internal intercostal. ये देखो, internal intercostal. After that, what do you have? Innermost. Innermost, I told you 3 muscles by the mnemonic SINS. S stands for what? Subcostalis. ये देखो, this is subcostalis. N stands for IN stands for intercostalis intimus, and another one is sternocostalis, which is attached to sternum. Clear, all of you? Guys, till here all of you are clear? Why am I telling you? Why am I telling you all these things? Why am I telling you? Janvi, just now I told that this is more than enough. Don't worry. Right? This will cover up most of your MCQs. Okay? And the session is going to be lengthy, which means we are covering a lot of topics, right? So most of the MCQs will be asked from this. Okay, I guarantee with that. So why am I telling you this is that, for example, guys, whenever you have an infection within the pleural cavity, for example, let us say if you have got pleural effusion, there is a lot of fluid that has been accumulated in the pleural cavity. Now, fluid ko, how will you remove that fluid? Through urine? Will you excrete it through urine, or will you attach the pipe all the way from the lungs to the urinary bladder? No. What you do is that you put a syringe from outside and then you drain the fluid. But if you are putting a syringe from outside, thoracic cavity is a very important cavity. There are a lot of structures that will be injured. Hai? So what are the layers you are exactly piercing? Dekh ke batao, guys. All of you look here. Just look here. For example, where is my needle here? Ye dekho, ye needle. This is the needle over here. This is the needle. Okay. Now tell me, what are the layers I have pierced? First, I have pierced the outermost layer, that is your skin. Ye dekho, skin gaya, right? Skin, outermost layer I have pierced the skin. After skin, subcutaneous tissue. After that, what is the next muscle I have pierced? What is this? External intercostal muscle. After that, what is the next muscle I have pierced? That is your internal intercostal muscle. After that, the next muscle is what? Is it subcostalis, or is it sternocostalis, or is it intercostalis intimus? It is intercostalis intimus. Okay. After that, I have got this blue color fascia, which you can say, this fascia is called as endothoracic fascia. Endothoracic fascia ko bhi pierce karne ke baad, right? Now your needle will enter into parietal pleura, और यहाँ पे जो fluid है ना, you can suck the fluid outside. Right? Very good, Mantis. Very good. So till here you understood. So the same thing I have kept it here. Okay. Skin, subcutaneous tissue, external intercostal, internal intercostal, intercostalis intimus, endothoracic fascia, and parietal pleura. This is the way I want you to remember it. Okay. This is the final point I want you to remember it. Clear, all of you? Right. Now, if you are looking, if I am cutting my body like this, right? So you can see a rib on the top, a rib on the bottom, upper rib, lower rib. Abhi ye outermost muscle kya tha? What is this? Now I am framing another concept. Outermost muscle kya hai? What is this? External intercostal. Center mein jo hai, what is this? This is called as internal intercostal. Inside you have what this muscle? This is called as innermost intercostal. Guys, dhyan se suno, this is very important point. So between internal intercostal muscle and between innermost intercostal, दोनों muscles के बीच में, you see a vein, you see an artery, you see a nerve. That is why I am telling it as vein. Okay. So every intercostal space, whichever intercostal space you want, you select. 7th, 8th, क्या चाहिए? 11th, 12th, any intercostal. 12th we don't have intercostal. Sorry. 11th intercostal, 10th, 9th, 7th, 8th, any intercostal space you see. First you will have vein, next you will have artery, next you will have nerve, except for the first intercostal space. First intercostal space में उल्टा होगा, पहला होगा nerve, उसके बाद होगा artery, उसके बाद होगा vein. Okay, so this is some of the important thing which you need to remember. Now, what is that putting needle inside your thoracic cavity and draining the fluid? This procedure you call it as pleuriscentesis or pleural tap. Guys, now you tell me, it is safe to put the needle above the surface of the rib, or it is safe to put the needle below the surface of the rib? बताओ, अगर ये रिब है, ठीक है, देयर आर टू रिब्स, इफ इट इज सेफ टू पुट द नीडल along the superior border of the rib or it is safe to put the needle along the inferior border of the rib, बताओ, superior or inferior, बताओ. Very good, Mantis. Very good. It is safe to put the needle. Very good, shall we? It is safe to put the needle क्योंकि you are not damaging the structures. That is a very important point. ये देखो, along the superior border of each rib. Okay, this is one of the important thing which you need to know. Right? ये देखो, this is your external intercostal, this is your internal intercostal, this is your innermost intercostal. Do not put the needle like this. Put the needle through the lower border. Okay. So till here you are clear. So this is all you need to know regarding the intercostal muscles. Coming to the intercostal nerves. Guys, if you remember, ये सब intercostal space का check करें ना, so everything will be the same number only. Okay, nothing to worry about that. So 12 pairs of ribs है. If 12 pairs of ribs are there, how many intercostal spaces will be there? 11. So each intercostal space is having one intercostal nerve. So 11 intercostal spaces मतलब कितने nerves होना चाहिए? 11 intercostal nerves. Then what is this extra? This is called subcosta. ये देखो, ये सारे ribs है ना, ribs के नीचे जो part है, this is called subcostal region. But ये जो है intercostal region. ये देखो, here I have got intercostal nerve, intercostal nerve, intercostal nerve. Should I call it as intercostal or subcostal? Subcostal nerve. So 11 plus 1, that is completely 12 intercostal nerves you have got. Okay, so 11 intercostal nerves, 1 subcostal nerve. Now these intercostal nerves, same like ribs, they are also divided into typical and atypical. Typical क्या है? 3, 4, 5, 6 are typical. बाकी सब atypical. Okay, what do you mean by typical? For example, this is a third pair of, ये देखो, this is a third intercostal nerve. ये third intercostal nerve क्या करेगा पता? This will supply only third intercostal space. Other than that, it will not supply anywhere. Okay, that is why it is called as typical. अभी यहाँ पे ये first देखो. Let us say this is the first intercostal nerve. This first intercostal nerve supplies the first intercostal space. At the same time, its branches will come out and supply the other organs, other parts also. So typical मतलब supply its own intercostal space. Atypical मतलब supply beyond, मतलब वहां पे supply करेगा और बाहर जाके भी other structures also it will supply. Okay, so if you just remember typical, atypical is easy. For example, let us say T1. ये देखो, what is this? T1. T1 will join the brachial plexus. Brachial plexus, what is that? C8 to T1. You see, T1 is actually supplying the T1 intercostal space and also it is taking part in the brachial plexus. Second important thing, T2. From the T2 also the nerve comes out and supplies to the skin of the axilla and middle part of the upper arm. ये देखो, skin of the axilla, middle part of the upper arm. That T2 मतलब कहाँ पे होगा guys? Just guys, one very important logic which you have to remember. T2 मतलब somewhere here, back side, somewhere here, right, in the intercostal spaces, somewhere here, right? So it is supplying a T2 space. At the same time, it is coming out supplying to the skin of the axilla and the medial surface of the arm. Yes or no? That is the reason why when I have heart attack here, why will I have pain all over here? The reason is because of that nerve. You are getting it? Because of that nerve. For example, if I have acute pancreatitis here, why will the pain radiate to the back? It is because of the nerve that is going to the back, because of the atypical nerve that is going to the back. Is it clear to everyone? For example, if I have pain, if I have renal stone, I should have pain here, but why the pain is going towards the groin? It is because of that radiation, because of the nerve that is passing out. Clear all of you now? Hope everyone is clear now. Okay, right. So this is the thing. So you just have to know what are typical, what are atypical. Typical याद रखो, atypical is automatically you can sort it out. Next most important thing we are discussing here is intercostal arteries. In the intercostal space, what did we discuss, guys? We discussed intercostal. What did we discuss? Intercostal muscles we discussed. Intercostal space we have discussed. Now we'll discuss about intercostal arteries. Two intercostal arteries. Front anterior intercostal. अगर पीछे है posterior intercostal. You're getting it? Whatever it is, anterior or posterior, most of them they will start from the subclavian artery only. Okay, so let us go down here. So all of you look here. This picture, all of you know, I'm not explaining this picture. I hope all of you know this picture. This is your subclavian artery. Subclavian artery has got three parts. I have already told you the blood supply, vitamin C and D. Remember, subclavian artery first part, second part, third part. Abhi, ye subclavian artery first part, if you see, from here there is an artery that is coming down all the way. This artery is internal thoracic artery. ये जैसे नीचे आ रहा है thorax के अंदर, internal thoracic artery. The same picture I'm putting it here. ये देखो. Subclavian artery branch here. What is this? Internal thoracic artery. Now internal thoracic artery is coming down all the way till where it is coming? It is coming down all the way till sixth intercostal space. Sixth intercostal space में क्या हो रहा है? Internal thoracic artery is dividing into two branches. What are those two branches? One branch is called superior epigastric artery. Another branch is called as musculophrenic artery. Fine. Why are you telling all these things? Why am I telling you all these things is that just now I told about intercostal arteries are two, anterior and posterior. Okay. So now I am discussing about anterior intercostal arteries. Anterior intercostal arteries. So you might ask a question, sir, from where anterior intercostal arteries will emerge? Anterior intercostal arteries will emerge from this internal thoracic artery. Internal thoracic artery. So in each intercostal space, how many anterior intercostal arteries are there, guys? The picture देख के बताओ. Each intercostal space में how many intercostal arteries are there? Two. Two anterior intercostal here. यहाँ पे भी two. ठीक है? यहाँ पे भी two. यहाँ पे भी two. यहाँ पे भी two. All of them are two, right? But from seventh intercostal space onwards, anterior intercostal arteries are emerging from where? Are they emerging from internal thoracic artery? No, they are emerging from musculophrenic. This is the important point. I want to click it in your mind. Okay, what do you need to know? That sixth intercostal space, that till sixth intercostal space, internal thoracic artery is giving two anterior intercostal arteries. From seventh intercostal space, musculophrenic artery will take the job to give two anterior intercostal arteries. This box, if you remember, also chalega. Clear, everyone? Is it clear to everyone? So this is all the discussion about your anterior intercostal arteries. I hope this is clear to all of you. Right, guys? Is it clear to all of you? Very good, Mustafa. Right. Yeah, देखो, this is a direct picture which I have taken from Vishram Singh. So this is your internal thoracic artery over here. This internal thoracic artery is coming down all the way. और ये देखो sixth intercostal space में क्या हो रहा है? Dividing into two, musculophrenic and superior epigastric artery. Okay, superior epigastric artery. Right. Next important thing I want to tell you over here, the one clinical importance, that internal mammary artery, we don't need the 100% of the artery. Whenever there are any blocks within the heart, for example, if patient is having coronary artery disease, coronary artery के अंदर block हुआ, maybe right coronary artery or left coronary artery. So what you need to do, you don't try to take out that block. Instead, you create a bypass. Okay? I hope all of you know this thing. Let us say this is a coronary artery. ठीक है? अभी ये coronary artery के अंदर यहाँ पे block हो गया. Right? Now what you do is that you make a opening here and now you attach an artery like this. ये देखो ऐसे. You attach an artery here. So क्या होगा यहाँ पे? The blood whatever is coming like this, it will take a bypass and then it will pass like this. This procedure is called as coronary artery bypass grafting. What is this called? Coronary artery bypass grafting. What are the vessels you use for coronary artery bypass grafting? One I use is internal mammary artery. Another one in the leg you have, that is called as a greater saphenous vein. Okay? Very good. Sometimes you even have a radial artery also, sometimes you use. Okay? Radial artery also you can use. So internal mammary artery and ग्रेटर सेफेनियस वेन. अब ये भी डाउट आएंगे तुमको, सर इंटरनल मैमरी आर्टरी में राइट साइड भी होगा लेफ्ट साइड भी होगा, विच वन? मोस्टली यू चूज द लेफ्ट इंटरनल मैमरी आर्टरी. ओके, दैट्स व्हाई कॉल्ड एज लाइमा, LIMA, लाइमा, लेफ्ट इंटरनल मैमरी आर्टरी. ओके, shall we go? Very good, she already answered it. Very good. So all of you can look at this picture over here. ये देखो, Can you look at this particular picture? From the subclavian artery, you are putting a vessel down over here. Okay, ये देखो. From here all the way down you are using here. ये देखो. From here all the way down you are using here. Can you see the blockage here? Right. So this procedure is called as Lima. So we are done with anterior intercostal arteries. You just need to know each intercostal space में कितने intercostal arteries आएंगे, right? How many intercostal arteries are gonna come, and you should know that anterior intercostal arteries till which level are they emerging from internal mammary artery, from which level they start emerging from the musculophrenic artery. Coming to the posterior intercostal artery. Posterior intercostal artery is very easy, guys. See, again the same thing. Subclavian artery में देखो first part, second part, third part. Third part of subclavian artery, that is vitamin C. C stands for what? Costocervical trunk. Costocervical trunk. So this costocervical trunk, ये देखो यहाँ पे blue color one is your costocervical trunk. Costocervical trunk is giving a branch. What is this? Superior intercostal artery. This superior intercostal artery is giving two branches. What are these two branches? These two branches over here are called posterior intercostal arteries. First and second posterior intercostal arteries. Okay. Now, yeah, Lima is used most commonly. Posterior intercostal arteries. Okay. Then from then what about the third, fourth, fifth and all? From where do they arise? They directly arise from the aorta. Very, very important thing. Okay. First two posterior intercostal arteries arise from superior intercostal artery, but whereas all the way from 3 till 11, all these posterior intercostal arteries, they directly arise from aorta. They directly arise from the aorta. Okay, so keep this thing in mind. Is this clear to all of you? So we have discussed regarding the intercostal space. We have discussed intercostal arteries. We have discussed intercostal nerves, and now we shall be discussing about and we also discussed intercostal muscles, and now we shall be discussing about intercostal veins. ये intercostal veins का जो concept है, you guys already know it. Okay, have you heard of hemiazygous, azygous, accessory hemiazygous and all? Right? So if you want to remember this entire picture, it is your wish. Or for exam point of view, if you remember this only one box, also your wish. Okay, but before I explain you this box, you have to know this picture. Okay, right. Now we are discussing intercostal veins, which are also called as your azygous, hemiazygous veins on the right and on the left. Okay, so all of you look here. On the right side, the first intercostal vein. The right side, the first intercostal vein, where it is draining into, observe this thing, guys. Right side, first intercostal vein, where it is draining into right brachiocephalic vein. Okay, done. Left side dekhte hain. Left side, the first intercostal vein is draining into where? It is also draining into left brachiocephalic vein. Right side mein right brachiocephalic, left side mein left brachiocephalic. Okay, next. The second, third and fourth intercostal veins on the right side join together to form a common vein called as right superior intercostal vein. ये कहाँ पे drain हो रहा है? This is draining into a large vein over here. This is called as azygous vein. Okay. Now let us go on to the left side. Left side में भी second, third and fourth together they join together to form a common vein. यहाँ पे right superior intercostal vein, यहाँ पे क्या होगा? Left superior intercostal vein. So this drains where? Again back into left brachiocephalic. अभी difference देखा? You have seen the difference. Here it drained into azygous, but here it drained back into the same left brachiocephalic. This is the first difference which I want you to point it out. ठीक है? Next, all the way 5, 6, 7, 8, 9, 10, 11, all of them they drain into azygous. Okay? Now after in this 5, 6, 7, 8 on the left side will drain into accessory hemiazygous. 9, 10, 11 will drain into hemiazygous. Okay, so if you just understand the differences on the right, picture looks little horrible. Okay, but if you understand the picture, right, what are the things that are located on the right and on the left, this will be easy. Sir, ये सब नहीं चलता, just tell me one box and all. चलो, this is a box. right superior intercostal vein drains into esophagus. Left superior intercostal vein drains into left brachiocephalic. Just now I told you. Next, right side 5 to 11 will drain into esophagus. Left side 5 to 8, first 5 to 8 will drain into accessory hemiesophagus. 9 to 11 will drain into hemiesophagus. Even if you remember this, it's fine. Is it clear to everyone? Till here all of you understood? Just give a thumbs up, right? So that I can proceed on to the next part. Right. So till here you understood, right? Mantis last slide मतलब ये वाला this one diagram, ये देखो, this is a diagram. Okay, right. चलो, now let us discuss about pleural recess. प्लूरल रिसेस मतलब क्या? प्लूरल कैविटी के बीच में जो गैप्स होगा ना, गैप्स बिटवीन द प्लूरल कैविटी इज कॉल्ड एज प्लूरल रिसेस. ओके, सो ऑल ऑफ यू जस्ट पे अटेंशन. First of all, what are the different types of, see, anatomically we have got parietal and visceral. Based upon the location, there are 4 different types of pleura. All of you look here. This green color pleura which you can see over here, what is this? This is called as the cervical part of the pleura. What is this pleura? Cervical part of the pleura. Next, what is this second part of the pleura? This second part of the pleura is facing your ribs. So it is called as a costal part of the pleura. What is this? Costal pleura. Next, this third part of the pleura is facing a diaphragm. So you call it as diaphragmatic pleura. What is this? Diaphragmatic pleura. And fourth is facing what? बीच में क्या होगा यहाँ पे? Heart. Right? So fourth one is facing your heart or your mediastinum. That is why you call it as a mediastinal pleura. So how many pleuras we have got? Cervical pleura, costal pleura, diaphragmatic pleura and mediastinal pleura. Okay. Now, out of all these pleuras, the first 3 pleuras are innervated by intercostal nerve. Whatever it might be, first, second, third, whatever it might be, the first 3 are innervated by intercostal nerve. But the last one, the mediastinal pleura, is innervated by phrenic nerve. Okay? Most of the students, you know, what do they do? Diaphragmatic pleura is innervated by phrenic nerve. No, that is a mediastinal pleura that is innervated by phrenic nerve. This is the first point which I want you to understand here. Second point is that expanded regions of pleural cavities are called pleural recesses. That's what I told you. Yeah, dekho. If this is a parietal pleura, outside you got is a parietal pleura. Okay, inside you got is a visceral pleura. But at some places, do you see parietal pleura, visceral pleura are separated from each other? These separated cavities are called as recesses. कितने recesses है? 2 recesses. ये देखो, this is one recess. Where is this recess located? One side ribs are there, one side diaphragm is there. So you call it as costodiaphragmatic recess. And where is this recess is located? One side ribs you have got on this and mediastinum, costomediastinal recess. Costodiaphragmatic, costomediastinal. Guys, if I throw water all the way, this is a jug like this, right? If I'm pouring water like this, ab batao, most likely water will enter into costodiaphragmatic or it will take an upturn and then enter into costomediastinal. Batao, kahan pe enter hoga water? Where will the water most commonly enter? The water most commonly will enter into costodiaphragmatic recess. That is the reason why costodiaphragmatic recess is called as the most dependent area. Most dependent recess. Whenever there is fluid within your lungs, the fluid comes down and accumulates within your costodiaphragmatic recess. Okay. So, in case of pleural effusion, the fluid accumulation will happen in the costodiaphragmatic recess. Clear all of you? So you told me, sir, pleural effusion and all, you have to remove the fluid, and you also told me you have to put the needle along the superior surface of the rib so that you don't damage the structures. But exactly where? You have to do pleural wrapping in the mid-scapular region or the posterior axillary line. ये देखो, ये axilla है, this is axilla, राइट, इस एक्सिला में ना ये देखो, ये हो गया एंटीरियर एक्सिलरी लाइन, ये हो गया मिडिल एक्सिलरी लाइन, और ये हो गया पोस्टीरियर एक्सिलरी लाइन. सो इन द पोस्टीरियर एक्सिलरी लाइन यू हैव टू पुट द नीडल. So parietal pleura pain sensitive, visceral pleura pain insensitive. If you want to remember it or else leave, right? So then, and I even thought of putting some x-rays over here. Okay, so I don't know if I have those x-rays. No, I don't have any x-rays with me, but still you better practice the x-rays, right? On my other videos we have the x-rays. Anyways, in the PDF I will include the x-rays and I'll send it to you. Okay, so x-rays of pleural effusion, very easy to identify. Okay, now coming to the next important thing, that is your root of your lung. What is the root of the lung? All of you know what is root of the lung, right? So for example, if for example this is my left lung और यहाँ पे right lung होगा, ये surface जो है ना, this is called as the root of the lung. Okay, the place where your bronchi, bronchioles, all of them they enter into the lung, that is called as the root of the lung. ये देखो, ये हो गया root of the lung. So we should discuss what structures are located on the right side of the lung, left side of the root of the lung. Very dead easy topic. All of you just pay attention. See, just find the differences between right and left. ये हो गया right lung और ये हो गया left lung. ठीक है? Center में यहाँ पे क्या है? What is this? You have got bronchial artery. How many bronchial arteries are present on the right lung? One bronchial artery, right? Look on the left side. Left side में कितने bronchial arteries है? There are two bronchial arteries. Okay. Now come back to the right. How many bronchi you have got? ये देखो, two bronchi. But on the left side, how many bronchi you have got? One. You see, vice versa. One bronchial artery on the right, two bronchial artery on the left. Okay. Two bronchus on the right, one bronchi on the left. You're getting this difference? Next, ये bronchial artery के ऊपर, above this bronchial artery, the bronchus which you have is called epi. Epi in the sense above. Epiarterial bronchus. Then what is a bronchus below called as hypoarterial bronchus? Short forms are eparterial bronchus and hyparterial bronchus. Okay. So these are the major differences which you need to know. Next, how many pulmonary arteries? ये देखो, right pulmonary artery यहाँ पे होगा, left pulmonary artery. How many pulmonary veins? Two right pulmonary veins. Here we have got two left pulmonary veins, and remaining everything is same, except for this part. Remaining everything is symmetrical. Is it clear to everyone? Yes or no? Right. The next important thing we shall be discussing is bronchopulmonary segments. But before we discuss this bronchopulmonary segments, you have to know that the right lung, whatever is there, is divided into three lobes. Right upper lobe, right middle lobe, right lower lobe. How it is divided? With the help of a horizontal fissure, with the help of an oblique fissure. But left side, you don't have a horizontal fissure. You only have oblique fissure, dividing the left lung into left upper and left lower. Next important thing is that each lung is having 10 bronchopulmonary segments, 10 on the right side, 10 on the left side. Okay, 10 bronchopulmonary segments on the right, 10 bronchopulmonary segments on the left side. What are the names of these bronchopulmonary segments? I will teach you now. You are learning it today. Okay, so these are the bronchopulmonary segments. So how many segments are located in the right upper lobe? 3, middle lobe 2, lower lobe 5. और यहाँ पे 5 and 5. Guys, you tell me, what is this part called? This is called as apex, right? What is this part called? This is called as base. Okay, so apex के पास कौन सा bronchopulmonary segment होगा? Apical segment. Always you have got apical. Next, A for apical. A also stands for anterior. Opposite of anterior is what? Posterior. Opposite of anterior is posterior. Next, second one, here you have got two segments, lateral segment, medial segment. Lateral and medial. Next, down here, I want you to remember the mnemonic SMALP. S-M-A-L-P, SMALP. What is SMALP? See, what are the different directions or the sides we have got? See, surfaces. See, S stands for superior, M stands for medial. You tell me. S stands for superior, M stands for medial, A stands for anterior, L stands for lateral, P stands for posterior. So superior basal, क्योंकि ये basal segment है, medial basal, anterior basal, lateral basal and posterior basal. The same 5, put it a copy paste over onto the left side. Okay, and left side on the top everything is same. Apex को क्या बोलते हैं? Apical. A for apical, A also stands for anterior. Anterior का opposite क्या है? Posterior. The only thing which you need to remember is right side you have got lateral medial, left side you have got superior inferior. That's it. These are your bronchopulmonary segments. Is it clear to everyone? All of you understood these bronchopulmonary segments, guys? Yeah? Perfectly clear. Very good. Now let us enter into the next important thing, that is your pericardium. Right? Guys, you know how many layers of pericardium we have got? We have got an outer layer, we have got an inner layer. What is pericardium? Pericardium is nothing but covering of the heart. Okay? So outer pericardium is called as fibrous pericardium. Inner pericardium is called as serous pericardium. Okay? Serous pericardium is again divided into two. One is called parietal layer, one is called visceral layer. Between parietal and visceral layer, the cavity which you have is pericardial cavity, and uske andar jo fluid hoga, pericardial fluid. Why are you telling this? Why am I telling this is that, for example, pericardial fluid ke andar if there is bacteria, the condition you call it as pericarditis, your pericardium will be inflamed. For example, within this pericardial fluid, if the amount of fluid is too much increased, that you call it as pericardial effusion. See, in the lungs, if the fluid is increased, pleural effusion. In the heart, if the fluid is increased, pericardial effusion. So, whenever a patient is having pericardial effusion, you have to immediately treat the patient. If you are not treating it, what will happen? Pericardial effusion will end up in a condition called as, what is that? Cardiac tamponade. This part, why am I discussing is, this part will be asked in your medicine part. So right now just grab up the things. So pericardial fluid excess, if it will become in the last stages, it will lead into cardiac tamponade. So all of you just look at this. Cardiac tamponade. So in the cardiac tamponade, 3 important things you will see. One is hypotension, distension of neck veins and muffled heart sounds. The explanations I can't give it now, we just have less time now. So hypotension, distension of neck veins, ये देखो jugular vein distension हुआ ना. What neck vein has been distended? Jugular vein. Increased JVP. There is increased jugular venous pressure, JVP. Jugular vein के अंदर pressure ज़्यादा है. Okay. So hypotension, distended neck veins, muffled heart sounds, together it is called Beck's triad, and Beck's triad is seen in case of cardiac tamponade. So whenever a patient with the cardiac tamponade is seen, he is basically unconscious because of hypotension and all. So immediately what you need to do, you need to decompress the heart. How do you decompress the heart? Heart is compressed all the directions with the fluid. So in the xiphisternal point, you need to put a wide bore cannula and then remove all the fluid there, and the compression on the heart will stop and suddenly you will start breathing. Okay, so this is called as Beck's triad. Okay, here all of you, right? Now we shall discuss about the heart. We shall discuss the blood supply of your heart. Okay, so coming to the blood supply of your heart, what are the important things? I already told you, I'm not discussing this again. Okay, ये तीनों क्या है? What are these 3? Aortic sinuses, aortic bulb. Together you call it as ascending aorta. From the aortic bulb to the lower border of T4, what is this called as? Arch of aorta. This thing you know, right? Now, what are the names of these aortic sinuses? See, 1, 2, 3. 3 aortic sinuses are there. So what you do is that put a line here. Put a line here and divide these aortic sinuses. So how do you divide? This one is called as your anterior. 2 and 3 are called as posterior. In posterior, this is called as the right. This is called as the left. So now name all these things. Anterior aortic sinus, right posterior aortic sinus, left posterior aortic sinus. Why are you telling this? Why am I telling you this is that from where your right coronary artery will originate? Right coronary artery will originate from anterior aortic sinus. where your left coronary artery will originate from your left posterior aortic sinus. Is it clear to all of you? Batao, jaldi batao. Yes or no? Very good. Excellent. So now I will teach you blood supply of heart. Not only just blood supply of heart, I want to also teach you which artery blockage will lead to which kind of myocardial infarction, so that it will be useful for your medicine also. Okay, so all of you, just I'm zooming it in. From the first part, what is coming? Right coronary artery. From the third part, what is coming? Left coronary artery. Okay, so all of you just look here. Right coronary artery will come down all the way. It will come down and give a branch called, what is this branch? Right marginal artery. Okay, what is this branch called? Right marginal artery. Next important thing is that look at the left coronary artery. Left coronary artery gives a branch here. What is this branch? Left circumflex artery. और लेफ्ट सर्कमफ्लेक्स आर्टरी से जो ब्रांच नीचे आ रहा है, दिस इज कॉल्ड लेफ्ट मार्जिनल. यहाँ पे राइट मार्जिनल होगा तो यहाँ पे लेफ्ट मार्जिनल होगा, राइट. नेक्स्ट, another branch of left coronary artery which is coming anteriorly and descending down. Anteriorly it is descending down, so you called as left anterior descending artery. Left anterior descending artery. Okay, now look at this right coronary artery, guys. Right coronary artery, it has given right marginal, fine, but right coronary artery went to the back side. After going to the back side, it has also given an artery which is going down. So if this is anterior descending artery, तो ये artery कौन सा होगा? ये होगा posterior descending artery. Are you getting it? Or I can also tell that this artery is present between right and left ventricle. So can I call it as posterior interventricular artery because it is present between two ventricles? Posterior interventricular artery, right? So this is the basic blood supply which you need to know. Now after this, just look at this. Right coronary artery gives blood supply to SA node, AV node, bundle of his. Left coronary artery gives blood supply to right bundle branch and left bundle branch. So this is the blood supply to the conducting system. Okay, so keep this thing in mind. Okay, so all of you, this is from the Springer I have taken, right? You know, sinoatrial node is supplied by the right coronary artery. Atrioventricular node supplied by the right coronary artery. The right bundle and the left bundle were defined to be derived from the left coronary artery. Okay, if you can't see, I'm just zooming it. Okay, so this is the standard mantis. Posterior interventricular artery is defining the cardiac dominance. Yes, अगर posterior interventricular artery जो है, if it is coming from the right side, it is right cardiac dominant. Right? If it is coming from the left side, it is the left side dominant. So mostly it will come from the right side only. Okay. Right. So till here you are clear, guys. All of you are clear till here. Everyone, ping me. Is it clear? Yeah, very good. Chalo. Now, what I'm trying to tell you, guys, all of you just look at this particular picture. This will clear up most of your questions, okay? Most of your questions, and I promise that most of your concepts will be cleared regarding your MI, myocardial infarction and all, okay? Right. So just look here now. What is this wall of the heart called as? This is called as your inferior wall. This is called as your inferior wall. And what is this entire part of the heart called as? This is looking at you. So this is your anterior wall. Okay. Yeah, anterior wall maybe there are two important things. What are those two important things? ये देखो center में जो है, this is called septal part and this is called as a lateral part. So three things I'm telling you. This is called as a inferior part. This is called as anterior septal. This is called as anterior lateral. Anterior septal, anterior lateral. All of you just look here. Inferior wall is supplied mainly by which artery? देखो, right coronary artery is the one which is mainly supplying your inferior wall. I mean, it is giving a right marginal artery, but agar right coronary artery block hua, tell me, your inferior wall will receive the blood? No. So what kind of myocardial infarction the patient will have? Inferior wall MI. Okay, so that is we have written here, inferior wall MI, right coronary artery is most commonly involved. Okay, next, anterior wall. Anterior wall. What do you mean by anterior wall? ये देखो, this entire wall over here is your anterior wall. अच्छे से देखो, this entire wall. Now in this entire wall, what things you can see? ये देखो, फिर से this entire wall is anterior wall. इस anterior wall में ना I can see three parts. What are those three parts? Center में जो है this is called septa. यहाँ पे जो है this is called apex, and this is called as a lateral wall. What are these three? And this is called septal wall, this is called as the apex, and this is called as the lateral wall. Can I call it as anteroseptal, anteroapical, anterolateral? है कि नहीं? I can call it as anteroseptal, anteroapical, anterolateral. Now you just look at the picture and tell me anteroseptal में कौन सा artery है? Which artery is present in the anteroseptal region? बताओ. Very good. Left anterior descending artery. Okay. Now, which artery is present in the anteroapical region? Again the same, left anterior descending only, but distal part of left anterior descending. Distal part of left anterior descending. Now, if I ask you anterolateral part, which artery is present, what will you tell? Your left circumflex artery. So, anterior wall MI can happen at three places. They can happen at septa, apical part, lateral part. If it is in the septa, left anterior descending. अगर apical होगा तो distal part of left anterior descending. Lateral होगा तो left circumflex artery. Is it clear to every one of you? Right? And finally, posterior interventricular artery, if it is blocked, that will lead to posterior wall MI. Very easy. ये देखो, posterior wall MI, posterior interventricular artery. So these are some of the basic MI you have to remember. What is one thing you know in myocardial infarction, guys? Agar myocardial infarction hua, in ECG, what changes you see basically? All of you know one thing, that there is ST elevation. There is ST elevation. See now, very important thing. Remember these things. V1, V2, V3, V4, V5, V6. Okay? V1, V2, V3, V4, V5, V6. Agar V1, V2 में if you see ST elevation, that is called as septal wall MI. Anterior septal wall MI. If V3, V4 leads में ST elevation देखा, that is called anterior apical wall MI. If V5, V6 में ST elevation you see, anterior lateral wall MI. Is it clear to everyone? Will you answer these questions if you get it in the exam? Yes or no, guys? Right? Right? Very good, guys. Very good. Very good. So very easy, guys. Just pata, mostly they will give you these MIs only. Septal wall, anterior wall. Agar difficult banana hai question paper, right? They'll give you anteroapical wall MI. 4-5 options they'll give. In the entire ECG V3, V4 में अगर ST elevation दिखा, blindly anteroapical wall MI. Like that. Right? Chalo, these are the arteries which I just now discussed. Okay. Most common occluded coronary artery है left anterior descending artery. It is called widowmaker. Why it is called widowmaker? Why it is called widowmaker is, अगर left anterior descending artery block हुआ, right? 90% chances that he will die. 90% chances that she will become a widow. That is why it is called widowmaker artery. Okay? Widowmaker artery. Chalo. Coming to the veins of the heart, what are the veins of the heart? I did not draw the picture intentionally because there is no point of drawing the picture. At the end, you have to remember these things. So, coming to the veins of the heart, what you need to remember is that all these veins are draining into finally coronary sinus. When I tell coronary sinus, you should remember from the heart tubes. Which heart tube develops into coronary sinus? बताओ कौन बताएगा अभी? Which heart tube develops into coronary sinus? 1 2 3 4 5. 1 होगा arterial end, 5 होगा venous end. Come on, भूल गए? Very good, very good, Molamu, very good, very good. Perfect, 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 perfect. I'm happy. ये देखो, venous end is developing into sinus venera. You see here, Hi Diksha. So you see here, venous end is developing into your sinus venera. Clear, all of you? Keep that thing in mind. Venous end is developing into sinus venerum. Right. Now, how do you remember the veins of the heart? So remember this thing, that great men see Paris late in the morning. Okay. So if you go to the Paris, so don't go early in the morning at 6 o'clock to visit the Paris. Okay. To look at, to go to the tower, Paris tower and all. Okay. So you have to go late in the morning at 11 o'clock or 12 o'clock. Okay. In the morning. So great men see Paris late in the morning. So why, I don't know. The mnemonic is like that. Okay. So great is greater cardiac vein. No, it did not stuck. It is running. M is middle cardiac vein. C is small cardiac vein. Paris is posterior vein of left ventricle. Late is left atrial oblique vein. Morning is marginal vein. Okay. So is it stuck, guys? Is it stuck? Is my screen stuck? Or is it fine? Fine, right? Right. So this is all, guys, we need to discuss regarding the thorax part. Okay. This is the part which we have to discuss regarding the thorax part. And the next we shall take a 5-minute break, and again we shall discuss regarding the abdomen pelvis. We have to discuss abdomen pelvis. Okay. Abdomen pelvis also will finish very fastly, and after that we will discuss head and neck, and lastly neuroanatomy. Neuroanatomy, I have selected few topics only, so that parts will also three more sections we will discuss, and then we shall close up the session. So in the next, I think, more 3 hours we shall finish up the anatomy here. And after that, yes, you know, after that I have already recorded one video previously telling that what are the important topics which you have to study, right? All the subjects, the important topics, I have recorded it in a video, and PDF I have sent it in the Telegram group also. Please watch that, study those topics before you appear to the exams. And most of the students message me many questions repeated from those topics, many of them. Okay. So do it. Chalo, let's take a 5 minutes break. Okay. Hello guys, how are you all? Thank you so much. Thank you. Right, if you're understanding, then it's well and good, and I'll also have some good energy to teach you all. Right, so now we shall be discussing regarding the abdomen. Okay, in the abdomen, the question which was previously 2 years back, they have asked regarding the abdominal planes. Okay, so you need not to remember much about this. So what you need to know is that, so if you can see here, right, you see, let us start from the lowermost plane over here. So this is your iliac bone, this is your iliac bone. Okay, touching both the iliac bones, you see there is a plane that is passing touching both the iliac bones, right? So actually you will have a small bumpy elevation on each of these iliac bones. So touching these two iliac bumpy elevations, you see a line here. So this particular line over here, which you can see, is called as your transtubercular plane. What is this plane called? This is called as transtubercular plane. This plane over here is called as transtubercular plane. Okay, just above the transtubercular plane, where I have kept this red color dot, you can see over here, this red color dot over here is called as your umbilicus. Okay, this is your umbilicus. So just above, where is your umbilicus present? It is present all the way between L3 as well as your L4. Okay, and next important thing over here is that if you see between L2 as well as L3, okay, between L2 as well as L3, you have got another important plane that is called as subcostal plane. What is this plane called? Subcostal plane. Why are you calling it as subcostal plane? Because this plane starts at the end part of the ribs. The ribs end here, just beneath the ribs you see a plane over here. This is called as a subcostal plane. And next important thing is that above that you have got another plane over here between L1 and L2. This is called as transpyloric plane, which you also called as Edison's plane. Okay, transpyloric plane or Edison's plane. Okay, transpyloric or Edison's plane. So these are the important planes over here. Okay, so just remember it. If question will be asked, then that is well and good. Okay, now when it comes to the abdomen, regarding the microbiology, we will plan the schedule, and if possible we will start a rapid revision. But anyways, there is also already rapid revision taken in this particular channel for microbiology, so you can watch that, not by me but by another faculty. So if you look at the muscles of the abdomen are divided into two groups. What are these two groups? One is, listen carefully now, pay attention, anterior, anterolateral. Anterior मतलब सामने, ऐसे, ठीक है? Anterolateral मतलब on the sides, anterolateral. So anterior are rap. So you go for the studio, you rap, you're a singer, you rap. After rapping, you're tired, and after that you come and eat, right? So you rap it and then you eat it. Okay, you rap the song, come and eat. Rap is what? R stands for rectus abdominis, A stands for anterior, P stands for pyramidalis. Okay, when it comes to anterolateral, E stands for external oblique, I stands for internal oblique, and T stands for transverse abdominis. External oblique, internal oblique, and transverse abdominis. Okay. Yes, Janvi, it is enough. Okay, trust me, it is perfectly enough. Okay, so external oblique, internal oblique, as well as transverse abdominis. So these are the muscles that are located anterolaterally, right? So these are the muscles that are located anterolaterally. Now, if I can show you these muscles over here, you see the muscles which are located anteriorly. Anteriorly, what did we discuss? RAP. R stands for rectus abdominis. You see this particular muscle over here, which is straight in the sense rectus, and located in the abdominal region, so abdominis. So this is called as rectus abdominis. Now, within this rectus abdominis, what is the artery that is supplying here? ये देखो, ये कौन सा artery है? ये external iliac artery है. External iliac artery है, एक branch है ना? You see a branch over here. This branch is called inferior epigastric artery. Okay, and by the way, what are these structures in between? These structures in between, these white color structures in between, are nothing but called as your tendinous insertions. These are called tendinous insertions. Okay, so what is happening is that, for example, if this inferior epigastric artery will rupture, then what will happen? The blood starts accumulating. Where will the blood accumulate? Within these tendinous insertions. So that condition you call it as rectus sheath hematoma. What is that? Rectus sheath hematoma. So in the exam they will ask you rectus sheath hematoma, which artery rupture leads to rectus sheath hematoma. You should write it as inferior epigastric artery. Very, very important. Okay, so this is how it looks. This is how it looks when there is a rectus sheath hematoma. And on the autopsy also, can you see this? Can you see all these blood clots in between the tendinous insertions over here? Very clear picture. Let me show it to you. Ye dekho. Can you see these blood clots within the tendinous insertions? So this is nothing but called as your rectus sheath hematoma. Okay, right. So these are the muscles over here. Rectus abdominis is the muscle that is present in the center. ठीक है, उसके बाद सबसे बाहर outermost muscle is external oblique. If I cut external oblique inside, what I will see? Internal oblique. If I cut internal oblique inside, what I will see? I will see transverse abdominis. Clear all of you? Right. Now, when it comes to anterior abdominal wall, matlab kya? This is what the thing. For example, if I'm cutting my abdomen, what layers will you cut? First, I'm going to cut the skin. After the skin, what is the second layer? That is your subcutaneous fat. After that, what do you have? You have got the superficial fascia. Superficial fascia is divided into two layers. Outer fatty layer, inner membranous layer. Outer fatty layer is called as camper fascia. Inner membranous layer is called as Karp's fascia. Okay. Next, after that, what do I have? External oblique muscle. I told you already. If I cut it, I will have internal oblique. If I cut it, then I will enter into transverse abdominis. If I cut that transverse abdominis also, inside what do I have? I have got deep fascia. Deep fascia is also called as transversalis fascia. You know that in the thigh also we have got fascia. With the help of fascia only, in the thigh, we divided the thigh into compartments, anterior, medial, posterior. Yes or no? So, abdomen के अंदर जो fascia है, ना, this fascia will continue down into the thigh. Okay, this fascia will continue down into the thigh as a deep fascia of the thigh. Okay, so deep fascia of the abdomen will continue as deep fascia of the thigh. And next you have got parietal peritoneum. After that you have got the peritoneal cavity over here. I hope this is perfectly clear to all of you, and I want you to remember all these layers one by one definitely. Okay, right. Now, next most important, and I'm telling you 100% a question will be asked from this. What is this? What is this is, you can see an arc-like line over here which I have drawn. This line is called as arcuate line. What we will do is that we shall make a section above the arcuate line and study, and we shall make a section below the arcuate line and also study. Above the arcuate line, how is the picture? Ye dekho, aise hoga picture. This is above the arcuate line. And this is a picture below the arcuate line. What are we right now discussing is, I am right now discussing about the rectus sheath. Very, 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 very important. I am telling you 100% you will get a question. Okay. So you should know that above the arcuate line, rectus sheath is formed by what? Below the arcuate line, rectus sheath is formed by what? For example, above the arcuate line, above the arcuate line, ये देखो ये क्या मसल, कौन सा मसल है ये? Rectus abdominis. Yes or no? Now, this is external oblique muscle. And what is this green color wavy part which is of the external oblique muscle? This is called as a aponeurosis of external oblique. What is this? Aponeurosis. Internal oblique is also having aponeurosis. But this aponeurosis is divided into two parts. See, one part above the muscle, one part below the muscle. So can I call it as anterior lamina and this as a posterior lamina? Next, transverse abdominis is also having aponeurosis. Now, if I ask you to tell what are the structures that are located over here, what will you tell one by one? This entire structures over here are called as a rectus sheath. Rectus sheath is formed by, first, aponeurosis of external oblique muscle. Ye dekho, aponeurosis of external oblique. Next, anterior lamina aponeurosis of internal oblique. Ye dekho, ye ho gaya anterior lamina of internal oblique. Next, posterior lamina of internal oblique. Ye dekho, posterior lamina of internal oblique. Next, aponeurosis of transverse abdominis. Ye dekho, this is aponeurosis of transverse abdominis. All of them together they form rectus sheath. So So these are the contents of the rectus. These are the structures that are forming the rectus sheath. कहाँ पे? Above the arcuate line. Above the arcuate line. But below the arcuate line, things are different. Below the arcuate line, ये देखो. Below the arcuate line कैसे होगा? It is rectus sheath is formed by aponeurosis of external oblique muscle. Okay? Aponeurosis of internal oblique muscle. ठीक है? कौन सा aponeurosis? Anterior lamina of the aponeurosis of internal oblique muscle. Next, aponeurosis of the transverse abdominis. Clear all of you? So all these three of them will form rectus sheath below the arcuate line. All of you are clear? So you should understand the differences between above the arcuate line and below the arcuate line. Difference क्या है? Difference ये है कि here below the arcuate line you don't have a posterior lamina. You see, there is no posterior lamina, but here you have the posterior lamina. This is the only difference which you have to figure it out, and again I'm telling you, definitely you will get a question on this. Okay, right, till here all of you understood? Everyone just give a thumbs up. Right, next important thing, anterior abdominal wall discuss किया हमने. Right, you see this is your entire anterior abdominal wall. Now posterior abdominal wall also I should discuss. So what are the structures that are present in the posterior abdominal wall? So all of you remember, posterior abdominal wall, on this posterior abdominal wall question is not asked, but they might ask you a question. So what do you tell that thing? You tell that thing as question in progress. Okay, question in progress. So posterior abdominal wall is formed by three muscles, Q, I, P. What is Q over here? Q is quadratus lumborum. I, what is I? I is iliacus. P, what is P? P is psoas major. Okay, so quadratus lumborum, right, and iliacus and psoas major. All these three muscles together form the posterior abdominal wall. What is the form? Posterior abdominal wall. If you want to remember the origins insertions, it is your wish, because they're not going to ask you, don't worry about that, but still I have kept for you the origins and insertions. When you get the PDF, you can revise it. Okay, right, so we are done with the anterior abdominal wall and posterior abdominal wall. Obviously the bulky part is anterior abdominal wall only, posterior side it is not bulky. Next, when it comes to abdominal aorta, okay, see this part of the aorta is your abdominal aorta. You remember, from the T12 all the way down till the aortoiliac junction, here we have got the abdominal aorta. So abdominal aorta topography is extremely important. Okay, so you have to remember this, that this is very important. See, at the level of T12, what artery do you have? At the level of T12 you have got celiac trunk. Okay, at the level of L1 you have got superior mesenteric artery. At the level of L2, you have got a renal artery and gonadal artery. At the level of L3, you have got inferior mesenteric artery. At least remember T12, L1 and L3. T12 is celiac, L1 is superior mesenteric artery, L3 is inferior mesenteric artery. At least remember these three. Okay, these three will help you a lot. I'm telling you, at least remember these three important things. Okay, very important. Okay, right, next important thing is abdominal aorta will divide into two branches. What are these two? These are the two common iliac arteries. Now these common iliac arteries are again dividing into external iliac, another one is your internal iliac. Okay, and internal iliac will give branches to your rectum, bladder and uterus. Keep this thing in mind. The internal iliac will give branches to what? Rectum, it will give bladder and uterus. So what arteries are supplied to the rectum with the help of internal iliac? ये देखो, middle rectal artery, inferior rectal artery. If this is a rectum, I am dividing the rectum into three parts: superior part of the rectum, middle part of the rectum and inferior part of the rectum. Middle part of the rectum and inferior part of the rectum, the arteries are given by internal iliac artery. Superior part I will discuss it later. Okay, so I hope till here all of you are clear. Memuna, lower limb is already done. We finished lower limb and we moved to this part, right? Very good, Mantis. Superior by SMA. I will tell you that thing. Okay, right. Now next important thing is that coming to the celiac trunk. What is this celiac trunk? Celiac trunk, if I tell celiac trunk, now you tell me celiac trunk originates from which level? T12, L1 or L2? It should originate from T12. It should originate from T12. And next, superior mesenteric artery will originate from L1. Next, inferior mesenteric artery will originate from L3. Clear? It will originate from L3. Right. First, let us discuss about celiac trunk. Very, 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 very important celiac trunk. So, all of you just look at this. Now, in this particular celiac trunk over here, this picture might be little bit difficult looking at it, but don't worry, I even have this particular presentation for you. But whatever it is, here we go. This particular celiac trunk is giving how many branches? Mainly 3 branches. Okay, here we go. All of you look here. Celiac trunk gives 1 branch to the liver. This is called hepatic artery proper. Here we go. This is called as your hepatic artery proper. Okay. After that, it gives 1 branch to the lesser surface of your, lesser, what is this? Lesser curvature of your stomach. This is called as your left gastric artery. Okay. What is this? Left gastric artery. And the third important artery is, here they go. It is also giving an artery that is coming all the way and supplying to your spleen. What is this? Splenic artery. So what did I write here? I have written here that main branches are what? One is hepatic artery proper, one is left gastric artery, another one is called as your splenic artery. Okay, these are the 3 main arteries. Okay, let us discuss about hepatic artery proper. Hepatic artery proper gives a branch, 2 branches. See, 1 branch going up, 1 branch coming down. Branch which is going up is called common hepatic artery. Okay, common hepatic artery. This common hepatic artery is dividing into right and left. Or right से cystic artery आएगा which will supply to your gallbladder. Okay, this is done. Liver is done now. Another important thing is it is also giving 1 more branch down. I told you that is called gastroduodenal artery. Sir, why are you calling it as gastroduodenal artery? Because this is present between the stomach and the duodenum. इसीलिए इसको क्या बोलते हैं? Gastroduodenal artery. Clear all of you? Gastroduodenal artery. This gastroduodenal artery is giving out 2 branches. 1 branch over here is called right gastromental artery. Another branch over here is called as superior pancreatoduodenal artery. Okay, what is that? One is called as a right gastromental artery and another one is your superior pancreatoduodenal artery. So till here I hope you are clear. Second important thing is that you see that this particular artery over here is called as splenic artery. Right? Now this splenic artery is supplied to your spleen. Now after supplying to your spleen, splenic artery will give 2 important branches. One is called short gastric artery, another one is called what will be this called as? अगर ये right gastromental artery हो गया तो ये क्या होगा? Left gastromental artery. So let us go back to this particular part. So what did I tell you? Hepatic artery proper will give 2 important branches. One is called as common hepatic artery, one is called as gastroduodenal artery. Common hepatic artery will divide into right hepatic artery, left hepatic artery, and the right hepatic artery will give away your cystic artery. When it comes to gastroduodenal artery will give 2 arteries I told you. One is called right gastromental artery, another one is superior pancreatoduodenal artery. When it comes to splenic will give short gastric artery and left gastromental artery. और ये right gastro और left gastromental artery दोनों जो है, they both of them will undergo anastomosis. Is it clear to everyone? Right. So you told me that celiac trunk will give another artery like left gastric artery. So when I tell left, there will also be right. From where then right is coming? Right is coming from hepatic artery proper. ये देखो, all of you look here. Main branches are left gastric artery. And where is right gastric artery coming from? Right gastric artery is coming from hepatic artery proper. So ये दोनों anastomos हो गए. Right? So this is the final blood supply which you need to remember regarding the celiac trunk. So once or twice if you just pay attention to this is going to be really the easiest part. Okay? So don't forget regarding this. Right. Now one more important thing I am going to tell you over here is that this superior mesenteric artery है ना, कहाँ पे बोला था superior mesenteric artery? L3 or L1? I told you superior mesenteric artery is present at the level of L1. So from there you see a branch that is going up. that is called inferior pancreatoduodenal artery. ठीक है, और यहां से जो ब्रांच नीचे आ रहे, what is that? Superior pancreatoduodenal artery. So both of them are anastomosing at this particular region. Okay, so this is what I want you to remember. I know it might be boring for you and it might be a little bit tiresome in this case, but if you practice this again and again, this is going to be really easy. Okay, one very important clinical point I want to tell you. ये देखो, ये artery जो है, this is your abdominal aorta. Okay, this abdominal aorta, what did I tell you? At the level of T12, celiac trunk, at the level of L1, what is this? Superior mesenteric artery. But what is this particular ligament? You know, median arcuate ligament. All of you just look at this particular ligament. This particular ligament over here is median arcuate ligament. अगर ये aorta है, abdominal aorta, okay, and to this abdominal aorta, you see what is this? Celiac trunk. Celiac trunk. ठीक है? Now I'm telling you, ये देखो, ये median arcuate ligament है ना? ये देखो, ये median arcuate ligament. This is median arcuate ligament. This will close your celiac trunk like this. Is it clear? ये देखो, it is closing your celiac trunk. अगर median arcuate ligament, if it is compressing more, then what will happen? This celiac trunk will also be compressed. When celiac trunk will be compressed, do you think blood supply will be to all those three organs like liver, spleen as well as stomach? No. Okay, so patient will have very, very severe pain. You know, when patient will have severe pain, he will have severe pain, chronic abdominal pain postprandial after the food. Okay, so this is the thing. And obviously what you need to do, laparoscopic surgical decompression you have to do. Okay, keep this thing in mind. And you see this is a normal patient, and you can see that this ligament has compressed your celiac trunk. ये देखो, ये celiac trunk इसको compress कर दिया पूरा. Right? This condition you call it as Dunbar syndrome. Other name is celiac axis syndrome. Other name is Harjola-Marabal syndrome or median arcuate syndrome. I'm not telling you to remember the names, but I'm telling you to observe the names. ठीक है, observe करो. जब भी whenever you are studying, just observe it, so that even in the exam, if you get it directly, you can put up the option over there. Clear, all of you? Is it clear? Right. Now coming on to the next arteries. Celiac trunk was from T12. ठीक है, L1 से क्या आएगा? Superior mesenteric artery. L3 से क्या आएगा? Inferior mesenteric artery. Okay. Now all of you just look at this. All of you just look at this. So very, very easy. You are the one who will going to tell me all these answers over here. ये देखो. From L1, you see this branch pink color one. This is called as your superior mesenteric artery. From L3, you see this branch over here. This is called as your inferior mesenteric artery. Right. Now, this superior mesenteric artery is giving three branches. What are those three branches? ये देखो, first, it is giving one branch supplying all the way to your iliac region. ये देखो, ये ilium है ना? What is this? This is your ilium. And what is this? This is your colon, ascending colon. So this artery is supplying your ilium and colon. So can I call it as ileocolic artery? ये देखो, artery number A is ileocolic artery. ठीक है, और ileocolic artery से branch आ रहा है, देखो, ये देखो, from ileocolic artery there is one branch that is coming and supplying to your appendix like this. So what is that artery should be called as? Appendicular artery. Okay, what is that artery should be called as? Appendicular artery. See, ileocolic artery is giving appendicular artery. Okay, next important thing. What is this? Superior mesenteric artery is giving one more branch that is supplying to right part of the colon. Ascending colon को कौन सा colon बोलते हैं? Right colon. ठीक है, descending colon को left colon और middle colon को transverse colon को middle colon. Okay, so B is supplying your right part of the colon. So you call this as what? Right colic artery. Next, it is also supplying to your middle part of the colon. So you call this as what? Middle colic artery. Superior mesenteric artery का branches क्या है? Ileocolic artery, right colic artery and middle colic artery. Here, when it comes to inferior mesenteric artery, which is arising from कहाँ से? L3. Okay. Tell me what are the branches? See, first branch coming all the way down to your sigmoid colon. What is this artery called as? Sigmoid artery. What is this? Sigmoid artery. Next, another branch supplying to left colon. So what is this artery called as? left colic artery. And now look here, there is one more artery supplying to your top of the rectum. इसको क्या बोलते हो? Superior rectal artery. So sigmoid artery, left colic artery, superior rectal artery. Guys, by now you are clear. Rectum is three parts: superior, middle, and inferior. Superior part of the rectum is supplied by inferior mesenteric artery. Middle or lower part of the rectum, just अभी मैंने बताया था, ये देखो, middle और inferior part of the rectum is supplied by internal iliac artery. ये याद रखो, ठीक है? Keep this thing in your mind. डलियो कॉलिंग मतलब, डलियो कॉलिंग मतलब is it? Right. So these are the things which you need to remember. Right. Now another extremely important topic I'm going to discuss is your inguinal region, inguinal canal. Okay. So what is this? All of you look here now. This is your what is this? Anterior superior iliac spine. याद है anterior superior iliac spine? और ये pelvic bone. ठीक है? Now in this pelvic bone, it is, what is this? This is your PT. What is PT here? Pubic tubercle. ठीक है? और ये क्या है? Pubic crest. ठीक है? और ये जो lines है, what are these lines called? Pectineal line. Again, once again, pubic crest, pubic tubercle और pectineal line. ठीक है? So all the way from anterior superior iliac spine to pubic tubercle, this particular ligament which you have over here is called inguinal ligament. What is this? Inguinal ligament. So how is inguinal ligament formed? How is basically inguinal ligament formed is that, let me show it to you. Right. So how basically inguinal ligament is formed? So how is inguinal ligament formed is that, just look here. For example, let us say this particular part over here which you can see, this muscle is external oblique. I told you ना, यहाँ पे एक्सटर्नल ऑब्लिक, इंटरनल ऑब्लिक, ट्रांसवर्स एब्डोमिनिस होगा, ये एक्सटर्नल ऑब्लिक है. ठीक है? ये एक्सटर्नल ऑब्लिक का लोअर पार्ट है ना, लोअर पार्ट ऑफ एक्सटर्नल ऑब्लिक will turn inside like this. ये देखो, lower part of external oblique will turn inside like this. Okay, it will turn inside like this and it will become very thick. The lower part will become very thick. This is what is called as your inguinal ligament. What is this called? Inguinal ligament. So what I can write, that external oblique muscle aponeurosis will infold inside to form inguinal ligament. Clear all of you? ये देखो, ये external oblique है. You see how it is infolding inside like this? ऐसे infolder है ना? It is infolding and forming this. But second important thing which you need to remember is that this is anterior. Sorry, this is anterior. What is this part? This is called as antero-inferiorly. Antero-inferiorly, external oblique muscle के अंदर ना, there is a small hole. In simple terms I'm telling, right? So there is a small deficit in the external oblique muscle antero-inferiorly. This deficit is nothing but called as superficial inguinal ring. But guys, look at the picture and tell, is it looking like a ring or a triangle? It is looking like a triangle, right? इसीलिए इसको misnomer बोलते हैं. Okay, so this is not called superficial inguinal ring, right? So the ring का जो word use किया ना, this is a misnomer actually. It is not looking like a triangle. So what is a superficial inguinal ring? This is a deficit in the aponeurosis of external oblique muscle antero-inferiorly. Clear? Okay. Now this is your inguinal ligament. Finally, inguinal ligament is formed by external oblique. Now some of the fibers are projecting down. These fibers which are projecting down are called as lacunar ligament. और जैसे ये नीचे प्रोजेक्ट होगा, it will reflect backwards. ये देखो ऐसे, they're reflecting back like this. As they're reflecting back, you see some other ligament is formed over here. This is called as pectineal ligament. Pectineal line पे जो ligament form होगा, pectineal ligament होगा. Clear? Why am I telling you this? You will understand it in a minute. Okay? But MCQs, this is the only MCQ which you need to remember here. Okay? Now let us go on to the next thing. How is superficial inguinal ring formed? That is a misnomer. It is triangular shaped. You know that how it is formed. Now, deep inguinal ring करके भी एक ring है. Okay? That is called as a true ring. Why it is called as a true ring? Because it is perfectly in the shape of a ring. And what is that? It is a deficit in transversalis fascia. I told you, remember, external oblique, internal oblique, and transverse abdominis, transversalis fascia, याद है ना, the layers of the anterior abdominal wall. So innermost transversalis fascia जो है, on the transversalis fascia you have an opening that is called as deep ring. So all of you just look here, ये देखो, this is called as a superficial ring, superficial होगा, और अंदर क्या होगा, you have got the deep ring. Clear? So where is deep ring present? Deep ring is present just above the mid-inguinal region. ये देखो, ये inguinal ligament है, so mid-inguinal point के ऊपर होगा, this is the deep ring. And second MCQ is deep ring is by the deficit of what? Transversalis fascia, and superficial inguinal ring is the deficit of what? External oblique muscle aponeurosis. These are the two important MCQs which you have to remember. Clear all of you? So now you understood superficial inguinal ring क्या होगा, you understood deep inguinal ring क्या होगा, right? How are they formed? And connecting the superficial inguinal ring and deep inguinal ring, the canal which you have here, ये देखो, ये जो canal है ना, this canal is called as inguinal canal. It is just 4 centimeters in length. Okay, inguinal canal is 4 centimeters in length. Inguinal canal के अंदर क्या होगा? What are the structures that are present within the inguinal canal? See, in the males, inguinal canal consists of spermatic cord only. But females में inguinal canal is consisting of round ligament of uterus as well as ilioinguinal nerve. ठीक है? Will you remember this? So it is consisting of round ligament of uterus as well as your ilioinguinal nerve. Is it clear to everyone? Yes or no? Right? I hope everyone is clear with this. So round ligament of uterus as well as ilioinguinal. Very good. Right. Now there are some triangles, guys, which we have to discuss over here. This picture, all of you are clear, right? ये देखो, what is this muscle? This muscle is called as your rectus abdominis muscle. And what is this called? This is called as your inguinal ligament. Okay, rectus abdominis as well as inguinal ligament. Now all of you just observe carefully whatever I'm telling you. अगर ये inguinal ligament है, ठीक है, exactly the center point of the inguinal ligament is called as mid-inguinal point. Above the mid-inguinal point, the ring which you have, what is that ring? Superficial inguinal ring or deep inguinal ring? You have got the deep inguinal ring. Exactly below that mid-inguinal point, you have got an artery called external iliac artery. External iliac artery is a branch that is called inferior epigastric artery. Now, why am I telling you all these things is that you see a triangle that is formed, right? Now, how is this particular triangle formed? This triangle is formed by, one is rectus abdominis on one side, one is inguinal ligament on other side, another one is inferior epigastric artery on one side. So all these three things together, you call this as inguinal triangle or Hasselbalch triangle. ये देखो, lateral border of rectus abdominis, inferior epigastric artery और medial half of inguinal ligament, तीनों मिलके यहाँ पे हुआ था. Why is this important? Because direct inguinal hernias, they emerge from this triangle. इसीलिए ये triangle बहुत important है. Okay, next important thing is that if you can see here, मैंने क्या बोला था, ये inguinal ligament है. Some fibers project down like this. This is called as lacunar ligament. From here some fibers go back like this. This is called as pectineal ligament. और यहाँ पे भी एक छोटा सा triangle है ना, ये देखो, look at this, isn't it? Right? Now, what are the borders of this triangle? We shall discuss now. See, anteriorly inguinal ligament, anteriorly ये देखो, inguinal ligament anteriorly है, ठीक है? Posteriorly pectineal ligament, posteriorly मतलब ये देखो, पीछे की तरफ, this one is there, pectineal ligament. Medially lacunar ligament, ये देखो, medially मतलब यहाँ पे lacunar ligament है, and laterally external iliac vein, ये देखो, laterally क्या है? External iliac vein है. So, surrounded by all of this, you see this triangle over here. This triangle is called as this ring is called as femoral ring. All of you understood what is this ring? Femoral ring. All of you understood this? Perfectly clear, guys? Right. Is it clear to every one of you? right? So these are the structures that are present over here, right? Now, right, very good. Now, the next important thing is that I think I've discussed this thing just now. Contents of inguinal canal, right? Males में क्या होगा? Spermatic cord, female में round ligament of uterus and all these things I've discussed, right? Now I'm telling you, males में spermatic cord होगा. Inguinal canal जो है, within that inguinal canal you have got spermatic cord. Spermatic cord के अंदर क्या होगा? What are the structures present within the spermatic cord? ये देखो, this is your spermatic cord. Okay, so within this spermatic cord, what are the things you have deep inside this spermatic cord? Yeah, what are the things you have deep inside this spermatic cord? You have got 3 arteries over here, you have got 3 nerves over here, you have got 3 structures over here. Okay, how do you remember all these 3 3s are 9? How do you remember all these 3 structures? How do you remember is that? Very simple thing. Okay, see, all of you look here now. Let us say there is a shop. Okay, shop का नाम है चाय वाला दुकान. Okay, so basically what do? You are really stressed out. Okay, so obviously what do? You go to that चाय वाला दुकान का नाम है चाय वाला. Okay, you go to that चाय वाला दुकान. Now once after you go there, what do you take? You take a tea along. चाय के साथ क्या लोगे? Sutta, if you have a habit. ठीक है, चाय के साथ you take the sutta. So write down all those things now. So all of you just look here now. चाय वाला दुकान तक गए, right? You went till the चाय वाला दुकान. Why? Because you ordered चाय and sutta. चाय और सुट्टा पीने के लिए वहां तक गए. ठीक है, and you have taken both of them. You have taken tea, you have taken what? You have taken the cigarette also. Okay, so how do you apply this? चाय वाला, what is C? C for cremasteric artery. Next, दुकान, D for what? Ductus deferens. T for what? Testicular artery. Okay, next, गए, G for what? Genital branch of genitofemoral nerve. Again, C for what? Cremasteric nerve. S for what? Sympathetic fibers. And in the same way it follows again. P for pampiniform plexus, Lalia matlab lymphatic vessels. Okay, ductus deferens already have mentioned. Ductus deferens artery. So this is ductus deferens to which that artery is supplying. So guys, easy. All of you understood these structures. Just once or twice if you repeat it, I'm telling you, this is gonna be really easy for you. Okay, so all of you are understanding, guys? Yes, बताओ जल्दी. Let me have some warm water. Sannyasi Pandit, so long. Nice to see you. Right. Next important thing is that, you know, the layers of the abdomen, they continue down into the scrotum also. How do they continue down into the scrotum? You have to know. For example, abdomen में transversalis fascia है, the innermost layer है कि नहीं? Transversalis fascia will continue into the scrotum as internal spermatic fascia. Okay, internal oblique muscle है ना? That will continue into the scrotum as cremasteric muscle and fascia. External oblique muscle है ना? That will continue into the scrotum as external spermatic fascia. Okay, how do you remember? Tie turns into ice. Okay, TIE, tie turns into ICE, ice. Okay, so keep this thing in mind. Tie turns into ice. Tie turns into ice. Okay, so these are the important things. So let me tell you these things little bit detail. ये देखो, abdomen में ना, the outermost thing is skin. After the skin you have got your superficial fascia. Then you have got your deep fascia. Okay. External oblique muscle, internal oblique muscle, transverse abdominis, transversalis fascia. These things we discussed already. Now, how are these transforming? Skin, this is a very important question, guys. Again, I forgot to tell you, very, very important. Skin will transform into skin of the scrotum. Superficial fascia, both of them will transform into a dartus muscle. Okay. Deep fascia, no. Next, external oblique muscle is continuing as external spermatic fascia. Internal oblique muscle is continuing as cremasteric muscle and fascia. Transverse abdominis will not continue as anything. It will end up in the abdomen itself. Transversalis fascia is continuing as internal spermatic fascia, and parietal peritoneum will not convert into anything. If you remember this thing, and most probably you might get a question from these guys, okay? Layers of the abdomen continuing with the testis is really important, okay? Right. Next important thing is that, what is this picture over here? What is this picture? This picture is a picture of inguinal canal. How is that? What did I tell you guys? I told you that external oblique muscle जो है ना, what did I tell you? External oblique muscle, the lower part will infold like this. I told you it will fold like this and form inguinal ligament. ये देखो, ये external oblique muscle है, right? You see it is infolding like this. Yes or no? It is infolding like this to form a canal here. ये होगा क्या? Inguinal canal. Okay. Next, external oblique cut करने के बाद you will have internal oblique. After that, when you cut it down, you will have transverse abdominis. After that, when you cut it down, you will have transversalis fascia. Now you tell me, what are the borders of this inguinal canal? What is anterior wall made up of? Anterior wall is made up of external oblique aponeurosis. ये देखो, ये होगा anterior wall. ये होगा anterior wall made up of external oblique aponeurosis. पीछे posterior wall is made up of fascia transversalis. ये देखो, posterior wall is made up of fascia transversalis. ठीक है? Next, roof is made up of internal oblique and transverse abdominis. Roof मतलब ऊपर, made up of what? Internal oblique and transverse abdominalis. And next, floor is made up of inguinal ligament. ये देखो, floor is made up of inguinal ligament. सर इसके अंदर ये जो पिंक कलर में है ये क्या है? This is your spermatic cord. This is your spermatic cord. Canal के अंदर spermatic cord, right? So you have got the canal, and within the canal you have got your spermatic cord over here. So I hope this is clear to you regarding your inguinal canal. Is it clear to every one of you? Yeah. Now, when it comes to the liver, if you look at this liver over here, liver is having two notches. One is called as a cystic notch. One is called as a notch for ligamentum teres. Ligament है ना वो, that is your ligamentum teres. Okay, why are you calling it a cystic notch? Because you have got a gallbladder over here. That is why you are calling it a cystic notch, right? Now, surgically how you will divide the liver and anatomically how you will divide the liver, I am telling you. Okay, as per anatomy, what I will tell you is liver is divided. See, this is your ligamentum teres. Wherever your ligamentum teres is there, right to that you call this as the right lobe of the liver. Left side is your left lobe of the liver. But surgically it is not that thing. Surgically, how do you do is that you see this is a gallbladder over here, and this is your inferior vena cava. And you draw an imaginary line touching inferior vena cava to the gallbladder. After this, you divide the liver into right lobe and left lobe. And what is the name of this line called as? This line is called as Cantlier's line. Okay. So, anatomical division of liver is based upon ligamentum teres, and surgical division of liver is based upon Cantlier's line. So in this way, if I have to donate my liver, right? So which lobe I will donate? The right lobe I will donate to the recipient. R for right lobe, R for to the recipient, whoever is taking. L is left with the donor. The left is left with the donor. Left lobe will be with me, and right lobe I will donate it. ये देखो, right lobe is for the recipient, left lobe is left with the donor. Clear all of you? Right. When I turn the liver back, right, when I turn the liver back, these are the structures which I can see over here. What are these structures over here? See, first important thing, you see ligamentum venosum over here. Down you see ligamentum teres, you know it, right? Here you see inferior vena cava, here you see gallbladder. Now, can you see a lobe that is sandwiched between ligamentum venosum and inferior vena cava? This part of the lobe, this lobe of your liver is called as your caudate lobe. What is this? Caudate lobe. In the same way, the lobe of the liver which is sandwiched between gallbladder and ligamentum teres is called as quadrate lobe. So, how many lobes of the liver you have? Anteriorly you have got right lobe, left lobe, and posteriorly you have got caudate lobe, or niche down you have got quadrate lobe. So, these are the lobes. Next important clinical point I want to tell you over here is that you see this is inferior vena cava. inferior vena cava. And you know what are these veins? Yeah, this is called as your right hepatic vein. This is called as your middle hepatic vein, and this is called as your left hepatic vein. All of them are draining into where? Inferior vena cava. And what is this? Your portal vein dividing into right and left portal vein. So because of this hepatic veins and portal vein, you divide the entire liver into segments. How many segments? 8 segments. So all of you look here. This is 1, 2, 3, 4, 5, 6, 7, 8. Always you have to name the segments in the clockwise direction. Okay. Now why am I telling you this? Because segment number 5, 6, 7, 8. Where do they drain? They drain into your right hepatic vein. Here they go. Segment 5, 6, 7, 8 drain into right hepatic vein. Next, segment number 2, 3 and 4 drain into your left hepatic vein. Okay, here they go. Drain into left hepatic vein. Segment number 4, 5 and 8, they drain into middle hepatic vein. Okay, but I did not tell about segment 1. Why? Because segment 1 will directly drain. Okay. Segment 1 will directly drain into inferior vena cava. Directly it will drain into inferior vena cava. That is the reason why. That is the reason why whenever you have a thrombus, a blood clot, a clot within your right hepatic vein, right hepatic vein, middle hepatic vein, as well as the left hepatic vein, when you have these clots, tell me, can 5, 6, 7, 8 drain into right hepatic vein? Even if it will drain, can it pass up into the inferior vena cava? No. Can the 2, 3, 4, can it pass up? No. Can 4, 5, 8 after entering into your middle hepatic vein, can it pass up? No. Why? Because your right, middle and left, all of them are blocked. But what is that? Only one segment of the liver which is not having any problem, that is segment number 1. Kyunki segment number 1 directly drains into your inferior vena cava. Right now, the condition which I have just now explained to you is called as Budd-Chiari syndrome. What is this? This condition is called as Budd-Chiari syndrome, and in Budd-Chiari syndrome, what do you see? You see hepatic vein thrombosis. All segments are involved except segment 1. Everyone understood this? Yes or no? Right. Right. All of you look at these stones over here, guys. I just want to put it here. Right. You know, different types of stones we have got: cholesterol stones, black pigmented stones, mixed stones. Anyways, you'll study in surgery. I don't know why this slide came. Hello. What are the ligaments which you have in the liver, guys? You have got coronary ligament. Why you call it coronary? Because it is on the crown, top. Coronary ligament. Coronary ligament on one side, it is forming a triangular shaped ligament called as right triangular ligament, and coronary ligament on the left side, it is also forming a triangular shaped ligament called as left triangular ligament. Okay. Next, down here you see this green color ligament over here. This is called as your falciform ligament, or falciform ligament ke andar you see this ligamentum teres. And what is ligamentum teres? That is a remnant of your umbilical vein. Umbilical vein jo hai, that will undergo condensation to form a ligament. Vein will condense, it will become thick to form a ligament called ligamentum teres. Okay. Now I am telling you one more very important point which will be asked in surgery. What is that point? What is that point is that, ye dekho, ye right hepatic duct, left hepatic duct hai. Both of them join together to form what? Common hepatic duct. Common hepatic duct and cystic duct join together to form common bile duct. Okay. But if you look at this particular part clearly, here you have got a triangle. Triangle is having a superior border, inferior border and a medial border. Superiorly, what do you have? You have the inferior surface of your liver. Inferiorly, what do you have? You have got the cystic duct. And medially, what do you have? You have got the common bile duct. So this particular triangle over here is called as Kellogg's triangle or hepatocystic triangle. Ye dekho, hepatocystic triangle or Kellogg's triangle. The most important thing is that what are the contents of this hepatic triangle or the Kellogg's triangle? What are the contents? You just look at the picture and tell, guys. You see, you have got right hepatic artery. Obviously, this is left hepatic artery. So what are the things you have got? You have got right hepatic artery. You have got a cystic artery, right? And what do you have? Right hepatic artery is there. Cystic artery is there, and I did not draw here. You have even got the lymph nodes, lymphatics, and you have got the lymph node of Lund. Okay. These are lymph nodes. Okay. You have got the lymph nodes. Okay. You have got the lymph nodes of LUND. Right. So what is this lymph node of LUND? This is the first lymph node of gallbladder. First lymph node of God. You guys don't laugh. Okay. I'm not laughing for that. First lymph node of gallbladder over here, right? So lymphatics. So these are the bus karo. These are the contents here. You guys have bad minds. I don't have a bad mind. I have a very clear mind. ठीक है? ये lymph node है. ठीक है? Lymph node का नाम क्या है? Lymph node of LUND. So and next you see, my mind is perfectly clean. So here you have got right hepatic, cystic artery, lymph node and lymphatic. These are the contents of hepatocystic triangle. Okay? Contents of hepatocystic triangle. Okay. Now you might get a doubt, sir, why do we need this hepatocystic triangle? Why do you need is that whenever you wanted to do laparoscopic cholecystectomy, let us say patient is having, stop it now. Whenever a patient is having gallstones, you have to remove the gallbladder. Okay, nowadays people are mainly opting for laparoscopic surgeries, right? So laparoscopic cholecystectomy, we use a triangle. That triangle which we use as a landmark is this, for laparoscopic cholecystectomy is the Kellogg's triangle. Clear all of you? This is a Kellogg's triangle over here, right? So all of you understood regarding the liver, right? Next important thing is anatomical constrictions of ureter. Another high yield topic, guys. Very important. Okay. So there are basically three places where ureter undergoes constriction. Okay. What are those constrictions? Ye dekho. All of you know this is the renal pelvis. And from here the ureter will start. So the point where the renal pelvis is starting as ureter, that point there is a constriction. That is called as pelvo-ureteric constriction. Pelvi-ureteric constriction. Pelvis starting as ureter is pelvi-ureteric constriction. Second, and ureter is coming like this all the way, right? It is passing above your right common iliac artery. On the left side also, obviously, passing above your common iliac artery. Here you see a small constriction that is called as pelvic brim at common iliac artery. Third one is the place where obviously ureters have to enter into urinary bladder. The place where we are entering also, at this particular part also you have got this constriction. This is called ureterovesical constriction. What is this called? Ureterovesical constriction. So what are the three constrictions? Pelvi-ureteric and constriction at the level of common iliac artery and uretrovesical constriction. Clear? So what is the blood supply to the ureters? So obviously guys, what is the blood supply? This is a picture I have given you. If you want to remember with this help of this picture, if you remember carefully, I told you T12 pe celiac trunk hoga, below that superior mesenteric artery, below that at the level of L2 I told you gonadal arteries and renal artery. You remember? See, this is your gonadal artery, this is your renal artery. Gonadal artery and renal artery also give few branches. Okay, so all of you look here. Renal artery will give branches, gonadal artery will give branches, common iliac artery will give branches, and common iliac artery is dividing into external and internal. Here देखो, internal is also giving branches. What are these branches? A, B, C, D, E branches. Okay, so how do you remember? Remember it as miss you. Okay, the last word which you told your junior girlfriend before coming back to India, miss you. Okay, so that thing over here. What is M over here? Middle rectal artery. I is your inferior vesical artery. S over here is your superior vesical artery. U over here is uterine artery. Okay, All these are the branches of what? Internal iliac artery. All these are the branches of internal iliac artery. Okay, internal iliac artery. So, what are the branches that are supplying to your ureters? All these are the branches that are supplied to the ureter. But mostly, ये तो easy है, renal, gonadal, common iliac easy है. But remembering these branches a little bit tricky. Remember the mnemonic, miss you. Okay, right. Next important thing which you have over here is your adrenal gland. All of you know that adrenal gland is a retroperitoneal organ. क्यों? क्योंकि it is present behind the peritoneum. Right? Now, see, I think this thing you have studied in your physiology also, that adrenal gland is having two parts. What is this? Adrenal medulla ek ho gaya, and the remaining part is called as your adrenal cortex. Cortex is divided into 3 layers. Now, I will tell you one trick. Remember the same way your entire life, okay? So, first important thing, all of you know GFR. GFR is glomerular filtration rate. Apply that GFR here. Here you go. Outermost layer G. G stands for glomerulosa. F stands for fasciculata. Innermost layer R stands for reticularis. Okay? G, F, R. Okay? And next important thing is that you have to know glomerulosa releases what? Aldosterone. Fasciculata releases cortisol, and reticularis releases androgen. Okay? Right. And the next important topic we shall be discussing is stomach bed. Okay. So, for example, if this is your stomach like this, see, I have removed the stomach now. Okay. I have removed the stomach, kept it aside. Okay. So, what are the structures that are located behind the stomach are called as stomach bed? What are the structures located behind the stomach are called as your stomach bed? Okay. So, how do you remember this? How do you remember this is that? Remember it by a mnemonic here. Doctor S3 kills patients mercilessly. Doctor, DR मतलब क्या? D for diaphragm. S3, what are these S3? S stands for splenic artery. S stands for suprarenal gland. अब बताओ, suprarenal gland in the sense adrenal gland. So stomach is present on the right side or on the left side? It is present on the epigastric region onto the left side, right? So left kidney suprarenal he is talking about, or right kidney? He is talking about the left kidney suprarenal gland. Next, splenic flexure. Kills, K for kidney, left kidney again. Patients, pancreas, M for mesocolon, transverse mesocolon. Right? Yes, Ganeshan, it is both for the NEET PG as well as the FMGe. Okay, so these are the important things. You just have to know that Dr. S3 kills the patients mercilessly. Okay, so if you remember this mnemonic, then this MCQ will be solved. Here, all of you, right? Now, guys, regarding jejunum and ileum, you just have to study the differences. Okay? How do you know the differences? Is that if you know the differences of jejunum, then the differences of ileum are very easy, because jejunum differences are exactly the opposite to the ileum differences. For example, jejunum is, see, look at this, jejunum is thicker. इलियम यहाँ पे थिनर हो गया, ये मोर वैस्कुलर हो गया, तो ये लेस वैस्कुलर, राइट? If you look at the lumen of the jejunum is wider. See, all of you just look at this, compare these two lumens. The lumen of the jejunum is wider. Okay, right? The lumen of the jejunum is wider. Then when I tell wider here, the opposite side what will be there? Narrow. The lumen will be narrow. Yes or no? Next. And this lumen is often found empty. तो वहां पे क्या होना चाहिए? Often found full. Clear? Next. Coming to the circular folds or plicae circularis. For example, see, all of you look at this. This is the innermost part of your jejunum. Inside this innermost part, can you see the circular folds over here? These circular folds over here are called as plicae circularis. Okay. Where do you have this? See, these plicae circularis are longer and closely set. All of you just look at this. If this is your jejunum, if this is your ileum, right? Here they go. They are longer and closely set. In this way, they are longer and closely set. But here they are smaller. They are smaller and sparsely set. Okay, दूर दूर से they are smaller and sparsely set. Okay. Next, coming to the villi. So obviously villi are more, larger, thicker and leaf-like. Exactly opposite word क्या होगा? More, less, larger, shorter, thicker. यहाँ पे क्या होगा? Thinner, leaf-like. This is finger-like. Clear all of you? Next important thing is that Peyer's patches. Obviously you look at this Peyer's patches, guys. ये देखो, these are your Peyer's patches. These Peyer's patches are small or large. These Peyer's patches are small, but look at the Peyer's patches in the ileum, they are large. Yes or no? So let us look at this. Here देखो, Peyer's patches over here are small and circular, right? But here they are large and oval. Clear? They are large and oval. Next, coming to the mesentery. Contains less fat. Here it contains more fat. Okay, contains less fat, contains more fat. Let us see. Yeah, can you see any fat here? Can you see any yellow color thing here? Yeah, any yellowishness here? There is no fat. But यहाँ पे देखो, can you see yellowishness here? There is fat. Okay, so here it contains less fat over here, and here it contains more fat. Okay, and next important thing is that if you see, peritoneal windows are visible or not. ये देखो, these are vasa recta. These are the blood vessels. Between the blood vessels, you see this transparent gap, white color transparent gap. These are called peritoneal windows. Why it is white in color? Because backside you don't have any fat. But look here also you have peritoneal windows. But are the peritoneal windows very clear? No. Why? Because you have fat there. If there is fat, why the peritoneal windows look transparent? You don't see transparent, right? So here you see completely white transparent peritoneal windows. Peritoneal windows. Okay, and here the peritoneal windows are there, but peritoneal windows are not clearly visible. They are opaque. Why? Because of the presence of fat behind. Okay, because of the presence of fat. Next important thing, arterial arcades. Okay. Arterial arcade, 1 or 2 rows of long vasa recta, and here 4 or 5 rows of short vasa recta. ये देखो, all of you look here, these are rows. This is 1 row, this is 2 rows. But look at this, this is 1, this is 2, this is 3, this is 4 or 5 rows of vasa recta. Okay, so I hope all of you understood the differences between jejunum and ileum. All of you are clear with this so far? Yes or no? जल्दी बताओ. Right. Next important thing, the last important topic here we'll be discussing is Meckel's diverticulum. Again, this topic is not taught in anatomy. This is taught in surgery, but still I'm teaching it to you here so that it would be easy for you. So all of you just look here, as I have discussed the ileum, jejunum and all. So let me discuss the clinical point also. What is Meckel's diverticulum? All of you look at this. This is your jejunum. Okay. And this is your ileum. Okay. In the birth defect, what will happen is that there is something called vitello-intestinal duct. Now I can't go into embryology. See, let us say this is called as vitello-intestinal duct. Later on in the ages, what will happen is this vitello-intestinal duct will completely close. But if it did not close, what will happen? That will remain as a protrusion outside. इस protrusion को क्या बोलते हो? Meckel's diverticulum. Where is Meckel's diverticulum located? It is located onto your ileum. Okay. Now there are few important things which you should understand about this Meckel's diverticulum. What? That is called as rule of 2. What is rule of 2? ये सिर्फ 2% of the population में देखा जाएगा, right? It is seen basically in 2% of the population. Next, it is 2 feet from ileocecal valve. What is ileocecal valve? देखो यहाँ पे होगा ileocecal valve. So from here, if you measure the distance, it is around 2 feet. Okay. Next, 2 inches long. It is 2 inches long. Next, where in which patients you see patients less than 2 years old. And next, ratio if you see 2:1, male female ratio is 2:1. That is why you call it as a rule of 2. What is this? Rule of 2. Okay. So how it is formed? What did I tell you? Vitellointestinal duct, if it is not obliterated matlab if it did not disappear, that will remain. That remnant of vitellointestinal duct, which is seen in the ileum, is called as this one. Okay, I'll show you the real picture. Ye dekho, this is your ileum. This is your ileum, and you see this. This is your Meckel's diverticulum. Ye dekho, this is your ileum, and ye dekho Meckel's diverticulum. Okay, this is your Meckel's diverticulum. So basically what happens is that whenever the food passes like this, there is chance that food can enter here. Okay, and food accumulates over here. Food accumulates, and this entire part turns to necrotic. And later on it will be a great problem to the patient, because there might be openings, I mean perforations that might be seen here. Okay, so guys, this is all you need to know regarding the abdomen part. All of you understood? Yes or no? All of you are clear with that, right? Right. So let us even start discussing the pelvic part also without a break, है ना? इसके बाद we will take a break. What do you say? You clear? Right. So let us discuss this. In the pelvic part, the first important thing which you need to know is regarding the pudendal nerve. Okay, pudendal nerve is asked in INICT and AIMS PG also, so it is better. No, I did not have my meal. Thank you for asking. Right, I'll have it. I will have it once this is done. Okay, because time won't be sufficient if I start eating now. Right, so pudendal nerve is very important. Now, pudendal, whenever I tell pudendal nerve, remember one thing, DIP branches. Okay, you have to remember it as DIP branches. Okay, DIP is the mnemonic, I will tell you later on. So, pudendal nerve starts all the way from S2, S3 and S4. Okay, here dekho, this pudendal nerve is passing down all the way, passing down, and it is entering into a foramen called as greater sciatic foramen. It will come out of that, it will pass behind a ligament called as sacrospinous ligament. Okay, after that it is coming down, and then it is passing through an opening called lesser. Such do we need to remember for an exam? No, you need not to remember this. I have to tell you the course, so I am telling you, but what you have to remember I will tell you now. Okay, so why it is called pudendal nerve is it is passing through pudendal canal. That is why you called as pudendal nerve. So this pudendal nerve will give three main branches. What did I tell you? DIP branches. From here you have to remember DIP branches. What is it? D for dorsal nerve, I for inferior rectal nerve, P for perineal nerve. DIP, dorsal nerve, inferior rectal nerve and perineal nerve. Okay. What does this dorsal nerve do? This dorsal nerve gives sensory supply to your penis and clitoris. Okay, what does your inferior rectal nerve do? This inferior rectal nerve supplies to your anal skin as well as external anal sphincter. Okay, what does it supply to? External anal sphincter also. Okay, next DIP, P stands for perineal nerve. Perineal nerve gives innervation to what? Remember again another mnemonic, that is bile. Perineal nerve will give innervation all the way to bile. What is bile? Bulbospongiosus muscle, ischiocavernosus muscle, levator ani muscle, external urethral sphincter. Guys, you just have to remember this. Okay? There is no other way here. You just have to remember this nerve. Right? I am not telling you to remember the entire thing. ये देखो सिर्फ ये याद रखो काफी है. Okay, it's just a memory part. Right. Next important thing. What is the next important thing is pelvic floor. Again, I'm telling you, 100% you get a question from pelvic floor. 100% every year there is a question. Pelvic floor. If I'm sitting like this, right? If I'm sitting like this, now automatically I'm not urinating or automatically I'm not defecating, right? Why am I not urinating and why I'm not defecating? I have an ability to control the urine. How am I having an ability to control the urine? I have ability to control the feces. How am I having an ability to control all this? It is because of the pelvic floor. Pelvic bone होगा ना, उसके नीचे जो floor होगा ना, that is pelvic floor. There you have got muscles tightly compressing all the structures. These muscles, they help in the support. Okay, if pelvic muscles are gone, then organs जो है body के अंदर organs, all of them will prolapse outside. They will come outside, prolapse. Okay, so pelvic floor muscles are very important. Okay, so this is the pelvic floor. In this pelvic floor, ये anterior pubic bone है. This is your pubic symphysis here, and this is the sacrum posteriorly. Okay, down here you see all this green color thing. What is this green color thing? All this is the muscles. Okay, so what are the muscles over here? See, before I discuss the muscles, you have to know pelvic floor. In the pelvic floor, how many openings you have? Two openings. One is called urogenital hiatus, one is called rectal hiatus. Obviously, if for example, if this is a female, right, you have one opening to pass urine from the front, one opening to pass the feces from the back. So front one is called urogenital hiatus, back one is called as rectal hiatus. Clear, all of you? Right. Let us go a little bit deep into this. What are the pelvic floor muscles over here? There are three important components of pelvic floor muscles. Okay. What are they? Levator ani muscle, coccygeus muscle, and fascia. Obviously, every muscle will be covered by fascia. So, levator ani muscle, coccygeus muscle. Levator ani muscle is having three components. What are those three components? One is called puborectalis, pubococcygeus, iliococcygeus. If you just remember these names, that is enough. Okay, if you just remember these names, that is more than enough. Okay, you need not to remember how is the muscle looking and all, but anyways, I will show it to you. So puborectalis, pubococcygeus, and iliococcygeus. All of you look at this. Yeah. The first important muscle is puborectalis. Guys, ये देखो puborectalis, pubic bone से लेकर rectum तक, ये देखो. All of you look here. This is your pubic bone. This is your pubic bone. And what is this? Rectum. So this muscle is surrounding the pubic bone. From the pubic bone, this muscle is going back, surrounding the rectum like this. ठीक है? अगर यहाँ पे rectum है, it is hugging the rectum and pulling itself. Okay? Like a U-shaped sling. Sir, why do we need this? Why do you need this is that whenever you are coughing, abdomen के अंदर pressures बढ़ेगा, right? Whenever you are coughing, the intra-abdominal pressure will be high. Because of this pressure, whatever feces is there, it is pushed out. Okay? But this muscle also will contract when you are coughing. So when this muscle will contract, what will happen? This muscle will pull the rectum like this. So as it is pulling the rectum like this, now you tell me, fecal matter, whatever is here, do you think it is easy to slip outside? No. You're getting it. So what is this muscle doing? This is the main muscle for maintaining fecal continence while coughing and sneezing. ठीक है, ऐसा नहीं है कि you are in a, let us say, in a classroom or whatever it is, you coughed and from backside the feces are releasing out. No, puborectalis is a very important muscle. That is the reason why, guys, you see some of the children, even they attain 10 years of age also, right, they still urinate in the bed. Why? The reason is that on coughing and all they urinate. Why? Because the pelvic floor muscles are very weak. That is the reason why you should train them. You know, there are some exercises called as Kegel exercises, okay, which are pelvic floor exercises, which will make the pelvic floor muscle strong. Okay, so those things we will be discussing later on. Right. So one is done. What is that? Puborectalis is done. Pubococcygeus मतलब क्या? Pubic bone से लेकर coccygeus, right? So all of you just look here. See, this muscle is all the way from the pubic bone to the coccyx. You see, pubic bone से लेकर coccyx तक, right? This is called pubococcygeus muscle. So pubococcygeus muscle. Next we have got iliococcygeus. All the way from the iliac bones here to the coccyx. This is called iliococcygeus. there is no need of remembering these muscles, guys. Just remember the name. Okay, origin, insertion, koi nahi puchega. If they ask you image based question, you should be able to tell in that situation to tell. Okay, right. So what did I tell you, guys? Levator ani has got three muscles, right? Puborectalis, pubococcygeus, iliococcygeus. All of them together are innervated by nerve to levator ani as well as branch of pudendal nerve. Keep this thing in mind. This was a question that was asked previously. So what is the nerve supply of your levator ani muscles? That is your these are the muscles here. Okay, is everyone clear, guys? Is everyone clear? Yeah, very good. Shall we go? It's the main support of uterus. Okay, right. Now this is a little bit 3D picture over here which you can see. This is a picture which you can see over here. Ye dekho. All of you look. What did I tell you? I told you two openings. What are the two openings? One is called as urogenital hiatus for urine. Another one is rectal hiatus for the feces. Ye dekho. Front side, what do you have here? Sorry, I have misplaced it. Yeah. Urogenital. Okay. Right. So this particular is called as your anal hiatus. Sorry, urogenital hiatus here. Urogenital hiatus, and here you have got your anal hiatus. Now, how did I change this? Because this is a sacrum. On the back side, you have got anal, and this is the front region, right? The pubic bone and all. Clear, all of you? But what I'm trying to tell you is that, so this is like a diamond shape, right? So if I draw it here, all of you look here, this is looking like a diamond shape like this. Okay, in the front you have this called as urogenital hiatus. On the back you have this rectal hiatus. Between urogenital and rectal hiatus, there is a small fibromuscular structure. This fibromuscular structure is called as perineal body. Ye dekho yahan pe, you see this black color one over here in the center. This black color one over here in the center is called as perineal body. Okay, so let me write it down. Ye dekho, this particular one over here is called as your perineal body. Perineal body. So this is your perineal body. Now can you figure out two important triangles over here, guys? Ye dekho, here you see one triangle and down also you see one triangle. The upper triangle which you can see over here, right? One triangle is called as anal triangle क्योंकि ये anus के पास है. This is called as anal triangle. And the lower triangle over here is called as urogenital triangle. Urogenital triangle, anal triangle, urogenital triangle. Guys, little by little I'm building some concepts in your brain. Why am I telling you this? You will get to know when I show you this particular picture. Okay? So that is why I'm just forming concepts in your brain. So till here I hope all of you are clear. Now all of you, let us go back. See the same picture I have drawn it here. The same picture I have drawn it here. Okay? Nothing to worry. Same things. ये देखो, this is urethra, this is anus. और ये triangle का नाम क्या है? Urogenital triangle. And the triangle over here is your anal triangle. What is this? Anal triangle. Now what is this body, anyone? Very fast. What is this body? This body over here is called as your perineal body. Very good. Now, what is my main main ideology to tell all this thing is that if you look carefully into the anal triangle, this is your anus. On either side of the anus, you see some space over here which I have highlighted with the yellow. Okay? ये space का नाम है Ischioanal Fossa. What is this? Ischioanal Fossa or Ischiorectal Fossa. This is a very important space. I am going to tell you in a minute about this. Very important clinical conditions are based here. So this fossa is called Ischioanal Fossa or Ischiorectal Fossa. Right? This is in case of males and यहाँ पे in case of females. Nothing. Only one thing extra it will add up. That is your vagina. Remaining everything is same. Okay? Right. Now this is anal triangle. Within this anal triangle, what structures do you have? You have got anal aperture, matlab your anus, right? Next, anal aperture ke surrounding that wheel-like shape, you see this? What is this wheel-like shape? That is nothing but sphincter. external anal sphincter. Next, ischioanal fossa. How many do you have ischioanal fossa? Both. Two you have on either side. Two ischioanal fossas and pudendal nerve. Okay, so these are the structures that are located within the anal triangle. Very important. Structures located within the anal triangle, these are the structures. Okay, right. Now, what I'm trying to do is that, for example, if you cut my body like this, right? If you cut my body like this in a coronal section all the way till down, right? This is how you are gonna end up. Okay, so just try understanding the picture first. Later you will see how many MCQs will be solved from this, many MCQs. And if there will be a question that will be asked from pelvic floor, that is 100%, 200% that is from this particular topic only. Okay, all of you, just whatever works you are doing there, I can't see, but just put it all aside, just listen to whatever I'm telling you. Okay, see, step by step. Okay, this is your urinary bladder. Clear? Okay, urinary bladder. Next, what is this? This is your urethra. What is this? Urethra. Okay, and what is this part over here? This is called as, this entire thing is called as your urethra over here. Okay, next, what are these two glands over here? These two glands over here are called as bulbourethral glands. Okay, bulbourethral glands. So bulbourethral glands ka ye kya hai? What are these? These are called as the ducts of bulbourethral glands. Okay, and what is this cut section of the bone? These are your pelvic bones which are cut. Okay, now here you can see two important pouches. And where is the penis? Actually, this is the penis over here. This is the penis. Okay, see, this is your entire penis. Okay, here now this entire penis has been opened like this. Okay, now all of you just look here. Here you have got two important pouches. ये blue color में जो है, this is called superficial perineal pouch. Okay, and whatever is there with this green color, this is called as deep perineal pouch. So we have got superficial perineal pouch, we have got deep perineal pouch. Now, what they ask you is that, what are the structures that are located in these perineal pouches in males and females? This is the male, but in females also, what structures do you have? We will discuss. Okay, first, one by one. First, let us discuss about superficial perineal pouch. Superficial perineal pouch in males. What structures do you have? You have to remember by the mnemonic cupboard. Okay, CUPBD, cupboard. Okay, first what do you, okay, don't look at the mnemonic now, just look at the things which I am telling. What do you have? Bulb of penis covered by bulbospongiosus muscle. Bulb of penis covered by bulbospongiosus muscle. Just look at this. Where is bulb of penis? Bulb of penis कहाँ पे है? ये देखो, ये हो गया bulb of penis. Okay, where is this bulb of penis present? Where is this bulb of penis present? This is covered by your bulbospongiosus muscle. Agree? All of you agree with this? Right? You see, this entirely is your bulb of penis. And this bulb of penis is covered by which muscle? Bulbospongiosus muscle. And where are they located? Superficial perineal pouch. Okay? हो गया. One is done. Okay? Second, crura of the penis is covered by ischiocavernosus muscle. Where is crura? You see, this part over here, this is called crura. This crura is covered by what is this muscle? Ischiocavernosus muscle. All of you look here. This is called as a crura. And crura is covered by which muscle? Ischiocavernosus muscle. Now tell me, they are located in superficial perineal pouch or deep perineal pouch? They are located over here in the superficial perineal pouch. Next, ducts of bulbourethral glands. Where are they located? Superficial perineal pouch. ये देखो, if this is bulbourethral gland, इसका ducts कहाँ पे? Where are these ducts located? These ducts are located in the superficial perineal pouch. Then if I ask you, where are the glands located? Yeah, where are these bulbourethral glands of Cowper? Where are these glands located? Superficial or deep? What will you tell? Just look at the picture here. Where are these glands located? They are located in the deep perineal pouch. Okay, but ducts are located in the superficial perineal pouch. Done? You are even done with this. Next, where is urethra? Urethra is in the bulb of the penis. Where is urethra? It is in the bulb of the penis. Guys, see here. ये येलो कलर में जो है ना, दिस इज द बल्ब ऑफ द पीनिस. बल्ब ऑफ द पीनिस के अंदर ये जो राउंड पार्ट है ना, व्हाट इज दिस सर्कुलर पार्ट, दिस इज कॉल्ड एज अ बल्ब. Sorry, urethra. This is called as urethra. Where is urethra now? In that yellow color tissue. What is that? Bulb of the penis. Clear? So that is also done. Right? And these remaining things I will tell you. Okay? But till here you understood. If you understood this simple part, right? Remaining all are easy. Okay? So all of you just look here. What do you mean by C? C stands for crura. What do you mean by U? U stands for urethra. What do you mean by P? P. Yeah, P stands for pudendal artery and pudendal nerve. P stands for what? Internal pudendal artery, internal pudendal nerve. Okay. Next, P is also done. After that, D. What does B stand for? B stands for bulb. Okay. Next, D stands for what? Ducts. Ducts of bulbourethral glands. So, if you remember this mnemonic CUPBD, cupboard, right, you can easily make out all the structures that are located in the superficial perineal pouch in the males. Okay. Now, coming to internal pudendal artery. Internal pudendal artery is having three branches. One is perineal artery, dorsal artery of penis, deep artery of penis. Okay. Dorsal artery of penis and deep artery of penis. When it comes to internal pudendal nerve, there are two important nerves. One is called perineal nerve, another one is called as dorsal nerve of penis. You see, perineal artery, here perineal nerve, dorsal artery of penis, here dorsal artery, dorsal nerve of penis. Easy. Now, if you understood in the males, females are very easy to understand. I mean, not in the real life, but at least in the textbooks over here. Okay. So, what are the things over here? See, bulb of penis is covered by bulbospongiosis. Females में penis थोड़ी होगा. What will be there? Vestibule will be there. Okay. So, what do you need to write? Bulb of vestibule is covered by bulbospongiosis. Clear? Next, here, crura of penis is covered by ischiocavernosus. Here, crura of clitoris is covered by ischiocavernosus. Okay. Third, ducts of bulbourethral glands. Right? Here what do you have? Bartholinus glands. In females, we have got Bartholinus glands. Okay. Next, here we have got urethra. Here also we have got urethra. Okay. Next, here we have got branches of internal pudendal artery. Here also we have got branches of internal pudendal artery. Branches of internal pudendal nerve. Branches of internal pudendal nerve. Again, internal pudendal artery का branches क्या है? Perineal artery, perineal artery. Dorsal artery of penis, but dorsal artery of not penis, clitoris. Dorsal artery of penis here, deep artery of penis here, deep artery of clitoris. I hope is this clear to all of you. You just have to figure out the structures that are located in this blue color box. ये blue color box के अंदर जो भी चीजें है, if you figure it out, then it will be easy. Right? I hope it is clear to all of you. Yes or no? Everyone? Thank you, Neha. Neha, very good. Remaining doctors, MCA पास होने दो, उसके बाद असली टॉर्चर शुरू. Right, so I will eat after the session is done. Don't worry about me. I'm really thankful. I'm hungry. I'm hungry. That's why I'm drinking water. Right. Anyways, let us first finish this up and then I'll go eat how much I want. Right. Right. So we are done with superficial perineal pouch. Right. Now, after the superficial perineal pouch, the next pouch which we have over here is your deep perineal pouch. Deep perineal pouch, just 5 points, guys. Just 5 points are there. Okay. Let us see in males whatever are there, and obviously females it will be the opposite thing. So yeah, I will take rest after this. I will take after this once the pelvis is done. Okay. So So in the males, you have got membranous part. Okay, so you have got the membranous part of the urethra. अब ये देखते हैं membranous part कहाँ पे है? Where is this? See, all of you just focus here, guys. This part of the urethra surrounding your prostate gland is called prostatic part of the urethra. Okay. Next, this part of the urethra which you can see here surrounding the deep perineal pouch. ये देखो deep perineal pouch के अंदर एक छोटा सा part of urethra is there, finger like thing, right? This is called as membranous part of the urethra. So deep perineal pouch is consisting of, first, what is the thing? Membranous part of the urethra. Second thing, it is consisting of ducts or it is consisting of glands. It is consisting of glands. What are these glands? Bulbourethral glands of Cowper. Okay, so it is consisting of bulbourethral glands of Cowper. Third important thing, it is also consisting of two important muscles. What are those two important muscles? These are sphincter. You see this? These are sphincter urethra muscles and these are deep transverse perineal muscles. Let us go back to the text over here. Right. ये देखो. In the males, you have got membranous part of the urethra. You have got sphincter urethra muscle. You have got deep transverse perineal muscle. You have got bulbourethral glands and again the same thing, guys. यहाँ पे जो है same thing. Branches of internal pudendal artery, branches of internal pudendal nerve. ये देखो. Branches of internal pudendal artery, branches of internal pudendal nerve. Even the same for females also. Okay, females also. Now, in males you have got membranous part of urethra. In females, what do you have? Urethra and vagina, right? Urethra and vagina. And here, what do you have? Sphincter urethra. We need sphincter in males to control the urine. Even females also need the sphincter. So, sphincter urethra. Deep transverse perineal. Here also deep transverse perineal. Bulbourethral glands, here no glands. Sir, why no glands? Because already in females glands are covered in the superficial perineal pouch. Okay, इसलिए there are no glands here. Remaining all are same. Right? Guys, have you understood what structures? I know it might be difficult if you are reading it for the first time, but if you just focus on it, just 2 to 3 minutes, it will be very easy. What structures located in the superficial as well as the deep are very important. Is it clear to everyone? Yeah, right. So the last part in the pelvis which I told I will discuss is your ischioanal fossa or ischiorectal fossa. मैंने बोला था ना, on both the sides you have got that fossa, ischioanal fossa or ischiorectal fossa. Actually, I have drawn it on one side, but I did not draw it on the other side because I don't want to occupy the space. Okay, don't confuse with this picture. So what is this picture here? This is a rectum. Okay, so what is this? ये देखो, ये हो गया rectum. Let us say, ये देखो, this is your rectum. This is your rectum. Okay, here ischioanal fossa is there. Here ischioanal fossa is there. What did I do? I cut the rectum like this. When I cut the rectum and I opened it up, this is how the picture you can see over here. Okay, right. Now let us mainly concentrate on this ischioanal fossa. This is your ischioanal fossa. Okay. Now in this ischioanal fossa, guys, you tell me what is this called? This is called as roof. और ये क्या होगा? ये होगा floor. और ये क्या होगा? This is called as a medial wall and this is called as a lateral wall. And even you have got this part called as apex also. Okay. So what is a roof consisting of? Roof is consisting of a muscle called as levator ani muscle. Okay. Here you go. Roof is consisting of a muscle called as levator ani muscle. Okay. Next. What is a floor consisting of? Floor is consisting of, what is it consisting of? Let us see. Deep transverse perineal fascia. See, what is a floor consisting of? Floor consisting of a green color layer here. Any green color layer is called fascia. And what is the, how is it fascia? Fascia is transverse. So it is a transverse perineal fascia. Floor is consisting of transverse perineal fascia. Next, medial wall is consisting of external anal sphincter and levator ani muscle. So all of you look here. So this is the medial wall. Medial wall is consisting of what? External anal sphincter. Sir, why are there three muscles? External anal sphincter के अंदर there will be three muscles. One is the deep, One is superficial, another one is subcutaneous. Okay, so here you have got this external anal sphincter medially. Laterally क्या होगा? Laterally you have got ischial tuberosity and obturator internus muscle. See, lateral in the sense this one. Laterally what do you have? This bone is called ischial tuberosity. And what is this red color muscle here? Obturatus internus. Obturatus internus. Okay, laterally you have got. Abhi apex. Apex क्या है? Apex is intersection of levator ani and obturatus internus muscle. What is that? ये देखो. Look at this. Levator ani, obturatus internus. Levator ani, obturatus internus. Both of them they intersect. That point is forming the apex here. That point is forming the apex over here. Okay, so base is having what? Anteriorly you have got perineal body, posteriorly you have got sacrotuberous ligament, right? So exactly in this picture you cannot see the base, okay, because this is this particular picture, right? I have opened it like this. Base matlab kya hoga? Yahan pe hoga, but this is a picture in this way, right? So you cannot see the base, but just remember it as anteriorly you have got perineal body and posteriorly you have got sacrotuberous ligament. So just by looking at the picture you have to answer each and everything. Why am I telling you this is that because within this ischioanal fossa which are located on both the side, what are the contents are very important. So the contents, all the contents here are named with the letter P. What is this? Pad of fat, right? Perineal branch of S4. Next pudendal canal. Pudendal canal के अंदर क्या होगा? Pudendal artery होगा, pudendal nerve होगा, pudendal vein होगा. Yes or no? Pudendal canal, perineal branch and pad of fat. Pudendal canal is having what? Pudendal nerve and internal pudendal vessels. मतलब artery and vein. Okay, artery and vein. Right. Why this part I have taught you is very important is that most commonly ये देखो, this is a rectum, right? Surrounding this rectal region, ये देखो, this surrounding this rectal region, you will have a number of abscesses formed. Okay, these are called as perianal abscesses. So, what are the types of abscesses that are formed? I am going to tell you, guys. Just look at this. This picture is almost, okay, almost not exactly, obviously. This picture is almost similar to this one. ये देखो, in the center you have got rectum. ये देखो, this is your pubic bone, right? This is your levator ani muscle, okay? This is your obturatus internus muscle, and where is your ischiorectal fossa or ischioanal fossa? ये देखो, this is your ischioanal fossa. Clear? On both the sides I told you, right? Now, where are the different places where abscesses are formed? First, what is this muscle? You should know. What is this muscle? This is your levator ani. है कि नहीं? The same picture here. ये देखो, levator ani. So, what I am trying to tell you is that above the levator ani, if there is an abscess formed, that is called supralevator abscess. What is that? Supralevator abscess. So, one abscess over here is supralevator abscess. Next, what is this? This is your anus. Just surrounding the anus, if you see an abscess, perianal abscess. What is that called as? Perianal abscess. Next important thing is abscess can be formed within the ischiorectal fossa or ischioanal fossa. Okay, that is called as ischiorectal abscess. And finally, intersphincteric. What is intersphincteric? You see here. What is intersphincteric here? ये देखो. What is this? External anal sphincter. External anal sphincter is having deep muscle, superficial muscle and subcutaneous muscle. Now in between this, if there is an abscess formed, this is called intersphincteric abscess. What is this? Intersphincteric. Sir, how to remember it is very difficult. Just remember the mnemonic SIP. SIP. S stands for supralevator, I stands for ischiorectal, intersphincteric and P stands for perianal. These are some of the some of the places where you have these abscesses that are formed. So this part is mostly asked in surgery, right? So whenever you are revising, Mantis is asking, sir, does fistula cross ischiorectal fossa? Yes, it crosses the ischiorectal fossa. Yes, fistula crosses. See, look at this. But if it is formed inside, it cannot cross. Why? Because surrounding it is having, you see, if it is formed inside, it cannot cross. Because everywhere there is a wall, everywhere there is wall, it cannot go anywhere, right? So it cannot cross there. Clear, all of you? Right. So what is the, yeah, one more last topic is left over here, that is extravasation of urine. What is extravasation of urine? Extravasation of urine matlab, normally urine from the urinary bladder should enter into the urethra and then excrete out. But within the urethra, if there is any damage or any rupture of the urethra, urine from there will leak out. So that is called extravasation of urine. So how this extravasation is happening, we will see. Okay. So in this particular picture, let me just teach you few important things. Here देखो ये urinary bladder है, right? And this is your urethra all the way entering into your penis. And this is your scrotal sac. Okay. And ischiorectal fossa बोला था ना, ये देखो, this is your ischiorectal fossa. Okay. And next, where is deep perineal pouch? Any guess? This, very good. This is your deep perineal pouch. Deep perineal pouch के नीचे होगा superficial perineal pouch. Yes or no? You remember, guys? See, this is your deep perineal pouch. Below that, you have got this superficial perineal pouch. Okay? Here they go. This is your deep perineal pouch, and below that, this is called as your superficial perineal pouch. Deep perineal pouch ke niche superficial perineal pouch. Okay? Now, all of you just look here. First of all, what are the parts of the urethra? Can anyone tell what are the 4 important parts of urethra, guys? All of you look here. See, 1, 2, 3, 4. The first part of the urethra is surrounded by prostate gland. So, first part of the urethra, you call it as a prostatic urethra. Okay. Second, the second part of the urethra is located in the deep perineal pouch. Many already that thing I have discussed previously. So, second part of the urethra is called membranous urethra. Okay. Next, third part of the urethra is coming out of the deep perineal pouch. This is called as the bulbous urethra. Okay. Next, the fourth part of the urethra is within the penis. So, you call this as a penile urethra. So, what are the 4 parts of the urethra over here? Prostatic urethra, membranous urethra, bulbous urethra, and penile urethra. इनमें से the most commonly injured urethra is membranous part of the urethra. Okay, membranous part of the urethra. Right. Now, let us start discussing each and every urethral injury. First, now pay attention everyone, just focus, don't write anything. For example, if patient is having a rupture of prostatic part of the urethra, what will happen? What will happen is that the urine, all of you look here now, the urine from here will enter into your space. Okay, it will come out like this, and this urine is going to go upward. What is this? See, this red color line which I am drawing over here is your peritoneum. What is this? Peritoneum. Pata kaun sa peritoneum hai ye? This is your visceral peritoneum. Okay, and what is this particular part? This is your anterior abdominal wall. Anterior abdominal wall and its muscles. So, where will the urine escape into? Urine will escape between the anterior abdominal wall and the parietal layer. So, let us study now. Right. See, all of you look here. Agar prostate region injury hua, then the urine will escape into the retropubic space. Retropubic space matlab this is your pubic bone. So behind the pubic bone is retropubic space, and you know this particular space is called as, this particular space which you can see, this is called as space of Reitz. R-E-I-T-Z, space of Reitz. Okay. So if urine will escape, the urine will escape into the retropubic space. Can it cross the pubic bone and come? No. It will escape into the retropubic space, which is called as space of Reitz. Clear, all of you? So that is regarding your prostatic urethral injury. And between anterior abdominal wall and the peritoneum also I told you. Second, If patient will have membranous urethral injury, where will the urine enter into? Tell me guys. ये देखो, अगर membranous part is broken down, where will the urine enter into? The urine will very easily, the urine will very easily enter into your deep perineal pouch. Urine will very easily enter into your deep perineal pouch. Okay. Second injury is rupture of membranous part with rupture of fascia number A. ध्यान से सुनो. Again, I'm telling you, only membranous part is ruptured. Urine will stay within your deep perineal pouch. Membranous part के साथ, along with membranous part, the top green color layer, if that is also ruptured, then tell me where will the urine enter? देखो, this is also ruptured, right? Where will the urine enter? The urine will enter into deep perineal pouch, and the urine will also enter upward. Here also, what will happen? Here also the urine will enter upward. You know where will the urine go? The urine will go all the way surrounding your bladder. Surrounding your bladder is called perivesicle. Okay, perivesicle. So first stage injury, only membranous part is gone. Second stage injury, membranous part plus roof is gone. Third stage injury, membranous part plus floor is gone. All of you look here. Membranous part to gaya. Now I'm telling you, this floor is also gone. So what will happen? The urine from here will enter down into your scrotal sac. Is everyone clear with this? Just look at this now. For example, if patients only urethral injury has happened, then urine will stay in the deep perineal pouch. If urethral injury plus superficial fascia, the top one, the top layer A is gone, that will lead into perivesical space around the urinary bladder, around the prostate and all. For example, if it will enter into your perineal membrane, if the membranous part is gone and the perineal membrane is also gone, perineal membrane मतलब ये नीचे वाले जो layer है ना, if this is also gone, then the urine will enter into, what is this entire space called as, guys? Just tell me. ये deep होगा तो ये क्या होगा? This is your superficial perineal pouch. It will enter into superficial perineal pouch और वहां से it will also enter into your scrotum. Is this clear to everyone? And finally, bulbous part. Okay. So if bulbous part मतलब यहाँ पे, ये देखो यहाँ पे अगर rupture हुआ, right? If bulbous part is gone, then what will happen? The urine will enter into your scrotum, right? Urine, not only scrotum guys, अच्छे से देखो, urine will also enter down here. Okay, it will also enter here. You see, urine will also enter surrounding the urethra. So that is what it is written over here, that bulbous urethra agar gaya, first urine will enter into the scrotum, urine will enter into the penis, urine will enter into the superficial perineal pouch. ये पूरा superficial perineal pouch है ना? All this is a superficial perineal pouch. Okay, so this concept is called extravasation of urine. Once if you just look at the picture and study, that would be easy. Thank you so much, Sneha. So all of you understood whatever I've taught. Now we are done with the abdomen and pelvis, and after that now we shall be discussing head and neck neuroanatomy, and we shall finish up the topics here. Okay, so I think mostly 1.5 hours more, and then we shall finish up the anatomy here. Right, so guys, till here all of you are clear. So can I take a break for a few minutes? Right, just 5 minutes. Right guys, so how are you all? How are you all? Right. Everyone is there? आए तो बोलो. Lydia Daniel Lapata ladies. How is that? Is that series good? Yes, then I'll watch it tonight. Right. Chalo, let's start now. Let's not waste the time. So, we are done with the upper limb, we are done with the lower limb, we finished the abdomen, we finished the pelvis, right? And now we shall be discussing the head and neck and neuroanatomy, okay? So, all of you, in the neuroanatomy and in the head and neck, first, what are the important topics? Guys, head and neck and neuroanatomy are very important, even you know that, and very difficult, even you know that thing, right? You know everything, right? So, all of you just look at this head and neck and the neuroanatomy. Let's start this now. So, the first important thing which we shall come across is your pharyngeal arches, okay? So, all of you know pharyngeal arches. Thank you so much, RS sir. Pharyngeal arches, how many are they? What are pharyngeal arches first of all? Pharyngeal arches are nothing but they are present near the pharynx like this, okay? So, each pharyngeal arch will develop into a specific structure. For example, pharyngeal arch number 1 will develop into your ear, it will develop into your tympanic membrane, auditory meatus and all, okay, middle ear and all. Pharyngeal arch number, I'm just roughly telling, okay. Pharyngeal arch number 2 will develop into your mandible, some cartilages here. So, these pharyngeal arches are the arches that form the structures of the head and neck, okay. These are the structures that form the head and neck. So, your entire structures of your head and neck are mainly formed by these pharyngeal arches, okay. So, very good RSR is telling fifth pharyngeal arch is absent. Yes, it is rudimentary, it is omitted. So, how many pharyngeal arches we have got? As you can see in the screen over there, right, that the pharyngeal arches which you have over here, you can see there pharyngeal arch number 1, pharyngeal arch number 2, pharyngeal arch number 3, pharyngeal arch number 4, there is no 5, and finally you have got the down part, that is your 6, okay. So, here you have got pharyngeal arch number 1, 2, 3, 4 as well as 6. Fifth arch is rudimentary. Keep that thing in mind. Okay. Now, guys, very important thing is that this is your pharyngeal arch, right? If I am cutting down the pharyngeal arch like this, so both the sides pharyngeal arches are there. If I am cutting the pharyngeal arches here as well as here, how does the picture look? This is how the picture looks. Okay. You see, I have cut down the fingers 1, 2, 3, 4 and 6. Now, very important thing you need to remember is that you see there is an epithelium that is located inside. The epithelium that is located inside this red color one is called as endoderm. The epithelium that is located outside this blue color one is called as ectoderm. Okay, ectoderm. And this yellow color things which are located in the center, this is called as mesoderm. So, pharyngeal arches are made up of your ectoderm outside, mesoderm in between, endoderm inside, right? Next important thing is that outside you can see some depressions there. This is one depression over here, this is a second depression, third depression, fourth depression. What are these depressions over here? These depressions over here are called as clefts. Okay, what are they called as? Clefts. How many clefts do we have? We have got the first cleft, we have got the second cleft, we have got the third cleft, we have got the fourth cleft. 4 clefts are there. In the same way, if you look at the structures that are present on the endodermal side, these depressions are called as pouches. How many pouches are there? We have got the first, second, third, fourth. So if they ask you in the exam, clefts are, right? Clefts are derived from ectoderm, right? Whereas pouches are derived from endoderm. Then what are the structures in the center here? These are called as arches, pharyngeal arches. So pharyngeal arches are derived from mesoderm. Okay. So what do you need to know? Clefts are from ectoderm. Question was asked. Pouches are from endoderm. Right? Right? Thank you so much, Crazy. Thank you. Right. So next important thing over here we have got over here is these are your pouches. Okay. These are your pouches over here. Okay. So what is the important thing I told you? Yeah, this was a question asked. And next important thing, these are your arches. So arches are comprised of what? Arches are comprised of mesoderm. So 3 MCQs to cover ho gaya. Ectoderm is cleft, endoderm is pouches, and mesoderm is arches. Okay, guys, what we will do is that first we shall discuss about what are the derivatives of clefts. Uske baad we will discuss about what are the derivatives of pouches. Then we will discuss about what are the derivatives of your arches. Okay, first let us discuss about the clefts. Okay, now guys, listen carefully. Now listen very carefully. Okay, so all of you look here now. What is this one over here called as? All of you look here now. What is this particular one over here called as? This depression over here is called as your cleft. Okay. So what has happened to the cleft is that this cleft will invaginate in this way. Cleft, how did it invaginate inside? Cleft on the other side also will invaginate the same way. See, all of you look here. I have just drawn this picture over here. Now this particular cleft invagination will little bit modify like this, and finally it will modify like this, and this is going to form your ear pinna. This is how your ear pinna is formed. I hope this is clear how ear pinna is formed. So this is your ear pinna over here. Okay. So next important thing. So first important thing which you need to know here is that first cleft will form into what? First cleft will form into your ear pinna. Now after that, second important thing is that there is a small depression here, a gap. Now within this gap, what will happen? This invagination will go deep inside, and this invagination will finally form this particular part called as external auditory meatus. This is your ear pinna, and inside if you go, you will get external auditory meatus, right? So external auditory meatus. So first cleft will form ear pinna and external auditory meatus. Next important thing, coming to the second, third as well as the fourth cleft. What will happen is that you see second, third and the fourth cleft. How did it happen? Ye dekho. Second, third and the fourth cleft, all of them together they join and form a sinus. This sinus is called as cervical sinus. Okay. Now later on this cervical sinus is disappeared. Cervical sinus will completely empty it up. It is like a balloon. Okay. It will completely get obliterated. In some patients, what will happen? Cervical sinus is not obliterated. When it is not obliterated, you see that the balloon-like swelling in the anterior part of your sternocleidomastoid muscle here. Here you see that swelling. That swelling over here, you call it as branchial cyst. Where do you find the branchial cyst? You see it anterior to sternocleidomastoid muscle. Clear everyone? You see it anterior to sternocleidomastoid muscle. Okay, so let us look at the patient now. All of you just look at this. Can you look at this kid having anterior to sternocleidomastoid muscle? Can you see a small cyst here? That is called as unobliterated cervical cyst, which is also called as branchial cyst. Okay, branchial cyst. Right. This is done. So we are done with the clefts. Right. First cleft I told you, ear pinna, external auditory meatus. Ho gaya. Next. second, third and fourth together they will invaginate inside, form cervical sinus, and that will obliterate later on. Agar obliterate nahi hua, right, if it will remain, that will lead to a condition called branchial cyst. Okay, done. Now we will discuss about pouches. What is the first pouch, second pouch, third pouch and fourth pouch doing? Now look at the first pouch over here, right? Now all of you just look here. First pouch. So when you first meet someone, when you first meet, M-E-T, meet, when you first met someone, right? When you first met someone. So this is how you remember. What does M here stand for? M here stands for mastoid air cells. E here stands for eustachian tube. And T here stands for tympanic cavity. So mastoid air cells, eustachian tube, tympanic cavity, all of them are the parts that are related to your ear only. Yes or no? Mastoid air cells, eustachian tube, tympanic cavity, all of them are related to your ear. So these are the structures that are derived from the first pouch. Okay. Now coming to the second pouch. So all of you just observe this particular image here. I'm just removing this image. Just observe it. Now what has happened to the second pouch? Second pouch kahan pe hai? Ye dekho, this is second pouch. Second pouch, you see some red color structures are located here. What are these? Within these red color structures, tonsils are formed. So second pouch will develop into tonsils. Okay. Now what about third pouch? Third pouch will invaginate again. Ye dekho. Third pouch has invaginated into two wings like this. Ye kya hai ye dono? One is called as a dorsal wing. One is called as a ventral wing. Even fourth pouch also divided into, one is called as a dorsal wing, one is called as a ventral wing, right? So what is present in the third pouch? Third pouch dorsal wing mein kya hai? Third pouch ventral wing mein kya hai? What are the structures that are present over here? So all of you just pay attention. Let us say that this is your thyroid gland. This is your thyroid gland. Now, on four corners of the thyroid gland, what do you have? Parathyroid glands, right? You have got two superior parathyroid glands. You have got two inferior parathyroid glands. You know what will happen here? What will happen over here is that, just look at this. See, this particular dorsal wing is forming, you know what gland? This dorsal wing is forming inferior parathyroid gland, not superior. Okay, don't confuse. It is forming inferior parathyroid gland. This inferior parathyroid gland will come down all the way, come down all the way, come down all the way, and settle down over here. ये देखो, यहाँ से भी this inferior parathyroid gland will come down and settle here. Clear, all of you? Is everyone clear? Next, after that, if you look at the fourth pouch, within the fourth pouch also you see some parathyroid gland that is formed, that is called superior parathyroid gland. What is that? Superior. That will go all the way and settle up there. Okay. Yahan se bhi it is going all the way and settling up there. What is exactly happening? What is exactly happening is that there is crisscross. From the dorsal wing, parathyroid gland is coming and setting down like this. From the fourth wing, parathyroid gland is going up and settling up. Then what about the ventral wing? Ventral wing mein ye jo pink color mein hai, what is this? This is nothing but your thymus. What is this? This is nothing but your thymus. So what did I tell you guys? What did I tell you is that second pouch se kya aayega? Tonsils. From the third pouch and fourth pouch, what will come? Let us say, if you look at the third pouch over here, third pouch is divided into dorsal wing as well as ventral wing, right? From the dorsal wing, inferior parathyroid gland will come. From the ventral wing, thymus will come. Next, if you look at the fourth pouch, from the dorsal wing, superior parathyroid gland will come. And from the ventral wing, did I draw anything in the ventral wing over? You see, ventral wing is empty, right? Ventral wing is empty. But from the ventral wing over here, you know what structures come out? One is ultimobranchial body and parafollicular cells of thyroid gland. You know, thyroid gland has got follicular cells and parafollicular cells. So parafollicular cells of thyroid gland will start emerging from here. Guys, just tell me, are you clear with all of these things till here? Very good. Yeah, good. Now what we will do is that we are done with the clefts, we are done with the pouches. Now we will concentrate on the arches. Each arch is derived into what we will discuss about that. Now, all of you just look here. But before that, one very important clinical condition I want to tell you, that you know there is chromosome number 22. Chromosome number 22 has got a long arm, a short arm. Short arm is 11th position. Short arm 11th position, in the short arm 11th position, if it is completely deleted, okay, so that would lead to a condition called as DiGeorge syndrome. That would lead to a condition called as DiGeorge syndrome. Now what will happen when there is DiGeorge syndrome? Pouch 3, pouch 4 will not invaginate. मतलब normally ऐसा होगा ना pouches? Invagination ऐसा होना चाहिए ना? Invagination should happen like this. Pouch 3, pouch 4 will not invaginate. If it will not invaginate, do you think parathyroid glands are formed? No. Thymus is formed? No. So absence of parathyroid gland or thymus is called as your DiGeorge syndrome. Clear? This is a topic that you will see in case of biochemistry, okay? And in pediatrics also. So keep this thing in mind. Now coming to the first arch, guys, I'll give you a mnemonic to remember these arches, okay? If you look at first arch, okay, first arch is mad at, just remember the mnemonic, it is mad at someone. So all the structures over here coming from the first arch, they start with the letter M. What do you mean by M? M stands for muscles of mastication. M stands for mylohyoid muscle. M stands for mandibular prominence, your mandible is formed. M stands for Meckel's cartilage. Meckel's cartilage will later on develop into malleus and incus. And next, it will also MAD. M is done, right? And next, ADT, right? A, D and T, MADT. So D stands for digastric. Digastric में जानते हो guys? Digastric has got anterior belly of digastric and posterior belly of digastric. ठीक है? तो anterior belly of digastric is formed from first arch. Posterior belly of digastric is formed from second arch. Okay. Next, anterior 2/3 of the tongue. Anterior 2/3 of the tongue is formed from first arch. Posterior 2/3 of the tongue is formed from second arch. Okay. And muscles. What are the muscles? Tensor. There are two tensor muscles. एक tensor palatini, एक tensor tympani. Okay. One is tensor palatini, one is tensor tympani. All these are the structures developed from the first arch. Everyone is clear? Coming to the second arch. Second arch का first letter क्या है? Second. S. S stands for what? Stapes. Why are you writing it as stapes? क्योंकि malleus incus वहां पे already खत्म हो गया. Next. S stands for styloid process. S stands for stylohyoid ligament. S stands for stylohyoid muscle. दोनों. Stylohyoid ligament or stylohyoid muscle. S stands for stapedius. Okay. Next. Muscles of facial expression. Right. And next important thing is diagastric posterior belly. What did I tell you here? Diagastric anterior belly, but here diagastric posterior belly. And here what did I tell you? Anterior 2/3 of the tongue. Now I am telling you posterior 2/3 of the tongue. Okay, posterior 2/3 of the tongue. So all these with S, all of them are derived from your second arch. Is everyone clear with this? Right. Very good. Crazy neurosurgeon. You are right. Nerve supply 7th. Yes, you are right. Coming to the third one. What is the third one? Just remember, as wherever there is any kind of operation going on, right? One SPG commando will not go. At least there will be 3 SPG commandos. Okay. So one to guide, one to attack, and one to get them back. Okay. So definitely there will be 3. So 3 is what? Third arch. 3 SPG commandos. What is S? S stands for stylopharynges. P stands for posterior 1/3 of the tongue, and G stands for greater horn of hyoid. Okay. And finally, let us go to the fourth arch. Fourth is nothing but 4. 4 monkeys can play lovely piano. Remember it as there are 4 monkeys in a concert who are playing lovely piano. That is a zoo restaurant, let us say. 4 monkeys are there who are playing a piano. So what is M? M stands for middle pharyngeal constrictor. C stands for cricothyroid muscle. P stands for palatopharyngeus, L stands for levator veli palatini, and P stands for posterior 1/3 of the tongue. You see, posterior 1/3 of the tongue is both from fourth arch as well as the third arch, right? So keep this thing in mind. Okay. Coming to the sixth arch is not that important. You know all the cartilages. Kya cartilage is? Thyroid is there, cricoid is there, right? Arytenoids are there, cuneiform, corniculae. All these cartilages, they start developing from your sixth arch. Okay. So in the same manner, the way I told you, if you remember it, then it is going to be easy, guys. Okay. It will be really, really easy for you. So these are the things over here. So this is the first arch, this is the second arch, this is the third arch, this is the fourth arch, and this is the sixth arch. So just look at those structures which I have written and compare with these pictures and then answer it. So each arch we have just written the structures that are formed, muscles, cartilages that are formed, but we should also discuss what arteries, what nerves are located. Okay. So first arch we have got the maxillary artery. Why? Because first arch is all the things that are starting with the letter M, I told you. So M for maxillary artery. Next, second arch, all the letters, all the structures with the letter S, I told you. So stapedial artery, right? Now third arch. What is this third arch? It is common carotid artery and first part of internal carotid artery. Okay. Coming to the fourth arch, right subclavian and left aortic arch. Coming to the sixth arch, it is both right pulmonary artery as well as your left pulmonary artery. Okay. Coming to the nerves, of you will remember, see, this is your fifth pair of cranial nerve. Add +2 to that. 5 + 2 is 7. 7 + 2 is 9. After 9, immediately you will have the 10th pair of cranial nerve. Clear, all of you? So these are the pharyngeal arches. Right? Right. Now let us look at the development of your tongue. You don't confuse with these pictures. You know what are these pictures? These pictures are nothing but pharyngeal arches. मैंने बोला था ना already. First pharyngeal arch से anterior 2/3 of the tongue develop होगा. ये देखो, ये first pharyngeal arch है, developing the anterior part of the tongue. And what did I tell you? Third, fourth pharyngeal arch develop the posterior. ये देखो, third, fourth pharyngeal arch developing the posterior part of the tongue. Okay, but I will tell you what are these things. See, these are pharyngeal arches like this. Okay, cut down the pharyngeal arches. Now here, what are these two swellings? These are called as lateral swellings. इसका नाम क्या है? These are called as lateral lingual swellings. These are called lateral lingual swellings. Next, between both lateral lingual swellings, can you see a blue color body over here? This is called as tuberculum impar. What is this? Tuberculum impar. Okay. Now, down here you see a very big oval structure. This is called as scapula. What is this? Scapula. Now I'm putting all of these structures down here. See, these are your lateral swellings, right? And what is this? This is your what? Tuberculum impar. So all these three structures together, they will form your anterior 2/3 of the tongue. So now if someone is asking you, anterior 2/3 of the tongue is formed by two lateral swellings as well as that medial part, okay, that impar, tuberculum impar. Next, look at this cupula. Look at this cupula now. Now, coming to cupula, cupula is having two important parts. One is called as a cranial part, one is called as a caudal part. Cranial part will form posterior 1/3 of the tongue. Caudal part will form posterior most of the tongue. मतलब सबसे पीछे, the last part of the tongue. Okay, all of these are formed. So guys, what did you understand now? Two lateral swellings, tuberculum impar will form the anterior part of the tongue. Okay, next we have got the cupula. Cupula is divided into two, cranial, caudal. Cranial will develop into posterior 2/3 and caudal will develop into posterior most part of the tongue. We are done with the development of the tongue. Now, you should know from where these lingual swellings are there. First arch. In the picture itself it is clear. Lingual swellings are in the first arch. Okay. Next, tuberculum impar. First and second arch. ये देखो, tuberculum impar is here, right? In between the first arch and the second arch. Okay. And what about hypobranchial eminence? Hypobranchial eminence are also called as scapula. Where are they? Second, third and fourth arch. All of you look here. Ye dekho. Second, third and fourth arch. Okay. So most of the MCQs will be asked from this part. I want you to just keep it in your mind. Is everything clear so far? Yeah? Very good. Very good. So now let us discuss about the cranial fossa, guys. These are the cranial fossa which you have. How many cranial fossa which we have got? ये देखो यहाँ पे anterior cranial fossa होगा, बीच में middle cranial fossa और पीछे posterior cranial fossa you have got. From the side if you see also, this is your anterior cranial fossa, this is your middle cranial fossa, this is your posterior cranial fossa. Okay. Now what we will do is that each cranial fossa के अंदर what foramens you have and what structures come out of these cranial foramens. Okay. So let us just look at this. First, what is this? Anterior. ये देखो ये हो गया anterior cranial fossa. Okay. In this anterior cranial fossa, can you, if I am zooming it inside, can you see a small plate over here? ये देखो with multiple foramens. This plate is called as cribriform plate. Plate का नाम क्या है? What is this? This is called as cribriform plate. Okay. So this particular plate over here is called as cribriform plate. Okay. So all of you just look here. This is the same cribriform plate that I have taken it from there. Okay. Now this cribriform plate is having how many foramens over here? You see, it is having two large foramens on the back. This is called as anterior ethmoidal foramen, posterior ethmoidal foramen. और ये क्या है? ये सब multiple small foraminas. From these multiple small foraminas, what are those blue color sticks that are coming outside? They are nothing but called as your olfactory nerve. From multiple small foramina, olfactory nerve will emerge out. Okay. Then from anterior ethmoidal foramina, what will come out? Anterior ethmoidal artery, anterior ethmoidal nerve, anterior ethmoidal vein. From posterior ethmoidal foramen, what will come out? Posterior ethmoidal artery, posterior ethmoidal nerve, posterior ethmoidal vein. Okay. So all of you look here. Anterior ethmoidal foramen say anterior ethmoidal artery, nerve and vein. From the posterior, it is posterior ethmoidal artery, vein as well as nerve. Very good, the crazy neurosurgeon. The nerve that is affected in COVID is, yes, in fact, the olfactory nerve. Right. So all of you understood this. These are the foramens. These are the structures that are coming out. Okay. Right. And remember one thing, that this cribriform plate, whatever I told you, this is the very thinnest part of the bone. Okay. So most commonly this bone can be fractured. When it can be fractured, what will happen is that from the frontal lobe, the CSF will leak through the nose and the CSF will come out of your nose. That is called as CSF rhinorrhea. Right? And by the way, don't you think that if this cribriform plate is fractured, right, the foramens are also ruptured. Foramen rupture हुआ तो olfactory nerve rupture होगा. If olfactory nerve is ruptured, patient will have what? Anosmia. That is loss of olfaction. Is everyone clear? So anterior cranial fossa हो गया. Now coming to the middle cranial fossa. Now in middle cranial fossa, what are the openings do you have? All of us, let us learn the openings. Okay? See, this is called as supraorbital foramen. क्यों? क्योंकि this is the place where your eyeball is located. Just above the eyeball, you have got this supraorbital foramen. Okay? Say deep inside your supraorbital foramen you have got. Okay? Supraorbital foramen. Next, just look at this opening, guys. Isn't it looking round? Any foramen which is round, can I call it as rotundum? Any foramen which is round is called rotundum, right? Next, any foramen which is oval shaped, can I call it as ovale, right? Any foramen which is zigzag shape, can I call it as lacerum? Because when you take a blunt object and hit a person, right, you will see a laceration with a very rough borders. So lacerum. And anything which is very small circle, right? Very fine circle. This is called spine, spinosum. Okay. So what are the foramens you have learned? Anything which is round is called rotundum. Anything which is oval is called oval. Round, perfectly small round is called spinosum. Lacerated shape is called lacerum. Okay. Lacerated shape is called lacerum. See, supraorbital fissure is done, rotundum is done, oval is done, foramen, spinosum, and lacerum also. So what structures pass through this? Guys, now don't comment now. I just want you to be with me now. Just look here now. Supraorbital fissure से क्या क्या cranial nerves pass होगा? See, one is 3. So now look at the number now. 3, 4, 5, 6. What is this? 3, 4, 5, 6. Now in 5th grade of cranial nerve, you have got V1, V2, V3. V1 is your ophthalmic, V2 is your maxillary, V3 is your mandibular. Now out of these 3, which one will pass? V1. What is V1? Ophthalmic branch. So 3, 4, in the 5th V1. Next 5, 6. Okay, 3, 4, 5, 6. Clear all of you? 3, 4, 5, 6 pass through supraorbital fissure. Abhi next, foramen rotundum. Foramen rotundum say what structures come out? Already V1 is done. Now you have to give chance to V2. Okay. Next, from foramen oval what will come? Already V1, V2 is done. Now you have to give chance to V3. Clear all of you? So V1, V2, V3. Now coming to foramen spinosum. Through foramen spinosum, the structures which will pass are middle meningeal artery, middle meningeal vein, middle meningeal branch of V3. All middle. Okay. Why? Because we are discussing about middle cranial fossa. So middle meningeal artery, middle meningeal vein, middle meningeal branch of V3. Clear all of you? Next important thing is foramen lacerum. Right? So foramen lacerum. In foramen lacerum, what are the structures that are coming out? You have to remember the mnemonic name. Okay, you have to remember the mnemonic name. So again, what did I tell you guys? I told you lacerum matlab laceration, right? That is why the foramen is also not clear. Tell me the shape of this. Irregular borders, right? So you have to ask with which object, what is the name of the object with which they have beaten you? So that is why the mnemonic also goes, lacerum is name. N stands for a nerve. What is that? Nerve to pterygoid canal. Okay. Next, A stands for artery to pterygoid canal. Next, M stands for meningeal branch of ascending pharyngeal artery. We will discuss now. And E stands for emissary veins. So you just need to have a little bit of repetition to understand these things. So guys, you understood these things. 3, 4, 5, 6. 5 में V1, next rotundum में V2, next oval में V3. These are easy, right? Right. Coming to the posterior cranial fossa. In the posterior cranial fossa, exactly where your ears are, guys, just tell me. This is a place where your ears. Now exactly if I am drawing a line along your ears, can you see it is ending up with this foramen? This is called as internal acoustic meatus. You are putting the earbud into the ear. That is called external acoustic meatus. Deep inside you will have internal acoustic meatus. Okay. Next important thing is that, can you look at this particular foramen? Isn't this foramen looking like a J shape? Yes or no? Some inverted reverse J, right? Isn't it looking like a J shape? J stands for what? J stands for jugular foramen. J stands for jugular foramen. Okay. Next, you have got hypoglossal canal. I agree that you cannot see here clearly. ये देखो ये वाला है hypoglossal canal on both the sides. You cannot see here, but still in the real exam they will give you the real hypoglossal canal. Okay, the real opening over there. So hypoglossal canal, from hypoglossal canal, what is the structure that is passing? Hypoglossal nerve. Very easy. The largest is what? Largest is foramen magnum. Guys, you tell me, from foramen magnum what structures pass out? You know what structures pass out from foramen magnum? Spinal cord, all of you know. Not only spinal cord, lower part of medulla oblongata also passes out. Medulla oblongata के बाद spinal cord होगा ना, lower part of medulla oblongata passes out, spinal cord also will pass out. And guys, if you remember, I hope, I don't think so, there is no need for me today to discuss about circle of Willis and all. You guys are perfect with that. Okay. So this is your foramen ovale and foramen magnum, and this is your spinal cord. Now just pay attention to whatever I am drawing here. Okay. This artery over here is called subclavian artery on both the sides. What is this? Subclavian artery. From subclavian artery, there is a branch that is going on to the top like this. Ye dekho. What is this branch? This artery is called vertebral artery. Okay. Now this vertebral artery passes up all the way like this, and finally in the brain, both the vertebral arteries join together to form an artery called basilar artery. So now you tell me, spinal cord is passing through foramen magnum, vertebral arteries are passing through foramen magnum, lower part of medulla oblongata is passing through foramen magnum, and from these particular vertebral arteries, you see two arteries coming down like this. You know what are these two arteries called as? Anterior spinal arteries. What are they? Anterior spinal arteries. Okay. Anterior spinal artery hai. See, if this is spinal cord, in front of that the artery is anterior spinal artery. Iske piche, back of that, what artery you called as? Posterior spinal artery. You're getting it? So what are the structures over here? Just look here now. First, medulla oblongata, complete? No, lower part of medulla oblongata. Spinal cord. Next, surrounding spinal cord, what do you have, guys? Don't you have meninges, dura, arachnoid, pia? Don't you have that? So meninges also, vertebral artery also, and anterior to spinal cord, anterior spinal artery. ये देखो, ये वाला हो गया anterior spinal artery. पीछे क्या होगा? Posterior spinal artery. And one last thing you have to remember, that is spinal accessory nerve. That is the ascending part of the spinal accessory nerve. Okay. Thank you so much, Kirandeep. I have to complete the syllabus, that is why. So it is spinal accessory nerve. So these are the structures passing through foramen magnum. But you remember we did not discuss about jugular foramen. See, jugular foramen structures. What are the structures? 9, 10, 11. Okay, cranial nerve number 9, 10 and 11 are passing through jugular foramen, and interjugular. Jugular matlab kya? Jugular vein. So internal jugular vein, right? And two sinuses are passing, inferior petrosal and sigmoid sinus. Okay. Apart from that, just keep these two things in your mind: inferior petrosal as well as jugular sigmoid sinus. Clear, all of you? Right. So these are the cranial nerves and their foramens, guys, which are very important to know. So exactly study the way I am teaching you so that it would be easy for you. Okay. Next important thing is the muscles of mastication, guys. I don't know how many of you know the muscles of mastication, but very few know about the actions of the muscles of mastication. So if you print this picture in your mind, all the actions will be easy. Trust me. Okay, print this picture at any cost in your brain, at any cost. Okay, all the muscles will be easy. Now, first of all, what are the muscles of mastication? First muscle, temporalis muscle. Second muscle, lateral pterygoid. Third muscle, medial pterygoid. And fourth muscle is masseter. So what are the four muscles of mastication? One is called as temporalis, right? Another one is called as masseter. और तीसरा क्या है? Lateral pterygoid, medial pterygoid. Very easy to remember. Yes or no? Temporalis, masseter, lateral, medial, pterygoid. Okay? Look at the functions now. Now all of you just look here. Whatever function it might be, the function is mainly based upon lifting, dropping, moving forward, moving backward. So all the actions of mandible, elevation of mandible, depression, protraction of mandible and retraction of mandible. Just look at temporalis, guys. पहले temporalis देखो. How are the arrows pointed? ये देखो. First, temporalis is starting from base. It is going back. First, it is going up and going back. Going up is called elevation. Going back is called retraction. है कि नहीं? ये देखो, elevation and retraction. You clear? Elevation and retraction of mandible. Next, let us discuss about lateral pterygoid. Lateral pterygoid, look at the fibers. They are coming forward and diving down, right? ये देखो, forward and then diving down. फॉरवर्ड को प्रोट्रैक्शन, डाइविंग डाउन इज डिप्रेशन. ये देखो प्रोट्रैक्शन एंड डिप्रेशन. Look at medial pterygoid. Medial pterygoid is going like this, right? First it should go up, then take a turn like this. Going up is called elevation, going forward is called protraction. ये देखो protraction or elevation. Next, masseter. Masseter का fibers देखो, they are going back like this, right? So if they are going back, how do they go? First they go up and then they go back. Going up is elevation and then retraction. ये देखो elevation and retraction. Okay? Next, these are the actions. So that's why I'm telling you, if you just remember the shapes of these muscles, the direction in which they are projected, it is very easy for you to figure out the actions here, right? Is it clear to every one of you? Mantis, not only depression, even it undergoes protraction also. So this way, you see, this is the way how it is doing, in this way. First my mandible is going forward and then depressing. Okay, so if you look at amboss, right, in the amboss it is given directly lateral pterygoid is protraction as well as depression. Okay, clear all of you? Harika, that is responsible, that is your buccal muscle, that is your cheek muscle, okay, buccinator. So it is one of the muscle of your facial expression. But all these muscles of mastication, all of them are innervated by which nerve? Mandibular nerve. Very simple, mandibular nerve. Ye dekho, if they give you such image based questions also, I have kept it for you images, jab PDF bhej dunga, that time you better study this, okay. Let us discuss about the muscles of the tongue now. Guys, you are clear with this? Clear with this? Mastication? Very good. Very good. Coming to the muscles of tongue. Muscles of tongue, guys, ye dekho. This is my tongue, right? Tongue itself is a muscle. Tongue itself is a muscle, right? But there are some muscles that are holding the tongue. See, for example, if this is my tongue, okay? If my tongue has to stay in position, you see my left hand is holding this. So there are some muscles from outside holding the tongue. They are called extrinsic muscles. And within the tongue को cut करने के बाद अंदर देखोगे ना, within the tongue itself we have got muscles that is called intrinsic muscles. So what are the extrinsic muscles over here? All of you just pay attention. First, what is this? Styloid process. Beneath your ear here, you have got styloid process. Okay, this is called as the styloid process. So from the styloid process to the tongue, what is the muscle called? Styloglossus. Styloid process to tongue is styloglossus. Clear? Next, ye kya hai? What is this bone? Hyoid bone. Hyoid bone to tongue, what is this called? Hyoglossus. Styloglossus, hyoglossus. Next, from here, whatever it is going and attaching to the tongue, this is called gynoglossus. Okay, so what are the extrinsic muscles of the tongue? Styloglossus, hyoglossus, gynoglossus. और एक muscle याद रखो, that is palatoglossus. Out of this, I don't have a picture of that, right? Just remember it as palatoglossus over here. Okay. Next, intrinsic muscles. Intrinsic muscles in this is when you cut down the tongue, on the top of the tongue there are two muscles like this. Superior longitudinal, uske niche hoga inferior longitudinal, uske niche hoga vertical muscles. Okay, so superior longitudinal, inferior longitudinal and vertical muscles. Clear all of you? Now, extrinsic muscles of tongue, intrinsic muscles of tongue, all of them, okay, all of them are innervated by your hypoglossal nerve, except all of them are innervated by hypoglossal nerve except your palatoglossus, that is innervated by 10th pair of cranial nerve. फिर से याद रखो, all the muscles of intrinsic, extrinsic दोनों मिला के all of them are innervated by hypoglossal nerve except palatoglossus, which is innervated by 10th pair of cranial nerve. Keep this box in your memory. Okay, keep this thing in your mind. So I hope you understood the muscles of tongue. Clear all of you? Right. Next important thing is the extraocular muscles. Very easy guys. अगर ये eyeball है, right? So let us say that this part over here is your beautiful nose. Okay, this is your eyeball over here. Clear? So all of you look here now. Above the eyeball, superior rectus. Rectus क्यों बोलते हैं? Why are calling it as rectus? Because they're straight. That is why you call them as rectus. Here, inferior rectus. Okay, towards the nose, medial rectus. Away from the nose, lateral rectus. Next, there is one muscle obliquely on the top, superior oblique. There is one muscle obliquely on the bottom, inferior oblique. Superior rectus क्या करेगा? It will lift the eyeball upward like this. Inferior rectus lift the eyeball downward. Medial rectus, right? And lateral rectus away. I can't do that, but it is away. Clear, all of you? Right. Guys, have you seen in some of the people, right? There is deviation of the eyeball to one side, right? So this deviation, see, one eyeball will be looking straight and the other eyeball, there is a deviation to the right side or left side in some cases. This is all because of paralysis of these muscles. Okay, right? So all of you just look at this. Okay, so coming to this extraocular, so if you understood the extraocular muscles very well, you will understand those squint deviations also very well. Okay, so this is all done. Coming to the nerve supply, I want you to remember a formula, that is SO4 LR6 R3. Print it in your mind. SO4 LR6 R3. SO4 matlab superior oblique is innervated by fourth pair of cranial nerve, lateral rectus is innervated by sixth pair of cranial nerve, and the rest baki sab are innervated by third pair of cranial nerve. And I'm telling you, 90% you can get a question from this. Okay, they will mainly ask you about this. Okay, now let us look at the actions. Guys, actions are easy. Okay, pata kya karna chahiye? See, all of you look here. Very easy method I'm telling you. Whenever actions are asked, in your mind or if you get a paper, just draw an eyeball. Okay, और यहाँ पे हो गया nose. This is your nose. So wherever your nose is there, this is your medial rectus. Okay, away जो है, this is your lateral rectus. These things are clear. Second important thing is that here write here as, and first of all draw these arrows. First draw these arrows like this. Very simple way I'm telling you. So what is the first thing I did? I have written medial rectus, lateral rectus, then I have drawn 4 outward projecting arrows there on 4 sides. This is clear to you. Now what you do is that write on the top superior rectus. Okay, उसके नीचे क्या होना चाहिए? Inferior rectus. Here you have to write inferior oblique and this is superior oblique. Sir, superior oblique should be on the top, inferior. See, these muscles which I have written are not based upon the location. They are based upon the function. Okay. Now don't take this as an anatomical picture. Take this as a functional picture. Okay. Next. So you have written like this, superior, inferior. और उसका opposite inferior, superior. ये देखो, superior rectus, inferior rectus. उसका opposite क्या है? Inferior oblique, superior oblique. Done. Next. After that, what you do is, what you do is write here intorsion. Just remember one word, intorsion. Intorsion matlab inside, extortion matlab outside, like this. Intorsion का ऑपोजिट क्या होगा? एक्सटॉर्शन. फिर एक्सटॉर्शन का ऑपोजिट क्या होगा? फिर से इंटॉर्शन. फिर इंटॉर्शन का ऑपोजिट क्या होगा? फिर एक्सटॉर्शन. फिर एक्सटॉर्शन. ओके, एंड रिमेंबर वन थिंग, इफ यू आर लुकिंग अप, दिस इज एलिवेशन. If you are looking down, that is depression. If you remember this picture, I am telling you, many MCQs you can solve. Many MCQs. Why? Because let us look at this particular picture. If I ask you what is the function of superior rectus, what will you tell? Superior rectus function is one arrow is going up, so elevation. One arrow is going this side, that is called intorsion. If I ask function of superior oblique, what will you tell? One action is a depression, one is intorsion. If I ask you the function of inferior oblique, what will you tell? Elevation, extorsion. Clear? So if you remember this picture, many MCQs will be solved, many of them. Guys, is it clear to everyone? Yes or no? Jaldi batao. Oh, very good. Very good, very good, very good. Mantis, understood, very good. Crazy neurosurgeon, you're here. Neha and Shilpa Natua and RSR, Lydia. What about Sanyasi Pandit? Where are all of you? You just beach mein aake chalegi, right? Molamu, Sonam Azad, all of you are here. Suresh, Chandrasekhar Rao. Chalo. The next important thing we shall be discussing is the pharynx, guys. Okay. अब यहाँ पे देखो, what are the three types of pharynx you have got? ये देखो, ये nasopharynx हो गया, ये oropharynx हो गया, और ये laryngopharynx हो गया. Nasopharynx, oropharynx, and laryngopharynx. Okay. The same picture here down. Nasopharynx, oropharynx, laryngopharynx. Okay. So what is the big deal? Pharynx. This pharynx is having muscles. Same. Again, what are the muscles here? One is called as pharyngeal constrictors, another group are called as pharyngeal elevators. Okay, pharyngeal constrictors are nothing but the outside muscles, elevators are nothing but the inside muscles. Okay, so outside muscles are circular, inside muscles are longitudinal. Okay, so what are the pharyngeal constrictors? एक होगा superior constrictor, एक होगा middle constrictor, एक होगा inferior constrictor. You're clear with that, right? In the books it is given superior constrictor, middle constrictor, inferior constrictor. Okay, but if you want to learn little bit in detail, I will tell you what to learn, what not to learn. Here देखो, these are your pharyngeal muscles. These are your pharyngeal muscles over here. Okay, ये देखो, first three muscles over here are your superior constrictors. बीच में ये दो जो है, these are called your middle constrictors. Okay, and down over here, whatever muscles you see, this is called as your inferior constrictor muscle. Clear all of you? Right. So how do you need to remember all these names? Absolutely not needed. Okay. What you need to remember, I will tell you. See, superior constrictors, middle constrictors, and inferior constrictors. Superior constrictors, just remember the mnemonic PUBG mobile. Okay. All of you play this. I think now it is banned, right? So PUBG mobile, PUBG mobile. I think even I have this game. ये देखो, Battlegrounds. Right? Chalo. What is this? Superior constrictors. Superior constrictors, you have got four muscles. PUBG mobile. What is P? P stands for pterygopharyngeal part. B stands for buccopharyngeal part. M stands for myelopharyngeal part. G stands for glossopharyngeal part. Pterygo, bucco, myelo, glosso. Okay, all these together you comprise it as superior constrictors. Okay, middle constrictors no need to remember, inferior constrictors also no need to remember. If you want to remember this last muscle, that is cricopharyngeus. क्यों मैं बताता हूं अभी. Okay, so till here you are clear. So if you look over here, guys, if you look carefully over here, right, if you look very carefully over here, that can you see this particular muscle over here is called as your cricopharyngeus muscle. ठीक है, ये cricopharyngeus muscle के ऊपर do you have any muscle here? See, all this is coated with the muscle, all this is coated with the muscle, all this is coated with the muscle. ठीक है, but this part is empty, not coated with any muscle. Then what can happen? What can happen is that the membranes here can sometimes outpouch like this. The membranes here can sometimes outpouch like this. So this outpouching of membranes, outpouching of muscle, right? This weak area is called as Killian's triangle. This weak area is called Killian's triangle, and from Killian's triangle, what will happen? The structures will outpouch like this. When it will outpouch, this particular structure you call it as Jenker diverticulum. Very good, Mantis. Jenker diverticulum. Okay, so all of you just look at this particular part, you will understand it clearly over here. Okay, guys, all of you just see. ये क्या है? Inferior pharyngeal constrictor है, ठीक है? And what is this particular muscle? This is called as your cricopharyngeus. Can you see between the inferior constrictor muscle and cricopharyngeus, दोनों के बीच में से you see this balloon like swelling that has come out because that area is weak. So easily this aneurysm kind of thing will be formed. This is called as Jenker diverticulum. So outpouching of pharyngeal mucosa, right, and submucosa, that is called as Jenker diverticulum. Now in the exams they will ask you why this diverticulum is called as false diverticulum. ठीक है, true diverticulum मतलब क्या? If any diverticula, when you cut it, if it is having mucosa, submucosa, muscle layer, इसको बोलते हैं true diverticula. But यहाँ पे देखो, just look here, it is having only mucosa, submucosa. Muscle layer is not there. So this is called false diverticula. What is this called? Yes, it is called as a false diverticulum mantis. It is called false diverticulum. Okay. Right, just look at this. Within the esophageal region, you will have three diverticulas. ये देखो, this is called pharyngeal diverticula. This is called mid-esophageal diverticula. This is called epinephric diverticula. Out of all these diverticula, mid-esophageal diverticula is a true diverticula because it is having all the three layers. बाकी दोनों ऊपर और नीचे, they don't have all the three layers. That is why it is called false diverticula. ये देखो, there is no muscle layer. Okay, so I hope till here everyone is clear. Or is everyone clear with this? Right. Next important thing, guys, we are done with pharyngeal constrictors. Now let us discuss about pharyngeal elevators. Elevators are three. What are those three? So all of you remember it as PS, PS. Okay, PS, 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 PS. Okay. P is already here, pharyngeal elevators. S is stylopharynges. P is palatopharynges. Again S is sulpingopharynges. Okay, stylo-palato-sulpingo. Stylo-palato-sulpingo. All of you just look here. Everyone. ये देखो. What is this? This is your hard palate. और पीछे क्या होगा? Soft palate. ये देखो, from the soft palate, you see a muscle that is coming down to the pharynx. इसीलिए इसको palatopharynges बोलते हैं. This is why it's called as palatopharynges. Okay. So these are the muscles over here. And all the muscles of pharynx, are innervated by 10th pair of cranial nerve except stylopharyngeus muscle. Why? Because stylopharyngeus muscle is innervated by 9th pair of cranial nerve. The same exception there. All muscles of tongue except palatoglossus, you remember that, right? Hypoglossal nerve except this one that is innervated by 10th pair of cranial nerve, right? I'll have dinner. Thank you so much for your care. I'll have it, sure. Right. So this is the thing. Right. Next important thing is external carotid artery. When it comes to external carotid artery, internal carotid artery I am not discussing because internal carotid artery I will discuss the clinical part only. Okay. When it comes to the circle of Willis, you already practice in radiology also, you will practice it. Okay. So coming to external carotid artery, what are the branches? How do you remember this? So I have this, what is this? I have a video on external carotid artery where I explained clearly how to remember this entire picture. I have drawn the picture. While drawing itself I explained. Now I cannot draw because it is time taking, right? So what we shall do is that we shall just remember the names of these arteries. That is more than enough. Okay, that is more than enough. So what are the arteries over here? If you want a conceptual way, then it is better you go watch external carotid artery by Dr. Krishna. You will get the video. Okay. So what are the branches? If for exam purpose, knowing the branches is enough. So she always likes friends over papa, mama and sister. Okay, just remember that. Okay. She always likes friends over papa, mama and sister. What is she? S stands for superior thyroid artery. A stands for ascending pharyngeal artery. Okay. I don't have anything now. I have to order it. Again. I am the only one to go pick up the order. Chalo. And L here stands for lingual artery. F here stands for facial artery. O here stands for occipital artery, P here stands for posterior auricular, maxillary and superficial temporal. Okay? Now I am showing all these arteries on me. Just look here. Yeah, dekho. First, if this is the lateral surface of my face, okay? So external carotid artery will come like this, okay? So external carotid artery is going like this, going like this, going like this. Yeah, dekho. It is passing behind, in front of my ear and behind. कहाँ पे? Front of my ear and behind the mandible. यहाँ से एक branch जा रहा है देखो. This branch is called superficial temporal artery. Why it is important? Because if you put your finger here, you can feel the pulsations of this artery. That is called as your superficial temporal artery. हो गया एक artery. Next. From this external carotid artery, one branch goes behind the ear. You call it as what? Posterior auricular artery. हो गया? From this external carotid artery, one branch goes behind your head. This is called occipital artery. 3 branches are done. From this external carotid artery, one branch goes like this to the maxilla. So you call it as maxillary artery. Okay. Next, from this external carotid artery, one branch goes and enters into your face. Once it enters into your face, it will supply your eye, it will supply your nose, it will supply your lip, it will supply your mental process. Dekho, it will supply your eye, nose, lip, mental process. So this particular artery is called facial artery. From this external carotid, one enters to the tongue called lingual artery, one enters to your thyroid gland called as thyroid artery. Lingual artery and superior thyroid artery. Okay, and finally we have got the ascending pharyngeal artery. So these are the branches of external carotid artery. External carotid artery. Clear all of you? Right. So after, guys, are you clear with this? Are you clear with this external carotid artery? Yeah. Coming to this is maxillary artery. External artery का एक branch था ना maxillary artery. These are the branches of maxillary artery. Do you need to remember this? Question was not asked, but still, why to give a chance? Okay? When we are expecting many questions from this lecture which I am giving you today, why to take a chance? It is better we study these things. Okay? So, but anyways, I have a mnemonic for you. What is a mnemonic is? ये देखो, maxillary artery is divided into 3 parts. ये देखो, this red color part you see here, this red color part is the first part, blue color one is the second part, green color one is the third part. There are 3 parts of maxillary artery. Okay, ये देखो, first part, second part and third part. How do you remember? Remember it like this. See, let us say that a foreigner, okay, a foreigner, he came to India. Let us say he went to Madras, right? So he came to Madras. He actually he was invited to a marriage function. Okay, so in the marriage function itself, it is written that dance all the mornings in Madras. Okay, dance all the mornings in Madras. Now in that marriage function, he met many people. He even met the brides who are dancing. At the same time, there are some people who are singing. Some of them are singing in pairs and some of them are clicking beautiful pictures and posting it. Okay. So how do you tell this? I mean, this mnemonic itself is a difficult thing, but still, mnemonic याद रखने के लिए another mnemonic you can't frame it. Okay. So better remember this mnemonic only. Dance all mornings in Madras, and this man met brides dancing, singing in pairs, posting decent pictures. Okay, so the numbers are given. 1, D for deep auricular artery. D for I will sleep. Why today everyone is scaring me a lot? I don't understand. I will sleep definitely. I'll sleep. Definitely I'll sleep. I think I have to go to hospital in the night. I have a case. So most probably after that, in the midnight like that, if I get time, I'll sleep. Chalo, so the things are, what is this? See, dance is 1. 1 is what? This deep auricular artery, okay? All mornings 2. 2 is what? Anterior tympanic artery. So guys, just I can't tell you like this. Even if I tell, there is nothing, because you just have to mug it up these things, okay? You just have to mug these things up. So 3 or 4 times, rather than remembering all these 17 arteries without a mnemonic, it is difficult. Something I have provided, so better make use of it. Okay. So these are the arteries now. The most important topic which you would see is triangles of neck. What they ask you is, they will point at a triangle and ask you what are the contents of the triangle, what are the borders of the triangle. Very neatly we shall frame up each and everything. Okay. Coming to the triangles of neck are divided into 2 parts. What are those 2 parts? Ye dekho. This is the midline. What is this? This is your midline here. Okay. This is your midline. Okay. And here you have got your sternocleidomastoid. Yaad hai na? This is your sternocleidomastoid. And here you have got a triangle. The place where I am putting my finger over here, this is your triangle. Okay. Ye dekho. Midline. See, one is midline. One is sternocleidomastoid. One is lower angle of mandible. Can you see a triangle here? Right? This triangle over here is called anterior triangle. Sternocleidomastoid ke piche jo triangle hai, that is called as your posterior triangle. Okay. So you have got anterior triangle of neck and posterior triangle of neck. So all of you look here now. Ye dekho. This entire triangle. Ye dekho. This entire triangle over here is called anterior triangle of neck. Or is anterior triangle mein, how many triangles are there? A, B, C, D. There are 4 other triangles which are located within this. Okay. So let us discuss one by one. All of you look here. Anterior triangle of neck. Anterior, superior, inferolateral. Anteriorly, what do you have? Ye dekho. Anteriorly, what do I have? Anteriorly, I have got the midline of your neck. Okay. Next, superiorly, what do I have? Inferior border of mandible. Ye dekho. Superiorly, what do I have? I have got inferior border of mandible. Next, inferolaterally, what do I have? I have got sternocleidomastoid. Ye dekho. Inferolaterally, what do I have got? Sternocleidomastoid. Is it clear to all of you guys? So, midline, inferior border of mandible, inferolaterally sternocleidomastoid. This forms your anterior triangle of your neck. This forms your anterior triangle of your neck. This forms your anterior triangle of your neck. Okay. Right. So this is done. Coming to the next thing, that is submandibular triangle. Guys, yahan pe dekho, all of you just look here. What is this triangle below the mandible? Submandibular triangle. Or ye dekho, what is this triangle beneath the mental process? Ye mental process hai na? Mental process ke niche ye triangle ka naam kya hai? Submental triangle. Okay. And what is this particular triangle over here where carotid artery will pass? This is called carotid triangle. And what is this particular triangle over here? This is called as your muscular triangle. So what are the triangles? एक हो गया submandibular triangle और एक हो गया submental triangle, and this one over here is your carotid triangle, and this one over here is your, what is this? Muscular triangle, right? So first let us look at submandibular triangle. So submandibular triangle ye, what are the borders of submandibular triangle? You have got mandible, you have got anterior belly of omohyoid, you have got posterior belly of omohyoid. Done. Very easy, right? Let us look at what is this? Submental triangle. What do you have? Midline of the neck, ठीक है? नीचे क्या है? Hyoid bone, और ऊपर क्या है? Anterior belly of digastric. Clear? When it comes to carotid triangle, what are the structures? ऊपर क्या है? What is this? Posterior belly of digastric. Here you have got superior belly of omohyoid, and this is called as your sternocleidomastoid muscle. हो गया, right? What do you mean by muscular triangle? Muscular triangle is a little bit tricky. Why it is tricky? I will tell you now. All of you look here. Muscular triangle is having superior, medial, supralateral, infralateral. All of you look at this. It is having superior, it is having medial, ठीक है? और ये हो गया supralateral, ये हो गया infralateral. Okay? Superiorly, what do you have? Superiorly, you have got the hyoid bone. Medially, what do you have? Midline of the neck. Superolaterally, what do you have? Superior belly of omohyoid. Infralaterally, what do you have? The distal part of sternocleidomastoid. Guys, see, the text might be too lengthy here. Okay, the text over here, whatever I have mentioned over here, might be too lengthy. But what I'm telling you is that abhi tak maine jo bhi bataya tha, right? Everything based on this picture. So that's what I'm telling you. If you can imagine this picture in the exam hall, right, by looking at this picture again and again while practicing, right, definitely I'm telling you, it will be very easy. Instead of imagining the picture, just imagine the picture on your body so that it will be very easy for you to understand these structures. And coming to contents क्या ही बोलना है guys? See, contents, you just have to study these contents. What are the contents that are located in each and everything? Okay, so these are the things which you have to know. Right. Muscular quadrangle. Triangle hai actually, but it is looking like a quadrangle, but it is called as a triangle. What to do? Right. So guys, I'm leaving this posterior triangle for you. It is also very simple. Ye dekho, all of you see. Ye dekho, this particular triangle which you can see over here. है ना? ये देखो. Just a second. Let me use another. Right. See, all of you. You see a triangle over here. This triangle over here is called as your posterior triangle. Posterior triangle is again divided into two. ये देखो, omohyoid muscle है ना? Omohyoid muscle के ऊपर जो है, this is called as a superior triangle. Omohyoid muscle के नीचे, this is called as a inferior triangle. Actually, not superior, inferior. You call it as upper triangle, lower triangle. Upper triangle above the omohyoid is called occipital triangle. Lower triangle is called as supraclavicular or subclavian triangle. And these borders, just look at the picture in the PDF and study these borders. Yahan pe bhi same things, and contents are here always. Okay, so these are the things. And yeah, by the way, this thing you have to know, guys. However, this thing will be taught in your ENT. Okay, but fir bhi I wanted to teach you. I'm just teaching you here. What is epistaxis or little area or kissel back plexus? So there are four or five different arteries. They are joining together from top and below, joining together. Joining together to form anastomosis. This anastomosis over here is called as kissel back area or little's area. Okay. So what are these arteries? All of you remember. Remember the mnemonic gaps. Greater palatine, anterior ethmoidal, posterior ethmoidal, septal branch and sphenopalatine artery. All these four arteries, they join together to form an anastomosis. This anastomosis is called as kissel back plexus. Okay, this is the basic question that is asked, but in detail agar question पूछना है, what will they ask? No. Internal carotid artery है ना? Internal carotid artery will give a branch called ophthalmic artery. Ophthalmic artery will give two branches, anterior ethmoidal, posterior ethmoidal. ये देखो. Second, external carotid artery will give facial artery, maxillary artery. Facial will give superior labial. Superior labial will give septal, and that septal will take part in the formation of plexus. And yahan pe bhi maxillary artery giving rise to two. Greater palatine, sphenopalatine. Again, both of them, they will take part. Okay. But main four branches are these: anterior, posterior, septal, greater palatine, sphenopalatine, which mnemonic I have given it to you, that is gaps. Okay. So these are the arteries over here. There are two types of epistaxis, guys. Anterior epistaxis, posterior epistaxis. Anterior epistaxis में ना blood will come from the nostrils, which is not dangerous. अभी मैंने जो explain किया आप लोगों को, this is called anterior epistaxis. Posterior epistaxis मतलब it will happen little bit behind, which you need not to know, but that is very dangerous. क्योंकि if there is a bleeding over here, the blood will directly enter into your throat. From there, it can be aspirated to your lungs, and patient might die of aspiration pneumonia. So always and always remember, out of two epistaxis, which epistaxis is very dangerous? Posterior epistaxis. Okay, posterior epistaxis. Right, guys? So let us take just 5 minutes break, and then we shall finish up neuroanatomy. Neuroanatomy, very few concepts of neuroanatomy are left. I think maximum 10 to 15 minutes we shall finish up neuroanatomy. No, mantis, posterior ethmoidal, don't take part in Clisel. No, no, no. Yeah. Okay. 5 minutes. Just 5 minutes. Just 5 minutes, and then I will start. Hello guys, welcome back. So we shall start with the neuroanatomy. We shall very fastly finish. Just 17 slides are there here. 17, not 70. It is 17. So very fastly we shall finish up the neuroanatomy over here. Okay. So all of you are with me, right? All of you are with me, energetic, or you are tired? Slept? Everyone is slept? Starting 70 members were there. Abhi 17 आ गया. So most of you have decided, अच्छा ठीक है बाद में देख लेंगे इसको, है ना? The video won't go anywhere. It will be there. What if video gets deleted? And what if I told you? That's it. Right, Google Boss is here. RSR. No, don't worry. Video can never ever be deleted. Okay, don't worry about that. Mantis is here. Mantis, Sneha, Shalvi, Doc Rekis, Molamo is here. Molamo. Everyone is here. Right, chalo, let us discuss the remaining part of the neuroanatomy, guys. As you can see over here, so if you look here within the neural tube, right, we have got two important openings. So one is called as the anterior neuros. You see this opening over here? This is called anterior neuropore. Or पीछे जो opening है, what is this called? Posterior neuropore. Now normally what you need to know is that anterior neuropore usually in you and me, it will close by day 25. Guys, ये part बहुत important है. They have asked last to last FMGe, they have asked this. Okay, anterior neuropore will close by day 25. अगर close नहीं हुआ, that would lead to anencephaly. Anencephaly is absence of the brain. Okay, absence of part of the cranium. Okay, that is anencephaly. Okay, so all of you just look at this. This is a condition of anencephaly where there is no brain. The brain is absent here. Part of the brain is not developed. Okay, anencephaly. So when should the anterior neuropore close? Usually by day 25. In the same way, posterior neuropore should close by day 28. Agar close nahi hua, then that would lead to a condition called spina bifida. What is that? That would lead to a condition called as spina bifida. That is the reason why pregnant women, right? Pregnant women, to prevent this neural tube defects, what do they basically do is that, for example, a couple come to you and they haven't planned for pregnancy. Okay, they are about to plan, but they haven't planned right now for pregnancy. So if they haven't planned for a pregnancy, but still you should start giving them folic acid. Why? Because all these neural tube defects are mainly happening because of folic acid deficiency, right? Vitamin B9, folate deficiency. So how much you should give? 400 to 800 micrograms per day. But once the pregnancy is planned, then daily you have to take around 4 mg per day of what? Of this folate. Okay, so this is one of the very important thing in your OBGY. Okay, right. I hope till here you are clear. Next important thing is, I told you, agar posterior neuropore close nahi hua, that would lead to a condition called as what? Spina bifida. So if you look at spina bifida, how many types of spina bifida are there? There are 4 different types of spina bifida. One is called spina bifida occulta. One is called as spina bifida with meningocele, spina bifida with meningomyelocele, and rachis. And you know, last to last FMGe, they have asked about rachis only. Rachis ka question पूछा था. Okay, so spina bifida occulta. But before that, first we shall discuss about rachis. Rachis क्या होगा? This is open vertebra, guys. See, normally the vertebral arches, they come like this and they join together and form the spine of the vertebra, right? Agar ye vertebral arches ठीक से close नहीं हुआ, if they didn't close properly, right, the vertebra is open मतलब अंदर जो the inside whatever spinal cord is there, that is also open. Meninges are also opened. So what is rachis-kyssis? Rachis-kyssis is nothing but patient having open vertebra, open spinal cord. Agar spinal cord is opened, then don't you think leakage of CSF will happen? Yes, there is leakage of CSF. Can you see this? All this shininess. What is this shininess? Shininess kya hai? What is this? This is all the CSF that has been leaked. Okay. So this condition you call it as rachis-kyssis. Keep this thing in mind. Rachis-kyssis. Next, see, this was a concept I was telling you. These are the arches which are not closed. When it is not closed, what will happen? The spinal cord will protrude outside. Okay. Now, guys, basic thing you remember. This is spinal cord. Okay. This is spinal cord. Yeah, this is spinal cord. Surrounding the spinal cord, you have got meninges. Sometimes what will happen? Only meninges will protrude out. Okay, sometimes only meninges will protrude out. Sometimes meninges along with spinal cord also will protrude out. Okay, what I'm trying to explain you is just look at this. Just look at this part. This is a normal patient. Okay, normal patient. Just look at this. In this patient, what has happened? Center mein jo hai, this is your spinal cord. Surrounding that, what is this? All CSF. You see, only the green color, only the meninges have been protruded out. If only meninges will protrude out, this condition you call it as spina bifida with meningocele. What is this? Spina bifida with meningocele. If spinal cord and meninges, both of them are protruded out, this is called as spina bifida with meningomyelocele. Myelo matlab kya? Spinal cord, right? Meningomyelocele. Keep this thing in mind, guys. Keep this thing in mind. Hi, Caroline, I'm back. Yeah. Keep this thing in mind. Okay. So all of you just look at this. Here there is swelling. Here also there is a swelling. And here also there is a swelling. Now what should I think of these swellings, guys? So this swelling is shiny. Yes or no? Isn't it shiny? Right? But tell me, is this swelling a shiny swelling? No. Why? Why is this swelling shiny? Because this swelling is covered only with meninges, no spinal cord. And this is the CSF inside which is shiny. Okay. Now look at this. Here it is not shiny, which means both spinal cord and meninges, both of them are protruded out. This is how you identify whether it is a meningocele or whether it is a myelomeningocele. Is it clear? No, you are right. You answered right, Sneha. You answered perfectly right. Right. So, meningocele as well as the myelomeningocele. So, I hope you understood this. Everything is clear. Then what is this, sir? What is this? What is this? Is that you take a balloon, you add more. You take a balloon. After taking a balloon, you add more water into it. If the pressure inside is increased, don't you think the balloon will burst out? The same thing has happened. It is completely filled with fluid and the fluid bursted out. This is called as a ruptured meningocele. Okay, ruptured meningocele. But still, ruptured meningocele is also shiny. You see, ruptured meningocele is also shiny. So, meningocele is nothing but cyst with glow or shininess. It is not shiny, it is myelomeningocele. I will also show you some pictures which I have taken in our hospital. My brother is a neurosurgeon, so I have asked him for some pictures. Yeah, here they go. This is myelomeningocele. You see, this is a myelomeningocele case which he has done. You see, they have removed it completely. Here they go. And they have closed your meninges and all. Okay, this is the case. This is a myelomeningocele. Okay, here all of you. So if they give such picture and ask you, will you be able to answer yes or no? I'm sure you will be able to answer. Okay, chalo. Coming to this next big picture over here. What is this big picture over here? Nothing to confuse. Very, very easy picture. What is this? These are your ventricles. What are they? They are the ventricles of your brain. Okay. They are the ventricles of your brain. So, the outermost layer which you can see over here is called as dura mater. After dura mater, this pink color layer which you can see over here is called as arachnoid mater. Uske niche this layer which you can see over here is called as pia mater. Okay. Ventricles are there. How CSF is released and how does it flow, we will discuss now. Okay. Now, all of you pay attention. All of you pay attention to this, okay? So just look at this. See, these are your ventricles. These are your ventricles. Now attached to the roof of the ventricle, you have got some finger-like projections called as choroid plexus. From this choroid plexus only, your CSF is released like this. ये देखो, CSF is released. ठीक है, CSF तो release हुआ. Now this CSF has to move. How will it move? Do you see some ependymal cells with cilia like this? These ependymal cells with cilia, they are, what are they doing? They are continuously doing this movement, right? The ciliary movement, with the help of which this particular CSF will start moving. So from the lateral ventricles, the CSF will enter into your third ventricle. But how will it enter? It will enter through a foramen called as foramen of Monro. Okay? With the help of foramen of Monro, it will enter here. Enter हो गया. Enter होने के बाद, within the third ventricle, this is your third ventricle. Within your third ventricle also, you have got choroid plexus. From here also some extra amount of CSF is released. Again this CSF will flow down all the way through a opening here. This is called as aqueduct of Sylvius. Okay, aqueduct of Sylvius. So from this aqueduct of Sylvius, the CSF has entered into the fourth ventricle. Now in the fourth ventricle also there are choroid plexus. Again some extra CSF is released. So all the CSF, where it will go? Some of the CSF will go down into the spinal cord, but some of the CSF with the help of this foramen, you see, foramen of Lashka, right? With the help of this foramen of Lashka, this CSF, you see, it is entering into your subarachnoid space. Okay, that is the reason why subarachnoid space is having CSF. Now CSF in the subarachnoid space will travel all the way up like this. You see, CSF is traveling all the way up in the subarachnoid space, and subarachnoid space is also having some finger-like projections. These finger-like projections of subarachnoid space are called as arachnoid granulations, or simply you can call it as subarachnoid granulations. Subarachnoid granulations. So with the help of this subarachnoid granulations, CSF finally it enters into what? CSF finally it enters into this dural venous sinus. Okay, it enters into your dural venous sinus. So this is your dural venous sinus. From here it enters into your superior sagittal sinus. So all of you just look here. क्या हुआ था? From the lateral ventricles 1, 2, they entered through foramen of Monro into third ventricle. From here entered into the fourth ventricle through aqueduct of Sylvius. From the fourth ventricle with the help of foramen of Lashka and Magendie, there is another foramen. Fourth ventricle may, you can't see this foramen actually like this. There is another foramen here. This is called foramen of Magendie. They entered into subarachnoid space. From there they entered into subarachnoid granulations. From the granulations the CSF drained into dural venous sinus. वहां से कहाँ जाएगा? To superior sagittal sinus. Is it clear to everyone? Is it clear to everyone? Very good. Okay. Now there is a very important thing which will be asked in pediatrics, that is hydrocephalus. What is hydrocephalus? If there is excess accumulation of CSF within your ventricles, this condition you call it as hydrocephalus. Guys, there are two ways how the CSF can be accumulated. First, one way I am telling you. One way is if this choroid plexus secretes the CSF lots and lots, okay? If lots and lots of CSF uncontrollably, if it is getting secreted, in that condition also the within the ventricles, what is happening? The CSF is increasing, the pressure within the ventricles is also increasing, right? Now, this condition is called as communicating hydrocephalus. Okay? Why are you calling it as communicating? You will understand when I tell what is non-communicating. For example, let us say patient is having some kind of obstruction here. अभी यहाँ पे obstruction हुआ. But CSF release from the choroid plexus is normal. Even though it is normal release, tell me, can this CSF cross this obstruction and enter into the third ventricle? No. तो क्या होगा? CSF तो release हो रहा है, it is released from the choroid plexus, it keeps on accumulating here and slowly the ventricles will dilate. Now tell me, in this condition, the first ventricle, second ventricle, Are they interacting with the third ventricle? Batao? No. So can I call it as communicating or non-communicating hydrocephalus? This is called non-communicating hydrocephalus. Okay. All of you just look at this. Two types of hydrocephalus: non-communicating, communicating. Non-communicating is congenital, where there is obstruction to the ventricles. There is some kind of mass or a tumor, let us say tumor of ependymal cells, ependymoma. Okay, that condition. Communicating hydrocephalus is excess amount of CSF production. Clear? So this is your hydrocephalus. Okay. So these are your normal ventricles. Can you see the normal ventricles which will be asked in radiology? ये देखो यहाँ पे दिख रहे हैं ना normal ventricles with CSF within that. Yes or no? And if you come down all the way, do you see the ventricles are enlarged? Yes or no? Not SAH. Shall we? This is not SAH. This is just ventriculomegaly. Okay, ventriculomegaly, where the ventricles are enlarged here. यहाँ पे भी देखो ventricles are enlarged. Okay, right. Second important thing we shall be discussing is subarachnoid cisterns. Guys, when I was discussing pleural recess, क्या बोला था? Parietal pleura, visceral pleura. At some places, the pleural cavity is separated from each other. That place there is a gap called recess. In the same way, subarachnoid space also, at some places it is enlarged. That is called as subarachnoid cisterns. For example, ये देखो, this violet color layer over here is your arachnoid matter. Arachnoid matter के अंदर, what is this space over here? Subarachnoid space. Can you see at some places, you see subarachnoid space is leaving some gaps. ये देखो, यहाँ पे भी gap, and ये देखो, यहाँ पे भी gap, और यहाँ पे भी gap. What are these gaps called as? These gaps of subarachnoid cisterns are gaps called as subarachnoid cisterns. Okay. What are these? First, this particular one which is located behind, right, behind your midbrain is called as cisterna ambiens or quadrageminal cistern or superior cistern. Next, you see this cistern over here, this is called as interpeduncular cistern. Next, there is a cistern in front of pons. All of you know that this is your pons. This is your pons. Pons ke front mein there is a cistern called as cisterna pontis. What is this? This is called as cisterna pontis. Okay, this is called as cisterna pontis. Next, here you have got another cistern where there is foramen magnum. ये देखो यहाँ पे ये foramen magnum है ना. This is called cisterna magna. Cisterna magna. Clear? Very good. Now let us discuss about each cistern, and again I am telling you exactly study the way I am teaching you. Okay, first cistern we shall select is cisterna magna. Okay, so how do you remember this? Let us say cistern matlab sisters. Okay, there are three sisters. One sister is studying in the 9th class, one sister is studying in the 10th class, and one sister is studying in the 11th class. Okay, and all these three sisters are very, very practical girls. These three are very practical girls. So how do you remember this now? So yes, cistern ke andar what are the contents? What are the contents of this cisterna magna? Contents of this cisterna magna are three sisters studying 9th, 10th, 11th. 9th is your glossopharyngeal, vagus and accessory nerve. These are the three contents, and very practical matlab vertebral artery, posterior inferior cerebellar artery. These are the 5 important structures that are present within your, what is this? That are present within your cisterna magna. That are present within your cisterna magna. Is it clear to all of you? Right? And you know, out of all these cisterns, which is the largest? Magna is the largest word. Where is magna? Magna is here. Matlab ye wala cistern is the largest cistern. Okay. Next cistern we shall discuss is cisterna pontis. Cisterna pontis. Cisterna pontis. Guys, remember this thing. There are 6 friends who went to a pontis. Pontis matlab pond. Who went to a pond, open pond. Okay. Now, out of these 6 friends, they wanted to dive into the pond. They wanted to enjoy it. Okay. But still, you should make sure that there are no snakes in that. no other frogs in that, no other insects in that, or all of this, right? How is the water, right? Everything, the hygienic standards you have to make sure. How will you make sure? First thing, you go to the pond. These 6 friends went to the pond. They just look. The first thing is that you look at the water. Okay, from the above, from the top, you look at the water. Now, one guy, what he did, he went to the other side of the pond. That is called as the anterior side of the pond. There also, he started looking at the water. And another guy, what he did, he is a really dare dasher. Okay, he jumped into the water and checked whether everything is perfect within the water or no. So, what are these 6 friends done? One guy, he went above the pond. I mean, looking the pond from above. Another one, front, anterior. Another one entered into the water deep. Okay, below. So, above is superior cerebellar artery. Anterior is anterior inferior cerebellar artery. Below, B stands for basilar artery. Okay, and who are the 6 friends? 6 is what? Abducent nerve. So, all of these, where are they located? They are located in your cisterna pontis, in front of your pons. The cistern that is located in front of your pons. Clear, all of you? Right. Next important cistern is interpeduncular cistern. कहाँ पे discuss किया interpeduncular? Yeah, this one. Interpeduncular cistern. Okay. Interpeduncular cistern is having what? Circle of Willis. Next, cisterna ambiens. Cisterna ambiens मतलब this one, right? Cisterna ambiens or quadrageminal cistern. What is it having? It is having great cerebral vein or vein of Galen. This is all you need to remember. Okay. Guys, are you all clear about subarachnoid cisterns? Jaldi batao, yes or no? Yeah, very good. Next important thing is, guys, from here, from this topic, I don't know how you will learn this topic, but this hemorrhages, extra cerebral hemorrhage, whatever are there, from these hemorrhages, you will get questions in anatomy, you will get questions in radiology, you will get questions in surgery, you will get questions in medicine also. From these 4 subjects, you will get questions. So, definitely every year one question, if it will not come, just go once the exam is done, come back, comment down that whatever question you told that hasn't come. I am telling you right now, 100% one question will come from these hemorrhages. Pakka one question will come from these hemorrhages. Listen to this very carefully. Okay, so what is this? This is your brain. This is your brain. And this is your skull cap. The outside one which you have over here is your skull cap. Okay. And this is your dura mater, arachnoid mater, pia mater. Dura mater ke bahar, outside the dura mater, the space is called extradural space. Below the dura mater, the space is called subdural space. Okay. Outside is called extradural space. Below is called subdural space. Next, look at the extradural space. Extradural space is having an artery called middle meningeal artery. If this middle meningeal artery will rupture, what will happen? Let us say I'm driving a bike, I fell down, I met with an accident, I fell down. So what has happened? My middle meningeal artery has ruptured. What will happen? I will go unconscious for a brief amount of time. Again, I'll get up, right? I'll go to the hospital, right? Again, I'll go unconscious. Again, after that, again, I'll get up, right? Again, I'll talk to the doctor. You see that between two periods of consciousness or unconsciousness, there is a brief period of consciousness or unconsciousness. Okay, you go unconscious, again you get up, you go unconscious, you become conscious again. So this interval is called as lucid interval. What is this called as? Lucid interval. And this hematoma is called EDH. What is that? Extradural hematoma. Extradural hematoma. Next important thing, dura mater ke niche, what is that you called as? Subdural hematoma. Subdural hematoma, what veins do you have? Bridging veins. And these veins are ruptured when most commonly this subdural hematoma you see in elderly patients who are on anticoagulants like varofin. Okay, if these patients are prone to a fall, then they will have subdural hematoma, and this is not that serious also. Okay, the next important thing is arachnoid matter. Beneath the arachnoid matter, what is this space? Subarachnoid space. Or subarachnoid space ke andar what do you have? You have got CSF within this. Within the CSF, what do you have, guys? Within the CSF, you have got circle of Willis. Yaad hai na, circle of Willis? You have got circle of Willis there. Okay. Now, because of hypertension, and there are vessel disorders. Vessel disorders, pata kya? In some of the disorders, the collagen is not properly released. The collagen is not properly formed. For example, conditions like Ehlers-Danlos syndrome, conditions like Turner syndrome, in these patients, what will happen is that these blood vessels are more prone to rupture. So that is why you have seen any patient with high BP having paralysis. Why? It is because of this circle of Willis getting ruptured. So what will happen? What will happen is that within that CSF, if the blood vessel rupture, all the blood will enter into that CSF. Previously, CSF was transparent. Now you take a lumbar puncture sample. Within that lumbar puncture, you see a red color CSF, which indicates what? Which indicates most important pathology, that is called as subarachnoid hemorrhage. And always remember, yeah, very good. I should also mention one more thing, Marfan syndrome. Very good. Mantis, very good. Marfan syndrome. Marfan syndrome, right? In this, you know, how will the patient complain? Patient will complain of a thunderclap headache. Patient will complain that he will tell doctor, I never ever got such headache in my life. Okay, very severe intense headache, as if someone has took a bat and banged you on your head. That severe headache patient will have. Okay, so what are the questions? In the questions you see thunderclap headache, most severe headache and all. So these are the three important things. Extradural hemorrhage, what vessel is damaged? Middle meningeal artery. Subdural hemorrhage, bridging veins. Subarachnoid hemorrhage, what is that? Circle of Willis. Okay. And if in CT scans also, I don't have CT scans, I think, but if it is extradural hemorrhage, E stands for extradural hemorrhage, E stands for egg. If you see a egg-shaped structure in the CT scan, that is extradural hemorrhage. Subdural hemorrhage, SDH. S, you can convert it as C, right? C, or half moon shape. If you see a half moon shape, that is subdural hemorrhage. Okay. So these things will be useful for your radiology point of view. And again, I'm telling you, definitely they might ask you a question. Okay. So the last topic of today's we shall be discussing over here is what are the structures that are present in the base of your brain. So this is just a memory part, guys. Just look at this picture and then find it out. What are these structures? Not that difficult also. You see this? These are your olfactory bulbs. Olfactory bulb ke niche ye jo hai na, these are called as your olfactory tract. These are your olfactory tracts. Okay. The structures which are crossing like this is called optic chiasma. And down here you see two small bodies over here. Ye dekho, small bodies, peanut like bodies, right? This is called as your mammillary bodies. Okay. And you know, this is your midbrain over here, and this is your medulla oblongata and spinal cord. Guys, do you remember this thing? Do you remember that I have told you two vertebral arteries join together to form basilar artery? Ye dekho. This is one vertebral artery, this is one vertebral artery. You see, both of these vertebral arteries are joining together like this and form this artery called as basilar artery. Anyways, if you remember that circle of Willis and all, it will be clear. And additionally, apart from this rapid revision which we have done today, I have done an anatomy image based questions, right? A special video on image based questions. Just find it in this channel itself. There you will have all the images in the entire anatomy. All the images I have covered there. I think the session lasted about 1-2 hours or something like that. I don't remember, right? So long back I've taken it, but still we have covered as much as possible, guys. And I'm pretty sure that most of the questions, like last time, better than last time, rapid revision, most of the questions will be covered from this part. Okay. So guys, I the same channel which you are watching right now, okay, Dr. G. Banu Prakash animated video. So in this itself you'll find, okay. And by the way, I just want you to know 15 members are there at the end. I just want you to know I'm not tired, I'm still energetic, you know. So I just want you to know, are you satisfied with the content which I've delivered today? Just tell me honestly, whatever it might be. Yes, I'm watching your comments. Yeah. Right. So thank you so much. Thank you so much, guys. And it 25, the continuous strength maintained was 50 to 70. But at the end, I know, even I understand it might be tiresome for you. And anyways, this video is there in the YouTube itself. Anytime you want, you can watch it. But I would suggest you watch at 1.5x speed, okay? So that you don't shout at me, you don't get serious on me. TK, fine. So this is it. Now it's time for me to take rest, I think, right? So, and by the way, again, I'm telling you, 2 videos which you should must watch. One is image based questions, anatomy, and the second thing which you should watch is, one is image based questions and another one is important topics. I've just written down all the important topics from all the subjects. Just go be perfect with those topics before you go to the exam, okay? So this is all I want to tell you. So signing off, Dr. Krishna, and goodbye, take care, and love you all. All the best.